So, good morning everyone and welcome to the NHS Change Day Celebration. So the idea this morning is, the idea of the whole day is to take, what we did on Change Day, 3rd of March 2014, and celebrate the actions that have happened since. So we're a small and discreet band to start with, and it's just fantastic looking at the chat in terms of where people are today. And it's really great. We've got Lisa with us from San Francisco, where it's midnight. That's really brilliant. And then other colleagues from all over England. So my name's Helen Bevan, and I'm going to be chairing quite a lot of today between 8 a.m. and 8 p.m. English time. And so let's get going. So let's start off by talking a little bit about NHS Change Day. So the purpose of Change Day is to bring together people from right across the system. So people that work in the NHS, that work in the wider health and care system, and people that use the NHS and the health and care system, and also our partners all over the country. And the idea was for everybody to pledge to take an action on that day that will make a difference. And many of the actions for NHS Change Day are very small actions, but when we add all of them together, then it makes a huge difference. Now, I want to start off by acknowledging our very marvellous group of colleagues who are called the Hubbies. And the reason they're called the Hubbies is because they're the hub facilitators. They're a band of people across the country, clinical trainees, students, managers, patient representatives. And the Hubbies, if you like, are the beating heart of Change Day. They're a group of very passionate people who are volunteers, who coordinate all the actions and activities. When you think we got over 700,000 pledges this year for Change Day. So much of that was because of this amazing band of volunteers behind the scenes who made it happen. Now, Change Day was about pledging for change, which is a great thing, but a pledge is only a promise. It's only an aspiration of making change. And in a sense, pledges only mean so much. And really, the key is to turn our pledge into an action that really makes a difference for patients and colleagues. So the reason that we wanted to have the celebration day today is to actually give us a kind of focus for taking action, and also to celebrate all the actions that have happened as a result of Change Day. And there are so many amazing stories around the country. And actually on this jam, we're calling it today, this kind of virtual meeting that we're having across the day, we're going to actually connect with, hear from nearly 50 people. So we've got the people that are actually giving presentations as part of the day. But what we've also got is many people who are taking part on the WebEx meeting today, and we'd like to hear your stories and your comments too. So we hope that even if you're not somebody who is making a kind of formal presentation with some slides, that you'll tell us in the chat room about what you've been doing as a result of Change Day. So the aims of today, over the next 12 hours, first of all, is to celebrate the thousands of actions and achievements that have happened as a result of Change Day, of people actioning their pledges. The second aim is to be a catalyst for action. So, we thought that by actually having a celebration day, what that would enable us to do is to kind of be a focus, to kind of remind people to action their pledges. So I had 3 pledges for Change Day, and I've actioned 2 of them, and 1 of them I haven't. And actually, because I knew that the celebration day was happening, it's made me action my 3rd one. It's kind of given me a nudge, and I hope that might happen And thirdly, we want to capture all the learning and successes. And you know, people say quite often, well, what difference did NHS Change Day make? And because, you know, Change Day is about people making their own unique pledges, it's very hard to say, well, this was the return on investment of all the voluntary time that people put into Change Day, or this is the quantified outcomes of Change Day. You know, it's really hard to be able to do that. But what we can do, and I think what today shows, is just, you know, so many amazing successes and achievements and so much learning. And what we also want to do is we're thinking about Change Day 2015. You know, actually today, what can we learn that will help us to plan Change Day 2015 to be even more successful and impactful? And then finally, we want to create some social capital. And what we mean by that is about, you know, the lasting legacy of Change Day. So it's, you know, what can we learn? How can we change the value of or translate the value of Change Day into something that makes a lasting difference for patients and people that use the NHS across the country. So yeah, today is all about sharing our stories, what happened as a result of the pledges that we made for NHS Change Day. So yeah, please feel free to come on and off the WebEx link throughout the day. It'll be interesting to see how many of the, I think there's about 20 of us, when we look at the panelists and we look at the attendees that actually started this morning, how many of us will still be there at 8 p.m. tonight. Yeah, please feel free to just come and go when you can, and to pick the stories that you'd like to hear. We have really got a fantastic lineup of people throughout the day. What we're also going to be doing is launching a new white paper that's been published by NHS Improving Quality, which is called The New Era of Thinking and Practice in Change and Transformation. And what this is about is taking from all across the world much of the latest thinking about what's happening with regard to change and transformation, and we're translating that for our health and care context. And it will be possible to get a copy of that paper when it's launched later on today. And one of the things that's great about that paper is actually Change Day, and particularly the Hubbies network, are featured as a case study in that white paper. And then at 4 o'clock, we're very excited, and we're going to conduct our virtual graduation. So as part of Change Day 2014, we set up a school, and the school is called the School for Health and Care Radicals. What we found from the first Change Day in 2013 was that the biggest issue that was stopping colleagues making even small changes in their organisations was a sense that they didn't have permission. You know, people felt, oh, I haven't got permission to make changes to my services, or I'm a patient leader, you know, I haven't got any, you know, I can't make a change, and I haven't got permission from the system. So the idea was to set up this school for health and care radicals, so that, you know, we could learn together how to rock the boat, but not fall out of it, how to stay in it. So what was great was that a whole number of people, well over 100 people, actually followed the whole process through and did follow-up work where they actioned their pledges for Change Day and were able to demonstrate the learning from the School for Health and Care Radicals. And they are going to be graduating at 4 o'clock this afternoon UK time. So please, if you can, come and be part of the graduation and toast our graduates. So in terms of today, the first thing is that if you've actioned your pledge, will you go back onto the website for Change Day, and the address is there, and will you press the do button? So what that basically is doing is helping us to understand, you know, the action that you've taken as a result of the pledge. So you just log in, find your pledge, and then press the do button. Secondly, can you spread the word today? So can you share it on social media? Can you tweet? Can you write a blog? Can you put something in your own staff bulletin locally about the action that you've taken? And please let us know what you did as a result of today. And again, if you can send it to us at changeday@nhsiq.nhs.uk, we'd love to hear about what you're doing, and we will promote it further. So, you know, take part in the jam today, as much or as little as you want. And then also, please tweet about your experience today. So we're using the hashtag NHS Change Day, or normal usual hashtag. So yeah, just please tweet out. And with us, we've got two colleagues. We've got our colleague Pip, who's watching Twitter. And what we're going to do every few minutes is we're going to ask Pip to tell us what's happening on Twitter. And also Rosanna is keeping an eye on the chat box, and she'll feedback what's happening with that. So just to stop there. So let's hear from you. So first of all, Pip and Rosanna, what's happening on Twitter and what's happening in the chat box? So can we hear from Pip?
Hi, Helen. Good morning, everybody. Can you hear me?
Can hear you loud and clear. Welcome.
Good, thank you. Really lovely to be here. So far, the main Twitter activity has probably been from me, actually, although Lisa in California has joined us, which is really lovely, and Deborah, also from California. So if you're there, Lisa and Deborah, it's particularly lovely to hear you. So I think,
welcome, Lisa and Deborah. That's fantastic that you're here.
Yeah, lots of people anticipating eagerly their graduation and the amazing lineup of speakers that you've got organised for today. So hopefully things will warm up a bit on Twitter as the day progresses.
Thank you. That's great. And Rosanna, what's happening in the chat?
Yeah, good morning, everyone. Hi, Rosanna here. And mostly just a few hellos, really, on the chat, although Jenny has just shared with us that she's done her pledge and pressed the do button.
Great. Great. So what we'd like to do now is, you know, any kind of questions or any comments anybody would like to make. You know, let's hear from you. If you would like to say something, can you put your hand up and we will unmute you. So we'd love to hear whether you just want to make a comment, you know, whether you'd like to ask a question. You know, please, can we hear from you? So while we're waiting, I'm just going to ask some of our colleagues to make a comment. So can we unmute Jackie Linton? Hi, Jackie, are you there? Tell you what, Jenny Price has got her hand up, so let's hear from Jenny first, and then we'll hear from Jackie afterwards.
How are you?
Hi, Jenny. Good morning. Welcome to Change Day Celebration.
How very exciting. Isn't it lovely to be here?
Yeah. Great to hear from you.
So yeah. I just thought I could tell people a little tiny bit about my Change Day pledge.
Love that.
Which, as Rosanna said, I've gone back onto the website and I've clicked the do button. So my pledge was to start a change agents lunch club in the organisation that I work in, which is Health Education West Midlands. And I run a number of development programmes there for internal staff and some for external staff, all around improvement, innovation, service improvement. And what I was finding was that always the same usual suspects would come to the sessions. And so the idea of doing the lunch club was a way of engaging some different people and some new people. And it's been really, really fascinating because the first one, I think there were just about 7 or 8 of us in total. So it was small, but we had a fantastic discussion. We watched a TED talk all about behaviour change, and then we discussed it and we talked about what we might do differently in our day-to-day jobs as a result of that. And then everybody who was there promised to bring a friend to the next lunch club. And so gradually, bit by bit, we're starting to see some new faces who are probably slightly surprised the first time they come because they're not quite sure what to expect. But it's it's a very relaxed atmosphere. I just share some content, some thoughts, things I've been seeing on Twitter, and then we just have a conversation about it and say, what might we do differently on a day-to-day basis as a result of the conversations we've had. So we're still growing, but so far so good, I think.
That's fantastic to hear that, Jenny, because I think, one of the things that we about Change Day is like being part of a bigger movement of people, that you're not on your own. And I think actions, like you've been leading to bring people together to share and collaborate, I think are so powerful. So thank you. Jackie, would you like to say something? Jackie Linton.
In terms of my pledge for NHS. Good morning, everybody. Good morning, fellow change makers, first of all. Can you hear me?
Yeah, hear you loud and clear, Jackie.
Okay. So my pledge for Change Day, I remember my pledge for Change Day 2013 was I had 3 pledges that year. And the first one, which I have kept, which has really just been a personal thing for me, has been how do I ensure that hierarchy doesn't get in the way of patient care? And I think that really is really what Change Day is all about. And I remember one of the first things that I kind of observed in the first Change Day was that has become a really famous cartoon now and represents Change Day in the School for Health and Care Radicals, was the Permission cartoon. And it was just an observation and the feedback that we were getting from people that said, we just, even the smallest of change, that they just didn't feel that they had the permission. And it was really kind of represented a mindset. It was really a mindset about, were people really not giving them permission, or really was it about how they felt, and really how they feel in a kind of a big system where you might feel that, you're just a small part of it. So I think, Change Day has kind of really represented energizing and giving people permission to really just get on and just do what they know they want to do. And it's all about that I want to do it. And I just met with some Swedish colleague visitors just recently who've done Change Day as well. And they were saying exactly the same thing, that really this needs to bubble up from the ground. It needs to be that people need to own it, to want to do it. And I think that that's what we're celebrating today. I think, it's not Change Day itself. We're actually celebrating the energy that can be unleashed in the NHS if we just enable that to happen. So for me, it's to see where we've come from, over the past 2 years, and then the people that I now meet, just as a result of Change Day, and the sort of connections that we are now making has been phenomenal.
That's fantastic, Jackie, and I love that both you and Jenny, I think, really represent the spirit of Change Day around engaging, mobilising, bringing people together. We've had some new colleagues joining us this morning. So I can see that Ayana's joined us from Scotland, which is fantastic. Welcome, Ayana. So let's get down to the business at hand now, and let's hear from our colleagues. So our first set of presentations, we've called it From Singing to Sepsis to Spinal Boards. So 3 S's, but they're all about colleagues, clinical colleagues who have taken action at the front line. And we have 3 presenters, Dr. Jeremy Tong, Dr. Damien Rowland, and Rebecca Bussell. So the first person I'm going to call on is Jeremy Tong. And Jeremy is going to talk about the impact of his pledge, which was really important topic, improving the early recognition and management of sepsis in children, and doing this through widespread education and the implementation of a simplified care bundle called the Pediatric Sepsis 6. And Jeremy, you've got 8 minutes to tell us about the Pediatric Sepsis 6. So good morning, Jeremy.
Morning, Helen. How are you?
Very well. And Yeah, I can hear you really well. So
excellent. Yeah. Hi everyone, I'm Jeremy Tong. I'm one of the senior trainees at Birmingham Children's Hospital. I'm masquerading as Kathy Osborne on the panel at the moment because I've hijacked her laptop, but hopefully this will work very smoothly. My Twitter handle is @jez_tong. I'm going to talk to you today about the pediatric sepsis 6, and of course my pledge for Change Day. So the story started with my experiences of looking after children with sepsis. And so as part of my role in pediatric intensive care, I quite often see children with very severe infections who have multiple organ damage and failure. It just struck me when reading through the news, and this tragic story of Sam Morris is just the latest of them. There's been others in the past, and I think if you look back through the media, you will see there are lots of stories out there of children with severe infection who may have survived if they had different care. So, in fact, it got to a stage where the healthcare ombudsman was commissioned a report on sepsis, which was published on just before World Sepsis Day last year. It's called Time to Act, and in it, it describes a number of failings that the NHS has with people with sepsis. One of the cases is children, but if you look back at other reviews of child mortality, you will also find sepsis as a theme. And the reasons for, or some of the significant avoidable reasons for these critical incidents is a failure to recognize severe illness and severe sepsis in children. And you know what, to be fair, it is very difficult to recognize sepsis and differentiate that from other types of self-limiting or less severe illnesses. It is difficult. There are consensus guidelines out there that all pediatricians know, but the trouble is, I think because sepsis is a relatively rare thing, it's the incidence is about 0.9 per 100,000 children per year. People don't see it that often, therefore, when you're in a sea of cases where the symptoms and signs are very similar, how do you pick out that one child that's going to be really sick? So I work with, had the privilege to work with the CEO of the UK Sepsis Trust, Ron Daniels, together we put together a group, we worked on a pediatric version of the very successful adult sepsis 6 tool and initiative. I felt that after having worked with Ron for a little while, I felt that the adult sepsis 6 was right on so many levels. They were connecting with people at the front line. It was empowering the very people that were going to recognize the signs and symptoms in patients and give them a means to escalate the treatment at the right time. So I felt there was lots of things that we could learn from that. And so we put together a pediatric group, working group, to design a tool for aiding in the recognition and management of sepsis in children. So this is the tool. We came up with a pediatric sepsis 6. So the Pediatric Sepsis 6 we promoted via social media, via posters at professional conferences, and word of mouth. And we're now able to reach a number of trusts, and it's been agreed to roll it out across the whole of Scotland after it was piloted in Dundee. It's also been rolled out across my trust, we're now using the tool within the ICU where I work and within the ED department, and the other departments are following very shortly. So to raise awareness, actually, it's different. It's about connecting with people at front. I think the people that are going to recognise sepsis are the people that are looking after children. So that will be the bedside nurses, that will be the people in triage and sort of the most junior staff, junior doctors who will be picking up the signs or who will be called to review it, children who are just not quite right. And they're the ones that we wanted to target. So we devised an education program where we taught at the bedside, 3 or 4 nurses at the time, with a set of very simple slides, 5 or 6 slides, and we went around every morning for 2 weeks, and we did this power teaching, and we managed to reach about 70% of our staff, which is over 300, within the 2-week time period. We're now way over that. We also devised other ways to engage. For example, you can see Yvonne here is wearing a Sepsis 6 card around her neck on her lanyard, and that just helps remind people about the sepsis criteria, and we found that really useful. It becomes a talking point because it's nice and bright, and people wonder where the card's from. So then we're raising awareness through a number of channels. You can also see Yvonne is holding a box called a sepsis box, and inside is all the tools you need to manage a child with severe sepsis, alongside with our crash trolley. So in it you'll find the antibiotics and things. Again, it's a way to raise awareness. People know the box is there, and people thinking about it a lot more often. The design of the tool itself is also designed to allow people to help people make the right choice. So rather than missing sepsis because people aren't thinking about it, it's saying, okay, your child is unwell, and they could have sepsis. Can you just think about it a bit? Just go back and have a look and make sure that you don't miss it. And that is the key thing that I think in this initiative that will make a difference, which is earlier recognition and earlier treatment, because the data that we have out there is that the earlier you treat, the better the outcome is going to be. So
yeah, I think we've run out. So, yeah, go on. We've just got run out of time, Jeremy. Go on. So.
All right. Okay. Sorry. Yeah. So just quickly. So since I've made the pledge, which was to raise awareness and recognition of sepsis, we've been out and I've talked about sepsis to anaesthetists, pediatricians, senior pediatric trainees, junior pediatric trainees, and I'm going out to Wolverhampton next week to do another talk. So that was my pledge, and thank you very much for listening.
Jeremy, that was really fantastic, and I just think, you're the first case study that we presented today, and what a fantastic case study to start with. Change Day pledges, saving children's lives. that's really wonderful. So what we're going to do is we're going to hear the next two presentations, and then we'll have an opportunity to ask Jeremy some questions shortly. So stay with us, Jeremy. One last thing: where are you today, geographically?
I'm in NHS
in Coventry.
In Coventry, yeah.
Fantastic. Great. So what I want to do is kind of get a sense today as well of like where people are around the country. So so stay with us, and let's move on now to our second presentation, which comes from Dr. Damien Rowland. And Damien pledged to lie on a spinal board in the middle of a massive national conference in a collar and block for 1 hour. That he did this on Change Day. So Damien, can you hear me?
Hello, can you hear me?
Yeah, I can hear you, but I can't see you.
Fine. I might have a bit of difficulty with the video because it might crash my.
Okay, don't worry. We can hear you, and that's the most important thing.
Cool. Well, we'll see how it goes.
Yeah.
Do I have control?
I can see you now. I can see you.
Yeah. Cool.
Right. Yay.
Do I have control to move the slides along myself?
Yeah, no, I'll be doing it from here for you, so just give me an indication and I'll move the slide on for you.
Brilliant. So thank you very much, Helen. Good morning, everyone. I'm sitting in my office at Leicester Royal Infirmary in Leicester, which is where I work. This is my second Change Day pledge, and I like doing experiential pledges. So we're going to hear loads of pledges today of very different motivations, very different kinds. I quite like the one where you get a bit stuck into patient experience. So last year I tasted some children's medication, and this year I lay on a spinal board. Why did I do that? Well, if we move on to the first slide, children very rarely get injured by really serious trauma, but it does happen. Thank you very much to Hartley Hall's blog, because unfortunately they had a children's party there where a little young girl sustained a back injury after a fall, and an ambulance was called out. And as you can see, the poor little girl had to be put on a spinal board and her neck placed in a collar to make sure that she didn't sustain any further injury if she had broken her back or neck. We move on to the next slide. But you can see from the close-up that it's not the most comfortable of positions. You've got these two big rubber things next to your ears, your neck is locked in place, and you're on a very uncomfortable board. And most importantly, you've got a lot of people kind of around you. And the key thing is that this is just happening at the place where the incident took place, but the child needs to be transported to hospital. So if we move on, you can see that not only do you have to be moved from the house into the ambulance, you've got the ambulance journey, and then you've got the actual, depending on how long the journey is, potentially 10, 15, half an hour, maybe more, to actually get to the hospital. And even when you get to the hospital, you may be waiting quite a significant period of time if x-rays need to be done, etc. And I just wanted to know how that felt. So if we move on, the key thing for me was whether it was an experience that was painful. Was it an experience that was frightening? Was this something that we needed to individually change our practice for, or collectively change our practice? If we move on to the next slide. Well, there should be a picture next.
Paul, can you move on to the next one? So there's pictures there.
Hi, Damien. Sorry, we just have a little technical glitch with the slides, so we'll
see
if we can get there. Right,
keep talking, Damien.
So what was you might probably need to go back one or two, but anyway. So what happened was that I did a trial run because I wanted to know actually if I was going to lie for an hour on one of these boards in the main conference room, with lots of people looking at me, I needed to be sure that I might be able to get through the experience. And that trial run was really interesting. And the reason I'm telling you about the trial run is because of some of the great stuff that I've learned from Change Day itself, which is about engaging others and a bit about the importance of narrative. And the great thing about the trial run is it got people interested in my pledge even before the pledge really happened. So that the fact that I was just spending this time on a board in the department, we had a photographer come around to take some pictures, it got people talking. And it was that very visual nature of what I was doing got people talking in the department about being on spinal boards. Was it painful? What was Damien doing? What is Change Day? And I think that's a really important message to get out, actually, about the way that you can get people discussing things without actually having to directly go and speak to them. It was just about the visual event that took place in the department. Can we go back a slide? Okay, I think obviously there's a few missing. Anyway, so what happened on the day itself? Well, I pitched up. A huge thanks to Kirsty Challen, who is an emergency department registrar in Manchester, for providing the board and the blocks. The event took place at some point in the morning. I was lying down, and I noticed one thing immediately, which is why I'm showing the slide in front of you. You get a very different perspective of the world, and it is a very unsettling perspective. I'm 37 years old, and I found it a bit, oh, this is a bit weird, lots of people looking directly down at me from an angle I've never seen before. But actually, imagine if you're a 7-8-year-old boy or girl experiencing that, it's going to be scary. Can we move on to the next slide? So that's what happened originally. I then spent a bit of time getting settled in, 10 or 20 minutes. Actually, that was quite good fun. Lots of people kind of coming up to chat, was quite engaging, still a bit unnerving seeing people looking down at me. But then the next thing happened is that someone decided to move the board around the room a bit. And it's amazing instantly, because the ceiling moves and you're not, you get this seasick sensation. And I started feeling sick. Now, I didn't get uncomfortable, but as time moved on, I felt more and more nauseous. And when I came off the board at the end of the hour, I wasn't hugely sore, but I was a bit disorientated. I couldn't stand up properly because I've been lying down for an hour. My blood pressure was all over the place, but I just felt really sick. And I spent 5 minutes kind of trying to compose myself afterwards. So the really kind of the massive learning point for me was for children in this situation are going to feel potentially a little awkward, a little unsettled. And the story that I can now tell to the rest of the department is that if you've got a child on a spinal board, please do work very hard. One, reassure them. When you lean over towards them, if you lean right over them, that's going to be quite scary. So position yourself in a way that actually is not so frightening. Two, they might feel not uncomfortable in pain, but uncomfortable either because they feel a bit sick or because it's a bit awkward. So two, it's important that we reassure children about that. But most of all, just try and get them off the board as safely as is possible to do so. And I think the department has learned through some of my experiences. I see it now. As soon as a child comes in, we've got a lot of people around the bed kind of leaning them to get them off the board. Because actually, you can come off the board whether you've got the fracture or not, because as long as you're lying flat, that's okay. So actually, it's a part of a process of getting the staff engaged to do as much as they possibly can for benefiting this child. And my Change Day pledge not also kind of demonstrated to me that, but through the visual narrative of my Change Day experience, lots of others can share in that as well. So if we just move to the last slide, I think the Change Day process for me has taught me individually a lot, but actually I think the process of telling stories in this patient experience type way is a really good methodology of getting others engaged in a way that isn't particularly threatening. I'd like to thank again Kirsty Challen for providing the board. I'm extremely grateful for her for doing that, and I'm really looking forward to questions at the end of this session. So thank you very much.
Damien, thank you so much. And again, you know, something as simple as, you know, being on a board for an hour, and yet such a powerful and I think symbolic experience. So thank you so much for that. And it's great, by the way, just everybody taking part. That, you know, many of you are writing in the chat box. That's lovely. You know, let's hear about what you did. Let's get your questions and comments. So finally, in this session, we are going to hear from Rebecca Buswell. And Rebecca is a project support manager at Samwell and West Birmingham Hospital's NHS Trust. And she's going to tell us about her lovely pledge to start a small singing group to perform on the wards in her organisation. So welcome, Rebecca, and the virtual floor is yours.
Helen, thanks very much. Can you hear me?
Yeah, I hear you loud and clear. Can we see you at all?
Hopefully. I can't see any video at the moment.
Yeah. Don't worry, we can hear you. So that's the most important thing. So yeah, go for it.
Great stuff. Thank you. So yeah, as Helen mentioned, my pledge was to start up a small singing group that would be able to go onto the wards at City and Sandwell hospitals, hopefully then expanding over to Rowley, which is one of our sort of smaller community hospitals. The main reason behind the pledge was not just that I'm a keen singer and wanted to sort of perform in as many places as possible, but it was really to link in with our patient experience team as well. They had already started a fantastic programme of going onto the wards, taking Birmingham Royal Ballet dancers on there, and I went along for that about a year ago just to kind of see what was going on. And actually that was, I'd realised the first time I'd actually been on a ward in the hospital. Because I'm based in a non-clinical department, I do sometimes feel very far away from patients, and actually sort of walking onto the ward and washing my hands and rolling my sleeves up, I just thought, how on earth is this the first time I'd been on a ward? And really started to imagine what it's like for a patient, really. I've had family who've been in hospital, and it's obviously when it's your family, you're very close to them, and actually realising that everybody that's in hospital is somebody's family. So thinking about people who've been there for a day, 2 days, maybe even longer, and what their experience is sort of lying in a hospital bed, or even if they're able to sit up, and potentially if they don't have any visitors, you know, anything, if they don't have any stimulation throughout the day, what they'd be doing and what would make them happy, and anything that might be able to sort of enhance their experience at all. So as you can see here, I've pinched a quote from Professor Graham Welsh, who has written extensively, and there's some information on heartresearch.org.uk, but I thought it was a fantastic quote in terms of really trying to sum up the benefits of singing. I think people might have seen the programme with Gareth Malone about the choir, and him sort of setting up choirs across various different organisations, and anybody that's involved in singing potentially knows the huge benefits it can have, not just for your body, but the psychological benefits as well, increasing confidence and self-esteem. It can reduce stress. It helps in terms of sort of boosting your endorphins and releasing all sort of the positive, happy hormones. And it has actually proven in a study I think I saw in about 1998 in a nursing home that it was they ran a singing program there for people in the nursing home for a month, and after a month it was proven to have actually reduced significantly the levels of depression and anxiety. So I've also got a background in psychotherapy, so I think potentially that has influenced my pledge as well. So if we move on to the next slide, big thing, patient-centred care. So sitting in the office that I work in strategic planning, we're at the moment really focused, as we always should be, on how we sort of link our high-level strategic plans to patients. And actually, or the only way that I could think to get straight in and actually meeting patients and talking to them was singing, funnily enough. So I think really that was what motivated me to get there. Huge benefits for people's well-being, and as I've said, breaking up their very long days. And I didn't just want it to be about walking into the wards and singing and also performing and making it very one way. I really wanted patients to feel that they could join in if possible, and just spend a bit of time afterwards actually talking to them, and just having a chat and just seeing, you know, potentially whether they've done any singing in their past, if there are any songs they'd like to sing next time if we were able to go back. So yeah, so if I actually move on to what we've done so far, I think that's on the next slide. Yeah. So we've had 3 successful sessions at City Hospital, which is one of our main hospital sites. Myself and a colleague, Jo Ward, who's actually an NHS management trainee, who's just left us, unfortunately, but her and I basically began by going on to our medically fit for discharge ward, which is a ward for patients who are ready to be discharged, as it says, but are just looking probably for a placement potentially in a nursing home or somewhere similar. And a lot of the patients actually on this ward at the time we visited had dementia, so some of them weren't actually able to come and join us. We got the day room booked, which was fantastic, and the matron was wonderful, and they put on tea and biscuits for everybody. And some patients came down and sang with us. We sang songs like "We'll Meet Again." We did some ABBA, we did some Beatles, we did just some of the old classics, and asked them to join in where possible. And it was just really quite poignant. And some of the staff were there as well, and our chief nurse came along, and some of the families were there as well. And it just created a kind of a joined-up sense of we're just, you know, at the end of the day, we all may be patients one day, and actually if we can just come together and have a bit of a sing-song and maybe make this day a little less challenging or difficult for people. And the feedback was really, really positive, and I absolutely loved it. Jo really enjoyed it as well. So we've been to another couple of wards, and we'll be heading to hopefully the rehabilitation ward at Sandwell, the rehabilitation stroke ward at Sandwell Hospital, hopefully in the next few weeks. Again, with patients who've potentially been in hospital for months, going through their rehabilitation following a stroke. So that's going to be particularly interesting, and I'm really looking forward to that. And I think we're just hoping to continue, really. We've got support from our dementia activity coordinators, who've been brilliant, and they've been bringing along boxes of percussion instruments so that patients potentially who are unable to join in with the singing can join in from their bed and either shake a tambourine or get involved. And yeah, there's been lots of big smiles, which has been brilliant. So the next slide. Sorry, I realise I talk very quickly. Establishing the choir. So really, it was Jo and I that did those first few sessions, and as much as we really enjoyed it, we would love it to not just be the two of us, and especially as Jo's left, I'm really hoping to establish a small choir of about 10 to 15 singers initially, who will actually set up a programme of monthly activity so that it's a regular thing, so that people start to know that there's a bit of a presence in the hospital, and we can come along and do some singing, do some interactive stuff. So there's an advert going out in our staff newsletter that goes out to all of our staff, and that's going out in July, later this month, and we'll have some first rehearsals in August. So yeah, it's very exciting. As I said in the last point, it's not about performing and leaving, but it's about spending time with our patients. So if we go on to the last one. Where next, really? There's a fantastic charity, I don't know if anybody's already heard of it, called Kissing It Better. And they'd already done some work with our hospital, with our trust, and I know they work across the country. But yeah, hoping to link up with them really and just try and see how we can kind of get this programme up and running and get a bit of publicity for it. I sing with a local choir called Ex Cathedra. They have a really well-established programme called Singing Medicine, they do a lot of activity at Birmingham Children's Hospital. So I'm hoping to link in with them and just see whether we can get any shared learning, shared tips, to take it across our trust, and just get a programme up and running for the next 6 months. And potentially, if there's a way of measuring it without it being too target driven, just finding out, maybe after 6 months, has singing improved patients' experience of being in our trust, and certainly involving families and staff as well, because I think at the end of a long day for everybody, the staff are getting involved too. So I think we can find a way to measure just whether it's kind of having a bit of an effect. That would be brilliant. So I think that's it from me.
Oh, Rebecca, thank you so much. I think what a lovely story, and how powerful. And I think you're a really great role model for lots of us, in the sense that you don't have a direct clinical role, but like your passion for patients and the organisation that you work for, absolutely shines through. And I think that's one of the great things about Change Day, is that it enables all of us, whether we're clinical or we're a non-clinical member of staff, whether we're a patient representative, whether we're part of a broader community, all of us can do things to make a difference that are really powerful.
Absolutely.
So, yeah. So thank you. So stay on the line now, and hopefully Jeremy and Damien are with us as well. And we'd love to have some questions or comments from other people. It's lovely that so many of you are joining us today, and welcome everybody. I'll just put me on, so I'll do a visible welcome as well. Yeah, we'd love to hear any questions or comments. So please raise your virtual hand, or if you're shy, put your question in the chat box, and we'll ask it for you. Great. So we've got our first question from Helen Sanderson. Welcome, Helen. It's fantastic having you on our WebEx today. So Helen, you're unmuted, and the floor's yours.
I'm really intrigued about the way that Damien approached Change Day and doing something that's experimental that then made a bigger difference to lots of people. And I just wondered whether you had other ideas about how you can take that forward.
Yeah, thank you, Helen. Do you mean actually just not in terms of the actual pledge lying on the board, but the way of kind of engaging others through experience like pledges?
It was the actual pledge, really, because that sounded so powerful for you. Is it something that you'd like to see as part of training for doctors or nurses? Would you like to see that going further, or do you think you've taken it as far as you want to?
No, and I think I don't think I'll ever be able to take this as far as I want to, because actually every new kind of healthcare professional coming through the system will have something to learn, and I think memories kind of fade quite quickly. And one of the important things that Change Day needs to do is to continue itself and continue having events and pledges, because otherwise the story gets lost. And that's why I quite like the kind of the visual and the video recordings. Despite that, I often get accused of a great deal of self-publicity. Part of it is the motivation to get others talking about it. I really like your idea of kind of other people doing that as well. And I hadn't actually thought of that. But there are a lot of things that medical students do now. There is a real drive. I think every medical student in the country actually experience what it's like to be frail and elderly. There's now special kind of suits or other things that you can do to experience what it's like to be visually impaired, or have difficulty using your hands, or have difficulty mobilizing. And that's something that I think everyone goes through. I'm sure nurses do similar things. If I am teaching about kind of trauma, I will always include something about what it feels like. And actually, a lot of this experience, you don't need the board. You just need to lie on the floor for a period of time. And anyone can do that. You don't need the equipment to do it. It's quite easy to do.
Yeah, that's fantastic. I want to just see if anybody, just because we've only got a couple more minutes.
No,
I think it's just so brilliant and so inspiring for this conversation. I just want to see if anybody's got a question or a comment they would like to ask Rebecca or Jeremy. Okay. I'll ask one to Jeremy then. So Jeremy, my question to you is, you're talking about your approach to sepsis with other organisations. What, in terms of what you did, what is the kind of essence that other organisations or other clinical teams can take from your sepsis project and make their own?
Yeah, that's a good question. I think I think the main thing is the approach. The approach is different way. I think in a lot of care pathways or protocols are written by senior people, and that's not necessarily the wrong thing to do. But I think it's written by senior people, and then it's often filtered down through the levels. And I think sometimes the story is lost a bit by the time you get to the bedside person. So the bedside person finds it difficult to relate what the purpose of the protocol or the sheet of paper in front of them is for. And I think our approach was to turn that around and start from the people at bedside first, and then work our way upwards. Obviously, with the robust tool that was designed at the start from our group, and I think that's the approach that I would recommend other people take on. And I think there's other projects that are following on from our sepsis project that is starting to we're finding the benefits of getting it through a lot better by that approach.
Thank you, Jeremy. That's fantastic. And I'm going to ask the final question in this session, and this goes to Rebecca. And Rebecca, my question to you is: have you identified or joined up with other choirs from other organisations? And on the basis that if you don't ask, you don't get, would you be interested for Change Day 2015 in getting some other hospital choirs or other health and care organisation or other charity choirs involved in Change Day?
Absolutely, definitely. That sounds brilliant. For next year, I would love to. I think at the moment it's feeling very small within our trust, and I'm really keen to get it off the ground. But I think absolutely. I need to link up with I think at a Health Education West Midlands event last week, our chief exec said that he'd heard a fantastic performance from the choir from one of the local trusts. So I'll just be doing a bit of networking, hopefully, linking up with our patient experience team, and just potentially going to visit some people from local trusts as well, because I think that's something I don't get to do enough. And I think linking in with the talent around the West Midlands and maybe broader as well across the country throughout the year would be great, just to see how they run things and to see how they potentially do different types of activities with different patients. Just thinking the difference between working with children and adults, and with patients with dementia and patients that have had a stroke. So I think it could be quite a rich project. So I will be keen to network.
That's great. And we'll be in touch with you as well, Rebecca, in terms of getting organised for 2015. So that's the end of that session. And then what I really wanted to thank Jeremy and Damien and Rebecca. You've got us off to a fantastic start. And one thing I wanted to encourage us all to do is, if you look on the panel, next to where your hand is, where you put up your virtual hand, well, next to it, there's a feedback button, and if you click on that, it gives you a menu. And what would be nice is if we could all give Jeremy and Damien and Rebecca some virtual applause. So will you press the applause button? Thanks to all three of you. And we look forward to what all three of you will do for Change Day 2015. So what I'm going to thanks all. So what I'm going to do now is I'm going to move us on to our next session, which is kind of the other end of the boat. So what we heard were about, I think particularly from Jeremy there and from Rebecca, we heard about some really fantastic local projects. What we're going to do now is go to the other extreme, and we're going to talk about NHS Change Day going global. We have two speakers here. The first one is Jackie Linton, who works as part of NHS Horizons Group with NHS Improving Quality. And Jackie's going to talk about the extent to which Change Day is going global, and the kind of how the Change Day virus is just kind of spreading around the world. And then we're really pleased to hear from Mary Freer, who did an absolutely brilliant job leading Change Day in Australia, which was on March the 6th, 3 days after the British Change Day. And she's going to talk about Australian Change Day, and also how we work together, even though we're on different sides of the world and very different time zones. And also she's going to tell us about the very exciting plans for Change Day Australia Change Day Oz in 2015. So, so Jackie, let's hear from you.
Good morning, everybody. First of all, can you hear me?
Yeah.
Okay, I'm just going to turn my camera on. But for some reason, my camera isn't coming on, so I'm just going to carry on. So
yeah, Jackie, we can hear you well, and we can see the pictures. So,
okay.
So that's fine.
Great. Okay. Well, good morning, everybody. Good morning, fellow change makers. So I'm going to tell you a little bit about where we started and how we got to a global kind of movement. So I remember the very first meeting that we had about, what was our ambition for Change Day. And we took our inspiration from Earth Hour. And for anybody who knows Earth Hour, it's about how they can improve climate change. And that has moved to a massive global movement across the world. And we took our inspiration from there, but I think from that very small group of people that met, I don't think that we really thought that it was going to kind of go viral as it has. So I just want to reflect for just a few seconds on some of the things that we talked about at that first meeting. I think the first thing that we had was we had a burning ambition, and that was the group of people, the small group of people that came together. They just had a burning ambition. And I think the second thing that they had was that they believed that they could make a difference. The third thing that I think we had was that we had courage to just step up and step out. And I think the fourth thing that we had was that we had a goal. And the goal, yes, we had a goal of getting 65,000 pledges, but I think what was more important was the goal, the real goal was about making a contribution, no matter how small, to sustaining the NHS. And that was our simple goal. So Change Day continues to spread and inspire across the globe. So could we go to the next slide, please? When we had Change Day 2013, I remember, we were concentrating on what was happening in the NHS, but all of a sudden there was tweets, there were comments coming in from Canada, from America, from Australia, all over the world. People were kind of just catching the inspiration and the fire, right across the world. So who's actually doing Change Day and why? Well, you can see the list on the slide there. Starting with the NHS, on the second year, Northern Ireland joined us on the 3rd of March. Cerner was involved right from the 2013, but they actually held their own Change Day on the 3rd of March this year as well, 2014. Australia was always a champion right from the beginning, and we're going to hear from Mary in just a moment. And they did their Change Day on the 6th of March. Sweden on the 4th of June. The Netherlands has just had their Change Day on the 26th of June. The Session are going to have their Change Day in 2014 on the 6th of November. Scotland, Denmark and Finland, I know they're having a Change Day. I'm not sure of the date, but we're also following them. And it's just absolutely phenomenal. The latest one is the USA. They're coming soon as well, and we're just about to have a call with them. And I think the things that, as I've kind of spoken to people and met with people from across the globe, there are some kind of common themes that they talk about. I think the first one is that we all have common challenges in healthcare. And we're all looking for kind of new ways to think about change and how we can use different ways of coming together and the new ways of thinking about how we make connections. I think the next thing is that actually it uses simple rules, that it's about the grassroots that are standing up to make a difference, and that it's not hierarchical. that you can bring together volunteers. It's about having that you want to do this, and it's not that you have to. It's another sort of government task or something that you have to do. And that it uses the kind of social movement principles of collective action and the massive kind of connection that we've been able to make right across the globe. I think the thing about the starting place is that it is about doing this at a grassroots level, and that it doesn't start with a mandate to do Change Day. It actually bubbles up, and I think that that's really, really important. And what we've now been able to do is that every 6 months or so, we've been having a global WebEx where we're just learning from each other. It's not how can you do NHS Change Day in your country in the way in which we do it. It's actually applying these very simple rules of gaining a commitment, giving people permission, and using it for your own context. The last slide. So these are just some of the photographs or the logos from across the world. And I just really wanted, you can't see me on my camera, which I'm really disappointed because I have a green glass and I'm giving a toast to everybody who just stepped out, who wanted to make a difference and have been courageous enough to really take this on. And I think when you hear from Mary Freer, I think she will sort of, testify, the hard work that needs to go on, building commitments. And this is not just about having a platform, a website. It really is about connecting with people and making sure that you connect with people and build commitment right from the grassroots to make this happen. There is one of the kind of the small pictures right in just next to the winner Leaders Everywhere picture is a picture that was taken in the White House a few weeks ago, and even the White House has heard about Change Day and are getting excited about it. And I just want to thank everybody who really made this small idea that bubbled up from the grassroots into something that has been that has connected us, and why we're all here today, wanting to make a difference. So I just want to thank everybody and just to give a toast to you and to say well done and thank you for joining me.
Wow, that's so inspiring, Jackie, to hear that, and the way that the Change Day movement is just growing around the world. And I think there's some really interesting big issues for us. For instance, should we make it a global Change Day, and should we all have our Change Day on the same day, or do we all kind of do our own thing with our own particular kind of local and national context? So, but brilliant, thank you so much. So stay with us, Jackie, and we can finally see you now that you've stopped speaking.
Yes, I know. I don't know what happened there. Here's my toast.
Yeah, cheers. Can I just say, Jackie, can I just say, here's mine as well. It's a tea toast. Great. So, let's hear from Mary. So Mary has joined us from Australia, and I tell you, we have learned so much from Change Day Australia, and love the kind of global collaboration and the sense of solidarity. So Mary, the virtual stage is yours, and look forward to hearing what you have to say.
Fantastic.
Can you hear you loud and clear?
That's great. That's absolutely great. Well, if you hear a little dog barking, that's because my dog can hear me loud and clear too. Hello, everyone. Good morning to everyone in England. And I just want to start out by saying congratulations. Such an enormous success for your Change Day in March this year. You have achieved so much, and you have set a standard. It's a new standard. It's a new benchmark for the rest of the world. So thank you, and thank you from Australia. Now, can I have my first slide? Oh, fabulous. Okay, I want to tell you a little bit about Change Day 2014, which was the first Change Day that we had here in Australia. And, you know, we had Change Day in Australia because we had watched what you had done in the NHS, and we just kind of looked on from the other end of the world and were so inspired. And I can remember, you know, in 2013, and you set yourself that goal of 65,000, and I wondered, you know, are they going to make it? What's going to happen here? And I just remember cheering when I heard that you'd absolutely romped it in with so much more. And I thought, I wonder if we could do that here in Australia. I wonder if it would be possible to start something small to grow something big. And that's kind of how I like to think about Change Day. So I have the next slide now. So what we have done here in Australia is we have picked up your idea of Change Day, and we're doing it in a way that kind of fits for our cultural context. We know from this Change Day, our first Change Day in 2014, that it was moving, it was inspiring, and it was really appreciated. We think we've reached about 150,000 people across every state in Australia, and we know that we received more than 15,000, about 15,400 pledges. And they were pledges to improve patient and client outcomes. I'm going to talk in a few minutes, I'm going to talk to you a little bit about some of those pledges. It was so supported, it absolutely kind of took us by surprise that we could partner up with all our friends around the world and create this amazing social movement here in Australia. So I'll just go to the next slide, thanks. And I'll tell you a little bit about what it means to have an idea about Change Day in an Australian context. So here in Australia, our health system is facing increasing pressure, very much like yours and like we hear globally. We have a different health system to the health system in England. We don't have an NHS, we don't have an overarching employer. We have 3 tiers of government, Commonwealth, state and local, and all of those tiers of government and the private sector all play in the health and social care space, are all employers at different times and all put in some of the funding towards health and social care in Australia. We know that just like in other places around the world, we're facing a massive shortage of health workforce professionals, and probably around 109,000 nurses short by in the next 15 years, unless we do some radical things to kind of turn that around. We have a very ageing population, same as you, 65 and over, would have 5 or more long-term chronic conditions. So it's a very complex health system, and it's a really big country. We've got about 7.5 million square kilometres in Australia. It's probably 3,500 kilometres from one side to the other, so we're geographically very spread out. We've got probably 1,400 public-private sector hospitals. So there's a lot happening, and it's a big space. I'll just go to my next slide. So just like, can we just go to the next slide? Can you? Yeah, great. So just like the NHS, we need a paradigm shift. We need change. We need big change, and we knew we needed it now. And this is where we kind of said to ourselves, a very small group of people got together one night after the NHS Change Day. I remember us all sitting around my kitchen table, and we said, what would it take to create a Change Day in Australia? You know, what would we need to do? How would we create a paradigm shift? And that was exactly how Change Day started. It was a small group of health leaders saying, okay, what is it we need to do? Let's get really practical. And I'll just pop to the next slide, before I talk about kind of what we had in order to create the change that we did, just recently I read this fantastic quote by Joe Ito, who's a disruptive technology innovator, and he said, and I love this because this is exactly what happened in the NHS, and it's what happened for us. And he says we're kind of at the point of no return in terms of trying to deal with some of our problems in a linear way. We need non-linear change, and non-linear change only happens when you get a wildfire of support from people. And that is exactly what you got, and that's what we got, this wildfire of support. We'll just have a look at my next slide, thanks. We created, I always say this to people when they say, you know, how did you pull this off? And I say, we created Change Day with 6 inches of string and some sticky tape, because it really felt to us like we had absolutely nothing. We had a zero budget. So we had no organisational support. We had no infrastructure support behind us. We literally were a team of people saying, hey, let's see if we can do this. We spent $64 on that beautiful website of ours, and I hope you've all had a chance, and if you haven't, go over to our website and have a look. That cost us $64, and I can remember putting it on my credit card. We had no money to spend on marketing. We somehow found $180 for all of our printing, and we had no money for salaries, no office rental, no admin. And we created this fantastic movement where we had over 15,000 people getting in touch with us and making pledges. We had hundreds of people sending us those beautiful pledge pics where you write on your hand, I support Change Day, join me, and you'll see them. They come up throughout my presentation. We had hundreds of people tweeting them, hundreds of people emailing us, calling us to say, you know, if you're near where we are, can you drop in and come to our staff meeting? We put out a weekly e-newsletter. We had a monthly advisory team teleconference of health leaders around Australia who could help us and introduce us to people. We did lots of social media. We got this wildfire of support, and we got hundreds of emails and phone calls and contacts from people saying, I'm in, how do I get on board? So my next slide, you'll see there's a great little picture that we took there. And for those of you, most of you would never have met me. I am second from left there with, I'm the woman with the glasses on. So that power of social media is quite incredible, and it's, to this day, I have not met face-to-face most of the people that were the strongest supporters of Change Day, purely because we all live so far away from each other, and we know each other only by our connection over social media. And even tonight, because it's nighttime here, before I came onto this call, I got emails from people saying, you know, do us proud, and it's great that you're talking to the folks in England. So we feel like we kind of know each other really well, but we actually haven't met. My next slide, we are really building a sustainable change movement here in Australia, and we know that it's not possible for us to continue to deliver the sort of change and the sort of support to organisations that are wanting to participate in change with absolute $0. So we're looking at how we can build a sustainable financial model that will allow us to throw ourselves into this and not kind of have to do all of this between sort of 9 at night and 2 in the morning. So just to give you, this is a great little picture because it's a fantastic photograph of a great flash mob that was held in a hospital in Melbourne. And I don't know if Kate or Beth from Melbourne are on the line. I'm not sure that they are, but if they are, just big thanks and for that energy and pulling all those people together. And they were dancing in the corridor at this public hospital. This doesn't happen in Australia. People don't dance in hospitals. So it was absolutely fantastic, really beautiful, highly energetic. Next slide, thank you. It was a campaign that really speaks to emerging health leaders and future health leaders as a national council of young and emerging health leaders from every discipline. and they were so supportive of Change Day, and we really need the support of young and emerging health leaders. And you'll see they've all got their hands up, they've all got pledge pics. Fantastic, it was fantastic. And my next slide also shows, I've just thrown in, it's like photo night, family photo night. I just wanted to show you some of the great photos. It's just a little selection of the hundreds of photos that people sent, and we've got dental service teams there, and primary healthcare service, and young educators who work at a children's hospital, and they all kind of made these pledges and sent them in so that we could have them. My next pledge, my next page, sorry, not pledge, my next slide, and it's second to last, I'll be finishing up in a sec. I just wanted to give you a little sense of the types of pledges that we got, and they're very similar to those that are coming in other countries, but overwhelmingly people wanted to put patients at the very centre of the work that they did, and that was just a beautiful thing for all of us to see. And doctors who really wanted to use, or trainee doctors wanting to be the very best general practitioner they could be for their community. And wonderful pledges from all sorts of people. I'm just going to quickly tell you a little story so you get the sense of how different pledges, how different they were when we looked at all of them together. And I'm probably one of the people that have actually looked at all of our 15,400 pledges. We got an email from a woman who was homeless and lived in her car in Queensland. And she had heard about Change Day. And this woman got in touch with us to say, I don't work in health. I use a lot of healthcare services, but I don't work in health. Can I make a pledge? And she went on to make an amazing pledge. Her pledge was that she wanted to get the word about Change Day out to the people that lived in her town. And so we sent this woman a packet of postcards, and she delivered them to health services and to clinics in her area. And we thought, you know, if a woman living in her car who is homeless wants to share the responsibility to make our health service better, then absolutely anyone can get involved in Change Day. And we just found that so incredibly humbling, and there were so many beautiful examples like that. My very last slide, I just really want to leave you all with details on how to kind of keep in touch with what's happening in Australia. I am so appreciative of all the people across the NHS that follow us on Twitter. We got so many encouraging tweets for our Change Day. So many of you keep in touch with me and share the work that's going on there. I'm really excited that I'm going to tee up a Skype with Pollyanna soon so that I can learn about your hubbies. So I really want to hear about hubs and how you made that work so we can do it here. Keep in touch with us. Pollyanna Jones is on the line, so that's great. I'm glad she's able to hear me. I'm really looking forward to having that webinar or Skype with her, because I know I'm going to learn a lot. We'll be crowdfunding soon. We're going to use a crowdfunding platform called Start Some Good to try and raise some of the funds that we need, so keep in touch with us and you'll hear all about that. So just lastly, thank you so much to Jackie and to Helen. You have been just personally and professionally incredibly supportive of Change Day in Australia and of the work that I'm doing, and I couldn't have done it without you. So thank you, and it's beautiful to be part of a global change family. Thank you.
Thanks, Mary. This is Mina here. I think we just lost Helen with her connection. So thanks, Mary and Jackie. And I'll facilitate this Q&A session.
Sorry, yeah,
so,
I'm back now.
Are you back?
Yeah.
Okay,
I'm back.
excellent.
Sorry, Mina, yeah. So I had a little problem with my sound there, but a slight technical hit.
Oh, okay.
Yeah, but I'm back. I'm sorry about that, and thank you for stepping in. Do we have questions or comments that we'd like to make to Mary and Jackie? Okay, if you'd like to ask a question, will you put your virtual hand up? So I have a question for Jackie. So Jackie, what did we learn from Australian Change Day?
Oh wow! I think just listening to Mary just now, I think the first thing is that congratulations, Mary, to having a website that cost you $64, and I think it was absolutely fantastic. And I think we can learn a lot from your website. And I think the thing about your website was you kept it really simple. It was focused on, it was very user friendly, and it also, just did the job. It was absolutely fantastic. So I think we've got something to learn. I think the other thing that just listening to Mary there, how grounding it felt, and I think that this is a challenge for anybody who's doing change. I think you have to work from the grassroots up, but you also have to work with the hierarchy as well. And I think Mary's context is different in Australia, in terms of having the NHS and them not having an NHS in the same structural form. But yet she was still able to do the connecting, and I think that really is a massive kind of testament about how you can create change even inside or outside of a system. So I think there's a big learning for that. And I just love the stories that Mary told about, the lady who lived in the car, and how she has used resources other than money to really make a difference. I think that's a massive learning.
And do you know what I'd say, Jackie? That really fits as well with our Change Day theme, because across England, 98% of the activity was amazing activity was carried out by volunteers.
Absolutely.
In the same spirit. And I think what I take from both of you, is this idea that people think that if you want to change the world or you want to massively improve quality, that it costs money. Actually, if we can engage and mobilize our amazing workforce and the incredible people that use our services, it isn't money. It's about connectivity. It's about giving people a voice and a platform. And I think wherever we are in the world, whether we're in Sweden or in the Netherlands or Australia or Scotland or England, we can do it.
Absolutely.
Yeah. So, any questions for Mary or Jackie? So I want to ask Mary a question. So Mary, given your Change Day experience 2014, what wouldn't you do again?
What wouldn't I do? I think a few things. I wouldn't get so stressed out 3 days before deadline, thinking, oh my goodness, there are no pledges. That means it's not going to happen, because amazing things happen at the turn of a clock. So incredible things happen from we had our change day on the 6th of March. From the 5th of March to the 6th of March was a difference of like 10,000 pledges. So I wouldn't get stressed about that. I wouldn't, it's not so much what I wouldn't, but what I would do, and what I am going to do, we're going to do more next year, is spend more time encouraging and enabling people to take the thing on themselves and to really trust themselves to be creative and to back themselves to just, give it a go in their own organisation. So I think the more stories I can tell people about how little we had and how much we created, I think the more people will kind of really take that on. So so that's another thing that I would do that I probably didn't do enough of, because we were kind of flat out doing it this way. But I've learned so much. I can't even think in one kind of sentence, what the thing is. It just, as you would know, Helen and all the others that are involved in Change Day NHS, it is the most massive learning curve and just the most, I call it the most crazy beautiful thing that I've ever been involved in. So you're just learning all the time.
Thank you so much. So we're coming to the end of this session. So yeah, Jackie, go on, give you the final comment.
It wasn't a comment, it was a question I wanted to ask actually about what currency people thought, if we don't have enough time to sort of carry on the conversation, or even just in the chat, about, you know, this is Mary's first year. Next year you might say, oh well, you know, we've set a goal for more pledges, and we've done that for 2 years now. But how might we do that differently? What is the goal for next year? And I would really welcome, you know, comments on that about how we take that forward. You know, it's not just, oh, we did 500 pledges this year, let's increase that. So what is the currency that we would use? I'd really welcome.
Thank you. And you know, it'd be great if colleagues that are taking part could put some ideas in the chat box. So we've just got a few minutes now. So what I want to do is just get a quick update in terms of Twitter and chat. So Pip, are you around? What's happening in the Twitter sphere? Can you hear me, Pip? Okay, while we're waiting, can we ask Rosanna what's happening on the chat box? Can we hear either of you?
Hi, it's Nina. I'm looking at the chat box. I see that there was a question from Polly, I think, in the chat box about when Australian Change Day is for 2015.
Helen, I've just been unmuted. You want me to update you on Twitter now?
Yeah. Tell you what, you do that, and then what we'll do is we'll just, if you could just Pip, tell us what's happening on Twitter, and then we'll get Mary to answer the question from Pollyanna after that. So yeah, what's happening on Twitter, Pip?
Okay, so I think a huge amount of appreciation and I think almost incredulity about especially the work in Australia, and people were really amazed by Mary's fantastic work there. We've got a kind of heads up to listen to Jill Phillips and Ken Howard a little bit later today, where they're going to be showing Ken's film. Obviously people were really interested to hear about Damien's and Jeremy's pledges, and especially about the singing group, which I think was a really lovely idea. So mostly I think kind of acknowledgement and appreciation of wonderful stories and presentations that we've been hearing about, and I think really delight that the whole Change Day idea is actually going global, and that social movements are alive and well around the world.
Thanks.
Hi everyone, it's Rosanna here. I'm off mute, so I'm going to go ahead while Helen Bevan's coming back on and just give you an update on what's happening on the web chat, if that's all right. You can really sort of feel the energy rising on the web chat this morning, and there's a huge amount of enthusiasm for this WebEx being shared. There's been comments around how, you know, the simplest of pledges can create such a massive impact, and, you know, the importance of keeping it grounded, starting from the roots and growing up. But one of the themes that emerged a little bit earlier was about, from Damien actually, and Claire, who talked in the web chat about how we often get the usual agents for change coming forward, the sort of same old, and Change Day really helped others to get involved, and Damien's dad even made a pledge. And Claire asked about how do we then spread the word, and Damien suggested that we invite a friend, you know, spread via the word of mouth and the powerful, you know, impact of that. Something else that came up was a question from Jackie Linton, which was, what should we use as the currency for Change Day 2015? And Mary suggested that actually it's not just about pledges, it's about energy, and it's about increasing energy for change. So I think that's a really interesting opportunity that we've got there to look at measuring some of that. We've also heard from people around where they're located, and obviously, as Helen's mentioned, there's people from all around the world. People have been sharing where they're coming from. And we've also had a couple of pledges shared. So Emily, who's deaf and watching the pictures and monitoring the chat to keep up with us, is her pledge is to help hearing people to listen like deaf people. We've also heard from Emma what she's been doing since Change Day. She's become an MBE for Services for Public Health. And we've also heard about the enthusiasm of Change Day going global. Mary's mentioned that New Zealand might be joining in 2015. So there's a general kind of feeling of being connected across the world and feeling a real resonance with the common issues in the UK and Australia. So I think that's everything from the web chat for now, Helen.
Hi, it's Helen. I'm just, you know, I'm in the middle of a complex technical thing where I'm just swapping over to Google HangOut for our next session, and it's kind of happening, but I'm trying to manage both at once. So, Mina, can you keep an eye on things just for a couple of minutes before we just go into Google HangOut?
Yeah, I'm just going to take a couple-minute break so that we can switch to Google Hangout. So if everyone, if you can just grab a coffee, a glass of water, and come back in about 2-3 minutes, hopefully you'll be able to hear us on the Google Hangout. So we'll be back in 2 minutes. Hi, everybody on the line. This is Nina. We're just getting sorted with our Google Hangout. So just stay tuned and we'll be with you in a couple of minutes or so. Hi everyone, just an update. I can see Helen put a message in the chat box that says that they're nearly set up for the Google Hangout. And so we're doing something a little bit different here where we've got a few people that are going on a Google Hangout and we're attempting to live stream this to the WebEx. So just bear with us and hopefully all of the technology will work well. Okay, the latest update is I'm told that we have a link. So you should be seeing a video that will show up on your screen pretty soon. And hopefully you'll be able to hear it as well. So if you can't hear something or you're having difficulties, just type in the chat box if you're having any problems. Everybody, you'll also need to hit play on your own individual screen. You'll see if you hover over the red little play button and press it, you should be able to access it. So just hit that button and everything should be good.
they feel they're being lost out and
Hi, everybody. We're just about to start our next session, which is talking about small actions with big impact. And we're going to hear 2 stories from people who are making a difference. So we'll be starting that in just a couple of minutes. Okay, hi everybody. I hope you can hear me well. We're going to start the next session, which is talking about small actions with big impact. And we have 2 stories from people who are out there making a difference. So we're excited to have on the line today here, Joe Wren and Andy Tyso. So we hear Jo Wren is from the GMC, and she's going to share the pledge and story from the GMC to promote understanding of equality and diversity issues across patient, doctor, and student groups. And Andy Tyso is a dementia nurse specialist at the County of Chester Hospital, and he'll be sharing with us his pledge about reaching 2,000 friends, dementia friends, by the 23rd of May, 2014. So we're going to ask both our speakers to speak for a few minutes, and then at the end we'll have a question and answer period. So get your questions ready and make sure you're contributing in the chat box and on Twitter. So I'm going to hand it over. Can I have the next slide, please? I'm going to hand it over to Joe. So Joe, I think you've got your camera on and you've unmuted yourself. So great. Thank you, Joe.
That's okay. Hi, everyone. Can you hear me?
Yeah, we can hear you well.
Perfect. Hello, thank you. Thank you so much for inviting me. It's really exciting to be involved in this, and I've been enjoying all the stories that I've heard so far. So it's been really inspirational hearing about what everyone's been doing. So as I say, thank you very much for inviting me today. I'm going to talk a little bit about our team and sort of what our team has done, really, I think. I'm part of a team from the GMC called the Regional Liaison Team. So if you could just pop the next slide on, that'll explain a little bit about who we are. We're quite a new team that the GMC has introduced. For those of you that don't know what we do, the GMC regulates doctors. So we're probably best known for striking doctors off and taking action against doctors if there are problems with their fitness to practice. But actually, another part of that work is spreading good practice and going out and talking to doctors about our ethical guidance and our ethical standards. And traditionally, we haven't really done so much of that side of the work. So that's where my team came in. I've been at the GMC for about 13.5 years, and I was lucky enough to be involved in piloting this team about 2 years ago. So as I say, there's 8 of us around England, and we've really been trying to work out how we can make a difference, how we can improve patient care, how we can help doctors feel supported in their role. So Change Day seemed like a perfect opportunity for us to be involved and to sort of help make a difference with the way the NHS was interacting with its patients. So we sort of got involved this year and encouraged the other people across the GMC to get involved. We had a blog about what we were doing that went up on our website. We tweeted ferociously throughout the day about some of the things that we were getting involved in. Some of the other pledges from my team included Howard, who's from the South East Coast, has become involved in his GP surgery patient group, so he can understand exactly the issues affecting general practice on the ground. Kelly Taylor, who's a doctor that's working with us, pledged to help junior doctors become more involved in making a difference, quality improvement activities. So she became involved in the Agents for Change conference that was held recently, that was helping junior doctors empower their leadership skills and helping them understand how they can become better leaders. And she got really involved in that from her sort of perspective. One of my colleagues, Tracy, pledged to help medical students understand ethical guidance better. So she contacted Peninsula and Bristol medical schools, who are kind of next to each other geographically, and was able to arrange a university challenge-style debate based around our ethical guidance with a couple of our other colleagues, and that went down really well. And there seemed to be some good fun in the room around some of the questions around, you know, what you would do if this were to happen and that were to happen. So that's just a flavour for some of the things that the team has done. Some of the bits and pieces in particular that I got involved in, if you just put the next slide up. One of the main things that we were doing was looking around with our ethical guidance. Traditionally, we publish a booklet and we send it out, and that's really sort of where our involvement ends. And we expect that our guidance is applicable to all situations. And actually, one of the things that my team has been hearing and that we've been understanding is that's not necessarily the case, and different people interact with healthcare in different ways, which sounds obvious when you say it, but I think it's not really been in our mindset before. So as an example, we were hearing things like, and I've had to scribble some notes, so forgive me for looking down, that from Indian patient experts, we were told that culturally they would never consider asking their doctor questions, even if they don't understand their treatments, which for us was really interesting. And that's something that we've been able to highlight to doctors, to make sure that if they're explaining something to an individual, to a patient, and they feel that that patient isn't understanding it, or perhaps they just want to double check something, think about some questions that they can ask that aren't just yes/no questions, but that are some sort of leading questions that the doctor can ask, just to make sure that the patient has actually understood the issues that the doctor's been discussing with them. And we've been able to say to them, because we know from our research, from our engagement, that, you know, particular groups may find it difficult to question some of the things that you've been saying to them. So that's been really useful. Likewise, we were told that within Irish traveller communities, that healthcare workers can be surprised if they speak loudly, whereas to them that's a cultural norm and doesn't represent impoliteness. So again, we were able to feed that through to doctors, particularly doctors where there are large populations of traveller communities, and we've been able to sort of share that learning and that understanding, and that's helped ease the communication a little bit. Likewise, we've heard from some areas about there being lack of translators available. So when we've gone out and talked to doctors about quality improvement activities they can get engaged in, or audit activities, we've been able to suggest to them that perhaps they might want to look and see what translation services are available at the various surgeries or within the hospitals. Is there anything they can do to pull together resources? Have they got things in an easy read version for perhaps patients with learning disabilities, those types of things? So kind of taking the bits of information that we're hearing from patients and from certain groups, we're able to then feed that through into the teachings and the learnings that we're sort of sharing with doctors. Next slide, please. One of the other areas of work that we've been doing is encouraging doctors to just reflect on how their behaviour and how some of the things that they say, how some of the discussions they have impact on the patients that they're interacting with. Again, we had a gay patient come and talk to us as a group just to try and understand some of the issues that they perhaps face with accessing their healthcare. And one of the things that he told us was that he felt that he had to come out every time he saw a new doctor because there was no sort of format within the notes for it to be kept that he was gay, but it meant that each time he was having to sort of have this intensely personal discussion, even if he was just going to talk about a problem with his knee or something on those lines. So again, we've taken that through into some of the bits and pieces that we've talked to doctors about around understanding how they introduce themselves, the types of questions that they're asking, the types of things that impact on the reason why the patient might be uncomfortable sharing information with them. We've worked with GLAD, the Gay and Lesbian Association of Doctors and Dentists, and the Lesbian and Gay Foundation this year as well to try and understand, as I say, some of the concerns that patients face. And one of the things that we heard, for example, is that lesbians aren't routinely offered smears. So again, we've been able to take that through, and when we're talking to doctors, when we're talking about intimate examinations and chaperones, we're reinforcing that message to make sure that they're offering equal healthcare to everybody, and that they're not directly or indirectly discriminating. I think the issue here is that most doctors are doing an absolutely fantastic job, and I don't want to in any way suggest that they are doing anything other than that. But I think they don't have the time or the opportunity to be able to have the types of discussions that we're having with people. So they simply don't have the resource to be able to sort of find the nuggets of the information that we're able to do within our team, and that's where it's been really useful to share that. Likewise, when we go out and talk about our ethical guidance, we usually use kind of fictional case studies and ethical scenarios to help doctors understand how it applies in real life. So, if you're in this situation, what would you do? And looking at those scenarios in light of our recent sort of engagements, we've realised actually they're not hugely culturally diverse scenarios. So again, we've been able to mix that up a little bit. We had one of our scenarios focused around a potential relationship with a lesbian couple. And when we ran that with a group of junior doctors, there were some rumblings of surprise around the room that we would feature a lesbian couple in it. And one of the junior doctors actually came up afterwards and thanked us and said that it was something that they'd never necessarily thought about previously. It wouldn't have occurred to them to consider some of the issues that came up as a result of that discussion. So it's been really interesting being able to do that. And likewise, we've been told some things in confidence. There was a student at a medical school who'd effectively been bullied after she'd come out and had received some very hurtful comments from fellow students, and she felt that the medical school hadn't handled it particularly well. And whilst she didn't want us particularly to do anything about it, she just wanted us to be aware that this was one of the issues that's going on. So again, when we're talking to medical students now, we make sure that we sort of include some advice for them on how they interact with their colleagues as well as with their patients, and how they need to be sensitive to the people around them, because we know that this can be a problem in some areas. So again, it's not suggesting that they're doing anything wrong, it's just reminding them that there are things that they need to think about. I have to say, I was also thrilled last week to be able to march in Pride in London, which was great. We went out with loads of colour balloons and got absolutely soaked because obviously the heavens chose to open on the day that we were marching through London. But it was great to be out there for the GMC. It was absolutely fantastic to sort of be representing that side of the GMC's work, despite the dousing, and dancing non-stop for about 4 hours down Oxford Street. It was great fun. Just a couple of the other things that we've been doing, if I could have the next slide, please. We have been doing quite a lot talking to doctors about how we work in our data, and again, this flows through us understanding more about what worries doctors. So we've gone out and Tista, my colleague in the north in particular, has made great steps with this. This was her pledge really about working with equality and diversity groups, and while she's been working with equality and diversity groups with patients, she's also been doing the same with doctors. And there are a couple of groups out there that are quite large organisations that represent doctors from different backgrounds, and one of the things that we're very aware of is that certain groups of doctors are overrepresented within our fitness to practice procedures. So that means that certain groups of doctors from different backgrounds are more likely to receive complaints and are more likely to be investigated. So we've been going out and talking to these groups of doctors, explaining what we know, using the data from this report, that the cover of which you can see on the screen, which tells us why we receive complaints. It tells us what people are complaining about. We've been able to use that and go out to these groups and say, you know, we know that this group of patients is more likely to complain to us. We know that they're more likely to complain about these types of issues, for example, communication. We know that there are problems with record keeping. So have you thought about that? So through kind of going out, finding these groups and hopefully trying to share our knowledge with them and share our understanding of some of the issues that they face, we're hopefully keeping them away from our fitness to practice procedures as much as possible, because obviously that's what we would like to know, that every doctor out there is practicing to the best of their abilities. Next slide, please. Next, oh, thank you so much. We love this slide. One of the things that I pledged in particular was to share good practice, because I think that coming from the General Medical Council, doctors don't necessarily enjoy interacting with us. I haven't necessarily understood that we can be supportive as well as doing the fitness to practice part of work. And I think when we started as a team, we were focusing on when things go wrong. So if something goes wrong, what do you do about it? You're presented with a situation where something's horrific. What do you do about it? And I think that through hearing about initiatives such as Change Day for last year, we were able to understand where there were pockets of good practice that would be useful to share around the country. So that was my pledge, was to try and find these really interesting examples of good practice that could be quite easily duplicated around the country. So some of the things that we've talked about are the Onion initiative at West Hertfordshire Hospital, where the new chief executive at the time came in and started these morning meetings where she gathers all the staff together and they peel back the layers of things that are going on in the hospital and across the trust, and the feedback from that has been fantastic. So we've been able to talk about that with other organisations, because it's something that doesn't cost much money to sort of pull together, but has shown some really great results. Likewise, we got permission from Dr. Kate Granger to talk about her Hello, My Name Is initiative, which I'm sure many of you are aware of, and just really reminds doctors of the importance of a simple introduction before they go ahead and have the interaction with the patient that they're needing to have. So again, costs nothing, but something that we've been able to share around. Likewise, with medical students, we got permission to share the Ask One Question initiative, which has been sort of introduced over here mainly by a group of students in Wales that we've been talking to. And again, we're feeding that through to students. And the idea behind that is that medical students ask one question of a patient, which is, what can I do to improve your care today? And some of the feedback from what they've heard about that has just been fantastic. Things like a patient wanted to go to sleep, but the sun was in their eyes and they couldn't reach the blinds, or they were thirsty and they couldn't reach the water, or they didn't understand what their doctors had said to them when they'd given them their new tablets. They hadn't understood exactly the details of how they were to take it, so could the student explain it to them? So again, fairly simple things that cost nothing, that help the patient feel better and also help the student feel better, because it made them feel that they were making a difference in the care that the patient was receiving. So that's been a really interesting one to be able to share around and talk to some of the medical schools and other medical students about that. Likewise with patient groups, I heard about One Health Watch, who have worked really closely with their local hospital, and they've been able to have a Health Watch person, so a patient representative, on the interview panels for the medics in the hospital, and they found that really interesting, and the hospital have found it really useful to understand how the doctors coming in react when they're interviewed by a patient and ask questions by a patient as well as by their colleagues. So again, that's something that we've been talking about as we go around the country. And finally, Change Day. We've been promoting the heck out of Change Day, I have to say. Whenever we're out and about, it's one of our fairly standard slides on things that you can do that are quick and easy and make small but quite noticeable differences to for the care that people are receiving. We're encouraging people to come onto the website, read the change war, read the pledges that are on there, and just understand how they can help, really. So that was all I had to say. There is a final slide that's got my details on if anyone's interested, and I'm happy to stick around for questions.
Great, thanks, Jo. Thanks very much for that. It's inspirational to hear how you guys are promoting Change Day and how you've used tackle some of the issues of diversity and the other things you mentioned. So we will keep questions to the end, and now we're going to move over to Andy. So Andy, if you can just unmute yourself, and I think your camera is on as well.
It's on?
Yeah, we can hear you. Andy?
Yeah, I'm here.
Okay, great. Go ahead. Yeah,
okay,
we can see you and hear you. Excellent.
That must be quite scary. Have you got my presentation?
Yep. We'll go to the next slide. Just let us know when you'd like to advance the slide.
Okay, thank you. That's brilliant. Thanks very much, Arthur. Hi, my name's Andy Tyso. I'm a memory nurse, and I work here at the Countess of Chester Hospital. And thanks to a secondment opportunity inspired by Leslie at the West Cheshire CCG, I'm also a Dementia Friends facilitator working with Sandy and her team at the Cheshire West and Chester Council. Although, to be frank, I do prefer the word activist to facilitator, but hey, what can you do? I'm also a Dementia Friends champion for the Alzheimer's Society. I'm going to tell you the story of my pledge and the outcome of it. I've written it down and I'm reading it out mainly because it helps me to keep on track, and sometimes I can go on for weeks, so apologies for that. So I need to keep the time. So hopefully that'll be okay for you guys. My pledge for this year's Change Day was to create 2,000 Dementia Friends by the 23rd of May. That date was chosen because it coincides with the end of Dementia Awareness Week. But the journey began way before my current role was created. If I could have the next slide, please. Two members of the hospital management team, Sharon and Leslie, had not only the passion to stand up for the rights of people with dementia, but also the courage to sit down and listen for when things basically went wrong. And we need to be honest in healthcare, we really do. On the back of a harrowing complaint received from a carer of somebody living with dementia, they decided to employ 2 dementia nurse specialists, and with the brief to work differently with people with dementia and to improve their journey through the minefield of an acute hospital stay. My colleague Sue and I started in the hospital in August 2012 in a role that evolved more or less as we went along, but it was driven by a local initiative, commissioning initiative, or CPRIN, from an old age psychiatrist called Nush, who worked at the local mental health trust, the Cheshire and Rural Partnerships NHS Trust. The role then also grew. It also grew to include the outcome measures from the National Dementia CPRIN, and also to design and deliver dementia awareness training for clinical staff. Now, I've always had the view that everybody who works at the hospital, from the front of house volunteer to the chief exec, should know the basics about dementia, what it is, and probably more importantly, what it isn't. When you think about it, 1 in 3 people over the age of 55 in the UK will die with dementia, and the average age of a patient in an acute hospital bed in the NHS is 75. A no-brainer for me. Oh, and here's another one for you. All staff, whatever they do for a living, are going to get old. They're going to have older people in their families and live in a community. So really, it's another no-brainer for me as well. I was also keen to offer these awareness sessions out to other organisations, members of the public, and carers of people with dementia too. Because when somebody, and I don't know if you agree with this or not, I don't know if I've used the right word, but when somebody gets given a diagnosis of dementia, somebody else usually gets given another diagnosis of carer. And then who equips that person for their journey ahead? Carers need education and training, as well as ongoing support. Oh, and also we have access to the hospital's 100-seater lecture theatre, and we just wanted to fill the place up, basically. And also, when you think about it, think about this. What is the point of a dementia-friendly hospital when the community it sits in isn't? The other thing I'd like to share with you, and it's all part of this whole thing around change for me, I'm never one to reinvent the wheel. So if there's something out there that you can, if you think of a change and you think of something that you want to do, check to see that somebody hasn't done it first. People can get quite precious about their material and their property. It's not worth it. You need to share that. So, About the same time as this, the Alzheimer's Society had just launched their Dementia Friends initiative. That was a social movement providing free information sessions on dementia and telling people about the small things you can do to improve the lives of people living with dementia. It was also about creating dementia-friendly communities, so that seemed to be another perfect fit for me and another no-brainer. With some initial tweaking, the Chester model of Dementia Friends was born, providing a basic level of awareness and information on dementia for all, and also creating more dementia friends for the Alzheimer's Society. Another win-win. Over time, with suggestions and feedback, the sessions grew and evolved to include more information on dementia and the priceless stories and experiences shared by participants. I'll tell a story of Bert's wife and an anniversary card, and also a guy who went round a supermarket with his wife, and the concern just buying tomato sauce brought him. But then you'd need to see the session to understand those stories. And I usually start the session by encouraging people to think a little bit differently about dementia, and also share a vision that I'd like to see of a dementia-friendly checkout hill in a supermarket. Why not? And when you think about all the reasons why not, probably they're the reasons why you should. I then finished the session with a very moving poem, which I'm happy to actually share with you at the end of this story. It was sent in by email from a participant who thought it would be a good way to end the dementia session. And it's probably a good way to end my session here as well. Word started to spread about these sessions, and requests were also made to run them outside the hospital boundaries, in community halls, GP practices, shops, banks, and other publicly accessible buildings. Listen though, this isn't just about me. It can't be. Have the next slide, please. Thank you. That was freaky. It's also about the people who enabled and inspired me to make this happen. The fantastic people and organisations I've already mentioned, and other forward-thinking movers and shakers within them, learning from when things go right as well as they go wrong. And here's the model of change. It's a multiple choice. You can, A, sit safely in your trench. You can B, peer over the parapet, or C, you can just leg it across no man's land and be brave. I brought in a picture of my cat Gatsby for you to have a look at, and that's how we did it. So I hope you can all see that. I'll show that later if you need it. But that's Gatsby sat in a what? It's just a lovely picture. Anyway, don't forget, if you're gonna implement some change, you need to take people with you and look around for weapons too. There's all sorts. There's carrots and sticks. You can use legislation, national guidance, regulation from the CQC, and even the success of others. There's also the Mental Capacity Act and the Human Rights Act. I've legged it across no man's land with all kinds of people, all the ones I've already mentioned and others collected on the way. For example, Midnight Mel, our general nurse who has joined the dementia team, and an early supporter, Steve, who's the ward manager on Ward 34 at the counter, who generously, very generously, supplied the props for this slide before I actually thought about using them. Freaky. Anyway, oh yeah, and be prepared to take in from them, because it's not just and not just from the front too. Sometimes you do get shot in the back. So the more people you inspire to leg it across with you, the bigger the target, which is fantastic, for me anyway. But really, it's all fine and dandy being out on point. But it's the people who take the risk and come with you that provide the sustainability, and also to watch your back as well. If you do make it across no man's land, share your success with others and don't be precious about your intellectual property. Think of the greater good. Sometimes you don't know where all this is going. You don't know where you're going to end up, but you know you don't want to be where you are, so that could even be a motivation for change on its own. Be innovative, passionate and positive, and don't stop until you get arrested. Rock the boat, but remember, the bigger the boat, the more people you'll need to rock it. About the next slide, please. The impact of the 2,000 plus people who have now attended these sessions has been widespread. Incidentally, my colleague Sue has also just hit the 500 mark, so we're really trending up in Cheshire West. The impact has been quite widespread, from a desire to create a dementia-friendly council borough from the leader of the West Cheshire Council to simply changing the colour of a pot of paint from one of the decorators who works here at the hospital. After attending a session, our chief exec, Tony, described it as a game changer for him. And Asha, an obs and gynae consultant, said, As doctors, we think we understand most diseases, but that's a myth. You explained dementia very clearly. I am now very motivated to help these people. And people from all walks of life, health and social care staff, yeah, banks, businesses, museums, schools, and even the armed forces have attended, and including an architect. All have pledged to do something different to improve the lives of people who live with dementia and their carers, including staff from Tesco's, who promised to deliver on my dementia-friendly checkout bill. People have also been inspired to become Dementia Friends champions, and we've recently hosted a Dementia Friends Champions Facilitation Day here, thanks to John down in Malpas, and we've got another 20-odd Dementia Friends champions to start rolling out the story as well. We've also, in the hospital, created our own dementia operational group, and we've just launched also the West Cheshire Dementia Action Alliance. Our second dementia-friendly community, Blacon, which is an urban area of Chester, is launching this afternoon, so I'm off there in a bit. I'm also now working with NHS Strategic Clinical Networks, and I'm chairing a task and finish group on my other Change Day pledge, which was to see the Chester model of Dementia Friends, with all it entails, the whole package, rolled out across other NHS hospitals if they want it. But basically, and this is only just really coming to play, basically what the Chester model does is it meets the outcome criteria for Tier 1 of Health Education Southwest Basic Dementia Awareness Training, which there is now a mandate for that to be all across the NHS. Unfortunately, the Alzheimer's Society's Dementia Friends session as it stands doesn't, so we need to marry those two up. And I think I've found the way to do that. The Chester model of the Dementia Friends meets that requirement of Tier 1. The Alzheimer's Society are also happy to support the rollout of that and have endorsed the enhanced version. And we'll also be putting on a Champions Training Day for me so I can attract other people from different hospitals to go on a Dementia Friends Champions course, learn how to be a facilitator of that, and then come to spend a day with me at the counter and then learn about the Chester model. And again, it's all optional. You can't force people to do this. So, what are we looking at now? Are we looking at the opportunity to create a dementia-friendly NHS? Have the next slide, please. So, when you're in a position to work in true partnership within all these different organisations, you can start to see the many shades of grey that surround the black and white of each one of them, and how you can then start to join things up and make sense of a bigger picture. I've found solutions are easier to see. Not all the time, but sometimes easier to resolve too, because you've got the benefit of the insider knowledge of that culture and the personalities of those differing bodies, working alongside the people that you need to talk to instead of beforehand emails. You've also got the advantage of making things happen by knowing the right people to link up with each other as well and network. Yeah, and I think I need another vision to start my awareness sessions. Next slide, please. Why, get it. In May this year, probably the first ever dementia-friendly checkout till was officially opened by the Lord Mayor of Chester in a Tesco supermarket. It was a symbolic event. The council and commissioners provided the signs and the time. The countess provided the awareness session for the Tesco staff, and the local and regional Alzheimer's Society provided the press person and the leaflets and information too. That is true partnership working for the community and for the creative. For my next vision then, so I've got to think about something else. How about this? How about making the forget-me-not symbol for Dementia Friends as commonplace and as synonymous and alongside the blue disability badge? That would actually really change the way we think about people living with dementia in the UK, and also change the way society and community views those people living with dementia. Next slide. So it's great to get some publicity and get some profile. That's all great and good, but it's not the end of it, because it's all about the cause. And then why not celebrate your cause? Don't forget, that's all part of it as well. It makes people feel good, and it also draws a line and demonstrates that you've actually achieved something too. This picture here, that's the official launch of the West Cheshire Dementia Action Alliance last month. 120 people from around the borough came together to pledge to do things differently and to put it all on the map. They're leaders of all the some of the leaders of all the organisations that I've already mentioned, some representation, and also members of the public too. We put on a Dementia Friends session there, and the leader of the council became the 2002nd person to become a Dementia Friend, so fair play, and he made a very poignant pledge as well. We put on a marketplace where other people could come and demonstrate what they've been doing and sharing. We had a lot of networking. We also had the aspirations of national, regional and local speakers. This is key now. This is key and something I haven't mentioned just yet, but this has been all the way with us all the way through. We've also listened to people who have got dementia. And at the conference, we listened to somebody who was living with vascular dementia and his carer, who were brave enough to get up in front of us all and share their view of what dementia-friendly communities should look like. Real stories, real people, and very powerful. Okay, the final slide. Thank you. A couple of nights ago, this is the thing. When you pledge something, really, I mean, sometimes you don't know where it's going to end up, where it's going to go. But I'll tell you where I ended up a couple of nights ago. I ended up delivering a session of Dementia Friends for nearly 50 people from inside the Chester Cathedral, right in the heart of the city and right in the heart of the community. How fantastic was that? That was an amazing, amazing experience. And it was something that just fell in together by people talking to other people and, oh yeah, he'll do this, and somebody will bring along the pull-ups, and it was a really fantastic time. And thank you to the Chester Cathedral guys who actually helped facilitate that and put on all the great teas and coffees. It was really good. Ranks right up there with the experiences for me. I've also been asked to be the National NHS Change Day Hubby for Dementia. And again, I've got no idea what that will look like at the moment. A bit dodgy, guys, sorry. I don't even know where it's going to end up. What I do know is that I will need support from others from around the country, and also the inspiration and enabling power of NHS Change Day too. Okay, right. I mentioned a poem earlier, so here it goes. This is the poem that I end my session with. It's called The Alzheimer's Poem. It's by Owen Darnell. Do not ask me to remember. Do not try to make me understand. Let me kiss and know you're with me. Kiss my cheek and hold my hand. I'm confused beyond your concept. I am sad, I'm sick, and I'm lost. And all I know is that I need you to be with me at all costs. Do not lose your patience with me. Do not scold or curse or cry. I can't help the way I'm acting. I can't be different, though I try. But just remember that I need you, that the best of me is gone. And please don't fail to stand beside me. Love me until my life is gone. Thank you for this opportunity. Listen, guys, keep rocking the boat. You need to keep rocking the boat. Don't fall out. Don't fall out. One last thing. I've made another pledge, and I've got another change day coming up on Monday. I'm getting married to Jill, who I love, plus, in Lisbon for quite a week, really. Thank you all. Cheers. That's me done.
Thanks very much, Andy, for your inspirational story, and I love the poem at the end. It's amazing. So I just want to open this up now to anyone who might have any questions on the line for both Andy and Joe. If you can just raise your hand, if you see the little, hopefully you'll see the little hand button at the top or on the middle of your screen on the right-hand side. If you raise your hand, we'll just unmute you. And in the meantime, when you're thinking about the questions, I'm going to go to Pip and to Rosanna to get an update from Pip about what's happening on Twitter, and then an update from Rosanna afterwards about what's happening on the chat box.
Hi, Nina. Thank you. It's
Hi.
been really interesting watching Twitter and listening to the last few speakers. So for those of you who can see Twitter, I've actually made a little Wordle, which I thought might encapsulate some of the themes from this morning. And the words that seem to be coming up again and again and again are celebration, inspiration, connecting and connection, obviously change and innovation, improvement. It was fascinating hearing Joe's talk about diversity and equality and the different ways the DMC is promoting that, and I think people really appreciated that. And Andy has clearly touched lots of people's hearts, and there are several tweets about how wonderful it is to hear about the Dementia Friends project. So I've also noticed that the number of people attending the WebEx is just steadily climbing. So that's a really lovely thing to see, and more and more tweets are definitely coming through. So it's looking good for the rest of the day.
Great, thanks, Pip. And Rosanna, are you there?
Hi, yes. Lots of comments feeling very inspired by Andy's talk on the web chat. And, you know, a couple of quotes from there: dementia is everyone's business. And Linda McKench, new CEO, has become a dementia champion. She wants to share that with us, so that's
Brilliant.
fantastic. I think there's a bit of a theme that has been emerging throughout the day, and Charlie Keeney adds to that again, which is about the importance of, you know, widening the influence of, you know, non-change type groups, so voluntary and other groups in, you know, in sort of widening the impact of this community, of the change community, and the influence that NHS Change Day has on that. And Damien, again, talks a bit about how it's great to use Change Day to share great ideas. And just finally, there's a request also for the Twitter handles for all the speakers, so I'm sure we can get that out onto the web chat at some point today.
Great, thanks, Rosanna. I have a question for both for Andy and Joe. I guess, Joe, if I start off with you, just reflecting on what Andy has said, I wonder if there's, and your comments about looking at diversity and some of the other issues that the GMC is looking at. Has the GMC done any pledges around dementia?
We haven't, but I was scribbling ferociously as I was listening to his talk, which I thought was absolutely fantastic, and I've taken down all his details to pass on to my colleague who's from that part of the country, because I think there's some really interesting points that came out of some of the work that he was saying, and I loved the analogy of the more people you inspire to leg it across, the bigger the target. I think that's such a wonderful way of trying to encourage people to come along with you. So it's not something that my team in particular has done much on at the moment, but I definitely think there's scope to do work there in the future.
Excellent. And Andy, what's your recommendation to Joe and the GMC about how they can get involved in some of the work that you've been doing?
If you're a doctor, if you're going to get old, if you're part of the community, you need to be involved. So absolutely, there's loads and loads of research around. There's all sorts of different bodies that are doing that. What else have we got? We've got the Dementia UK, who are doing huge amounts of resources. Even if it's something like just going on the House of Memories, Liverpool Museum's website, and downloading their new app, it's absolutely fantastic. Just to sit there with that app, it's free, and then you can just sit and engage with somebody with dementia, because that's what you need to do as well. So there's all sorts of things you can do. You can take a virtual dementia tour. That's something that we've had at the hospital. And many people, I've just been talking to Sue, one of our directors here, about that, and the impact that's still having on her. That's something that you can do. So that there is loads of things to do more.
Okay, great. Okay, so can everyone, thank you very much, Andy and Joe. Can everyone give them a virtual round of applause? And you'll see that again on there's a little bubble with a check mark. And if you go click on that bubble, you'll see a little option there to applause. So I just click that. You guys can do that too, that would be great. And we're going to move on to our next session. So thanks, keep the chat going, and if you guys have any questions for Andy and Joe as the day progresses, just put them in the chat box or put them on Twitter, and we'll send them out to them. Okay, great. Can I have the next slide, please? Okay, so we're going to move on to our next session now, which is going to talk about patient-centered pledging in action, and 19,000 patients feedback for NHS Change Day. So we've got two speakers for this session, Rachel Royal and Ben Talbot. I hope I pronounced that correctly. And I hope you're all set up there and you've got your videos and your mics going. So really, Rachel is going to talk about her test work with pledging at Epsom and St. Helier. which launched a patient first program. And then we'll be having Ben talk about Hospedia's pledging, what some of their actions and outcomes were. We're kind of run this in the same kind of format as we did earlier. So we'll get Rachel to go first with her presentation, then followed by Ben, and then we'll have a question and answer period at the end. But if you have any questions as we're going through, please feel free to just put them into the chat box. Okay, can I have the next slide, please? So Rachel, we've got your slides up there now. Just let us know when you want us to progress to the next slide. So go ahead.
Okay, great. Thank you. Can you hear me okay?
Yeah, we can hear you loud and clear.
Brilliant. Good morning, everyone. My name is Rachel Royal, and I'm the Director of Communications and Corporate Affairs at Epsom and St Helier. What I thought I'd do today is tell you a little bit about the journey that we've been on as a trust in recent months that's led to many of our staff making patient pledges and what has resulted in a full-scale programme across the trust to drive real sustainable improvements that put the patient first. Next slide, please. As we all know, the Francis report was published in February last year, and it made a number of recommendations that were relevant to us as an acute trust. We reviewed all of these recommendations, from compassionate care, the duty of candour, the role of the Care Quality Commission, our relationship with our local health watch organisations, and in particular the role of staff and how they raise concerns, identify issues, and all different things that are important to patients and how they solve problems. From that work, we developed 4 work streams. Next slide, please. The first one was around organisation development. The second, patient experience and complaints. The third was risk and quality assurance. And the fourth was around effective ward care. But really, we knew that to try and improve the culture and to understand the concerns of our staff and patients, it wasn't just about the work streams or the programmes. We really needed to listen to our staff and engage them in some honest and open conversations. Next slide. So starting in the summer of last year across our hospitals, we embarked on a number of listening events with our staff in clinical and non-clinical areas. And we asked 3 core questions. Would you recommend your service and the trust to your friends and family? If you have a concern, do you think you could raise it, and would your manager do anything about it? What one thing could you do to improve the care that we give our patients? Next slide, please. There were many key themes, from staffing levels, incident reporting, effective ward rounds, and dignity. Next slide, please. However, it was from the last question, what one thing could you do to improve the care that we give our patients, that the idea of our My Patient Pledge campaign was born. And it was built on the premise that sometimes change can be difficult, scary, cumbersome, daunting, and there were lots of really big things that people were a bit afraid to change. But one of our members of staff said, wouldn't it be great if we all made one small pledge and one small action? Because if we all took one small action, we can really affect change and improve the care of our patients and make some big improvements. So from around September, we developed our pledge cards in-house and launched them at an event with our executive team. Across our organisation, all staff, from porters, directors, doctors and nurses, started to make their pledges. Our local MPs also joined in too, from Conservative, Labour and Lib Dems. We got them all to make patient pledges. On March the 3rd, we joined in with a national event with pledge polling stations in our restaurants, encouraging more staff to pledge, and the pledge board went on tour at team meetings across the organisation. The nursery, pharmacy, elective orthopaedic centre, for example, all developed their own boards and are displaying their pledges where they can be seen by their staff and visitors. Next slide, please. As part of the journey, though, it wasn't just an internal exercise. Using the power of social media and the hashtag #MyPatientPledge and joining in with the national NHS Change Day campaign, we shared our pledges far and wide. And throughout March, we shared them with our patients and their families at listening events that we held in partnership with our local health watch organisations. However, for us, it was important that the pledges and the actions we take are sustained, and almost perhaps a little more by accident than design. We had also been developing a patient first programme, and apologies, my slides are probably a little bit in the wrong order. So next slide, please. Go to the next one, please. So we developed the patient first programme, led by Cherry McCormack and our People and Organisation Director, Kevin Croft. And it was a programme of 4 sessions that really helped to embed the change and help our teams to make individual pledges and pledges as a team. It was very much focused on what can I do, what can the team do, and what other help do we need. And we're really beginning to see and unblock some of the problems and make some improvements. Essentially, the programme is 4 sessions, and we encourage mixed teams from across all of our hospitals to attend, everyone again from doctors, porters, nurses and corporate services, and we're really keen that at the sessions there is a mix of different staff. So the 4 sessions are really well designed, and they're based on real patient information from the Trust, the real complaints that we get through our own patient survey data. The first session looks at the history of the NHS, what's changed and the challenges and opportunities, and this helps us to set things in a broader context. The second session is quite interactive and takes a lot of our data from complaints, the inpatient survey, and gets the teams to look at different patient journeys and explore what some of the issues are. The third session is a walk around as a team, and we send the teams off around the hospitals with a clipboard and pen, looking at things from the patient perspective. The fourth session is where we've really combined this with the patient pledge campaigns, and as the teams come back and make their action plans, they link and make their pledges. To launch the campaign, we started to look at innovative ways that we could see things from the patient perspective. So, sorry, go back a slide, please. So we put Sue Cook. Sue is a wonderful older people's nurse that works at Epsom Hospital. So to launch the programme, what we did is we put Sue in an older people's suit, an age suit that we have, that gives her the feeling of lack of mobility in her joints. And really, we sent her walking around the hospital to see things completely from the patient's perspective, reading the letters, how to get up the stairs, pouring a drink of water. And even from that, we've been able to find problems that we didn't know we had. For example, patients find it really difficult to pour water. So we're going to look at getting easy to use drinking jugs, really, really simple things. So what's next? This morning I've just come away from our Patient First steering group, and we've appointed a programme director for the Patient First programme, and this group's going to oversee the rollout of the training programme across the Trust and the sessions that we're running with staff to help them understand the patient journey. And we're starting to ensure we really maintain momentum and pick things up, not just the individual actions, the actions as teams, but also there's things trust-wide that people have kind of battled with and got frustrated with at a local level. And one of those things is something around signage for us as a trust. Our patients and our staff constantly frustrated around signage, so it's really helping us to solve some real problems. That's it. Thank you.
Thank you very much, Rachel. So we're going to move on now to our next speaker, which is Ben, and then we'll have questions coming in at the end. Okay, go ahead, Ben.
Hi, good morning, everyone. Can everyone hear me well?
Yeah, we can hear you.
Fantastic. So I'm very pleased to be sharing the Hospedia pledge towards NHS Change Day with you. And it's probably a good starting point to introduce it to you. If you could go to the next slide, please. So when Hospedia learnt about the NHS Change Day, we were pleased to come up with a pledge, which is Hospedia to promote the NHS Change Day to patients at their bedside, to inspire patients to make pledges and to gain feedback from all patients on where they think improvements will make a real impact to the NHS. And to put that into perspective and why Hospedia feels that it can contribute to that, if you could go to the next slide, please. At a very high level, Hospedia is the world's leading operator of healthcare systems at the point of care. So Hospedia has presence across 155 NHS hospital sites with approximately 70,000 bedside units that act as entertainment systems, but also patient engagement platform and a provider for clinical access for clinicians and staff members within the NHS. So to fulfill that pledge, if you could go to the next slide, please. Hospidia constructed a nationwide campaign on its bedside units, utilising its advertising and promotional platform, as well as its patient feedback capabilities at the bedside. And what that meant is, in cooperation with NHS IQ, the content and the images were agreed on what to promote at the bedside. So advertising would appear on all bedside units to raise awareness of the NHS Change Day, but also it has the ability for the patient to click through and go to the NHS Change Day website for patients and their visitors to learn more about it, but also to give them the ability to submit a pledge and to be more educated about the whole initiative. So that was one component of the campaign. The other component was enabling the real-time patient feedback system at the bedside to ask patients some key questions about their satisfaction or their vision on whether the NHS Change Day would have any impact, with general satisfaction questionnaire to assess their opinion about all the services provided to them during their care in hospital. So if you could go to the next slide, please. So the campaign ran 3 days before the NHS Change Day, which was on, I believe it was the 3rd or the 4th of March, and included the day itself. So it spanned over 4 days in total. It generated 7,600 click-throughs from patients and their visitors to the NHS Change Day pledge website, which clearly enabled them to navigate through the portal and make decisions on whether to submit a pledge or not. Also, the on-screen surveys generated a staggering over 19,000 responses in total over 4 days, with really valuable feedback on various aspects that was addressed to them. Next slide, please. So from the advertising component of the campaign, again, a very, very high level. The top 20 sites, hospital sites, that have contributed to that 7,600 click-throughs come from the list that you can see there, ranging from Adam Brooks to all over the country, basically, which is very interesting. The next slide, please. So some key findings from the patient feedback that was addressed through the surveys at the bedside over the 4 days. Several questions were raised, all agreed by NHS IQ. Some of the very, very interesting feedback is 78% of patients think NHS Change Day will make an impact on patient experience. So that was really positive feedback about the whole activities regarding the NHS Change Day. 65% of patients choose to say thank you to nurses, doctors and healthcare assistants while they're in hospital. And then we'll go through a bit more detail on what it compares to. 49% of patients think NHS needs to make improvements in the way patients are treated and communicated to. So these two are the top 2 factors for patients in terms of improvement they expect from the NHS. 50% of people think that by keeping their scheduled appointments and going to A&E only in emergency situations will help improve the NHS. And frontline staff are most trusted by patients to improve the future of the NHS. So really interesting statistics there. All the data was fed back to NHS IQ to derive more conclusions from. The next slide, please. So the next couple of slides kind of go into the detail of the findings, highlighting the top 10 hospitals or contributors to this information.
Hi, everyone. Sorry, it looks like we just lost Ben's audio. Sorry, these things happen. Technical issue happens on the WebEx. So I'm just going to see if we can get her back connected. So if you just bear with me for a minute or so, we'll see if we can get her back online. In the meantime, I'm just looking in the chat box, and Andy, who was a presenter in the session just before the session, has posted that we can Google the poem that he read out, and I think he's sent something else in there. There's another story on YouTube that he recommends people watch. Does anyone have any questions for Rachel as we're waiting for Ben to come back in? If you just raise your hand. Nope, doesn't look like anyone has any. Rachel, I have a question for you. There, oh yeah, just seen you go off mute. So Ben's back, but okay, I'm going to stop asking my question and wait till the end because it looks like Ben's back on the line. Ben, are you there?
Yeah, I'm really sorry about that. I just got disconnected. So
no problem at all.
Shall I just carry on with the last two to three slides?
Yeah, just carry on. Sounds good.
Okay. So could you go to the next slide, please? Right. So patients were asked if they had to say thank you, who would they thank? And they were presented with a variety of options. The top three were nurses, doctors, and healthcare assistants. Next slide, please. And again, how patients were asked if they could improve any area within the NHS, what would it be? Presented with a variety of options there. What was key to them was communication and being treated with greater compassion. That was really important, which is the what's vital to patients.
Yeah, as long as I can get up here and get here on the Tuesday.
Next slide, please.
Yeah.
And as mentioned before, if patients had to choose what they would improve about how they contribute to the NHS to improve it, what would it be? And only going to A&E if necessary, it kind of played a big part of that, alongside not missing any appointments. And that's kind of the high-level findings from the campaign, which we hope it contributed to the NHS Change Day initiative and provided some real insight to what patients think. Thank you.
Okay, great. Thanks, Ben. Okay, so thank you, both of our speakers. Does anybody have any questions from the live? Again, you just need to raise your virtual hand and we'll take you off mute so that you can ask a question. You can also write, if you have any questions, you can also write them in the chat box. Okay, so I'm going to ask my question first to Rachel. I know when you sent through some information to us earlier, I saw a video link that you had about the Patient First program. I thought that video was amazing, actually. It kind of showed the journey of someone in your trust kind of trying on the older age suit and experiencing firsthand. I thought it was really quite powerful. Could you just talk a little bit about how you guys kind of thought about that pledge and how you kind of...
I just want to make sure she doesn't want me to do something.
Oh, hello. Sorry. I think that was Pip. Just not on mute. So Rachel, I would just thought if you could just shed some more light on the experience of the person who put on this suit, and also maybe if you can just give the link out to the video so that other people on WebEx can look at that in their own time later.
Yeah, sure. Basically, it was the idea of Stacey, one of the events coordinator on my team, and she'd seen the age suit around and about, and she said, Sue said it would be great to understand what it's like from that kind of patient's perspective. So, so Sue basically, you know, got the suit. Sue's worked on the older people's team for around 15 years, and she's never done anything like that where she's actually kind of really tried to look at it from, you know, walk around and actually really experience things from the patient's viewpoint. And I think she found it quite profound. She really didn't realise that from pushing doors, how heavy they would be, pouring water, things that we probably so much take for granted, really impact on how other people, you know, can experience the hospital. In particular, you know, reading the letter and things like that. So we basically we had the idea, and Sue had made pledges around wanting to you know, improve things for our older patients. So we thought who better to kind of really launch the program and to kind of try out wearing the suit. And we also hoped that it would help other people who watch Sue's experience of kind of wearing the suit really think about things differently and from a different viewpoint.
Yeah, I mean, I definitely agree. From my personal experience of viewing the video, you can clearly see that she was quite shocked by some of the simple things that I guess we would probably take for granted, like opening the door on the ward. I thought that was quite an interesting little snapshot in the video where it wasn't as easy as what we all thought it was. So I would highly recommend for people to take a look at that video link, and we'll make sure that we send out the video link soon. And okay, so thanks, Rachel. And then going over to Ben, very interesting about some of the data and the information that we got back from your survey as well. I was wondering if you've done a similar type of survey for other things, the same type of scale for other types of initiatives with Hospedia.
Yeah, absolutely. We work with a lot of hospitals across the country to utilise this real-time patient feedback system. So whether it's for the friends and family test, or the national inpatient, or smoking cessation services, all sorts of surveys we run on the bedside unit for various trusts where they're able to access patient feedback in real time and access patient is discharged. So any issue be rectified. It's a very effective way to react to patient needs. So absolutely, work with a lot of trust on that front.
Okay, great. So it looks like we still don't have any questions on the line. So I'm going to take it to Pip and to Rosanna to see if there's anything going on Twitter and in the chat box. So Pip, do you want to go first?
Hi, Nina. Thank you. Yes. People were obviously really impressed by Rachel's presentation and the whole notion of the old age suit. One of the things that struck me was that it would be interesting to add blindfolds to the old age suit and see what it's like for people who are actually blind. So yeah, that seems to have made quite an impact. And I think Yeah, there hasn't been a huge amount on Twitter since I last spoke, but I think people are kind of beginning to identify themes really and pull together their ideas around dementia and elderly people and a real need to improve the patient experience from the patient's perspective. So I think that's about all from Twitter at the moment.
Okay, great. Rosanna, is there anything in the chat box?
Well, I just sort of echo Pip's summary there, similar sort of chat going on with the web chat. There's a comment on Rachel's presentation that, you know, this is an excellent example of putting the patient first in action. And there's a real appreciation for, you know, these real ideas for improvements from patients' points of view. Andy has also just put a couple of notes up there if anybody wants to get hold of the poem by Owen Darnell. You can download that from Google, and has also posted a suggestion to look at Barbara's story, which is on YouTube, which was created by Guys and Thomas Hospital, a very powerful 33-minute video. And that's it from the web chat for now.
Okay, great. I just noticed that we just got a comment from Emma about whether this information will be available online after today, and the answer is yes, it will be. We're kind of recording the entire WebEx, and we'll break it down into the sections that we've kind of been following today, and we'll post up all of those links on the Change Day website probably sometime next week. We'll send out an email when that happens as well. Okay, so does anyone have any... Sorry, go ahead, Rosanna.
Just wanted to say that Emma Lee has posted a few things before. She's deaf, so I'm going to respond to her in the web chat so that she knows about that.
Okay, great. Thank you. Okay, so if there's no more questions for this session, can we please give our two speakers a round of applause? And again, you can do that on the little bubble with a check mark in it. I'm going to do that right now myself. And we're going to take, our next session is going to start at 11:40, and it's going to be the launch of a new white paper, which is going to be really exciting. So let's take a 10-minute break now, and we'll come back onto the WebEx at 11:40. So go grab a coffee, have a little bit of a bio break, and we'll speak to you shortly. Thank you. Paul, can you mute the people who aren't muted, like Tip and Susan? Hi everyone. I'm just going to do a quick sound check. So Helen, are you there on the line?
Yes, I'm here, Mina. Can you hear me?
Yeah, I can hear you loud and clear.
That's fantastic.
Great. And Jackie, are you there on the line?
Jackie doesn't look as though she's got any audio.
Yeah. Okay, that's fine. We can get started with the next session. So welcome everyone back. We're now going on to our session 7, which is the launch of the new white paper. So this new white paper is called The New Era of Thinking and Practice in Change and Transformation, a call to action for leaders of health and care. And we've got Helen Bevan, who's going to present to us about what this new white paper is about and where you can find it. So Helen, I'm just going to move on to your slides right now.
Okay,
thank
great.
You. Over to you.
Thank you, Mina. Yeah, so we're launching this white paper today, you know, to fit in with the celebration day for Change Day. And you know what I'd say about this paper? It really is in the spirit of Change Day. And what we've done is that we've looked across the world at people who are leading kind of thinkers and practitioners around change and transformation. I reckon 95% of the sources are not health and care specific, but what we've tried to do is to take that thinking and bring it back to us. And it's about, you know, how can we make change happen at a faster rate and be more disruptive. But what it also is, this white paper, as Mina said, is it's a call to action. And, you know, it's a call to leaders of health and care to join this kind of new breed of healthcare leaders across the world who are like rethinking and rewriting how we go about change and leading change from the future, because, you know, we need to get different change results in health and care. So, and it's going to be released today. It's going to be released later on today, and we've got the website address there. And this afternoon, you'll be able to go onto that website and get hold of the white paper. And this is a little sneak preview of what it looks like and what the contents are. Do you know, I love the kind of the style of it. You know, kind of Banksy, you know, sort of slightly edgy, sort of graffiti aspect to it. So what we basically have in it is first of all an analysis of what is happening in the wider world of change. And I'll show you some of that in a moment, and what that actually means for leaders of health and care. What we then do is to say, you know, having looked at this agenda, what do we need to do differently and additionally? And we've identified 5 enablers, and I'll talk to you about those shortly. And then we have a call to action for leaders with 15 activities. At the end, and I won't go into them now, we've got 4 case studies, and I think that these illustrate the points that we make in the white paper really well. The first one is a fantastic local case study from Cornwall and the Isles of Scilly around how they've been able to use or be able to work with, you know, local people, different voices, diversity in a way that I think hardly anybody has been able to do in other parts of the country, and got really great results. The second one is a very, very nice story of where a first-year nursing student set up a movement around avoiding pressure ulcers. The third case study is our very own Change Day hobbies, and again, I think they're a really great example of a voluntary self-organising network of local leaders across the country. And then the fourth case study that we know and love is the School for Health and Care Radicals. You know, how do we teach change agents to rock the boat and stay in it? So what I'm not going to do in this session is talk through the case studies, but I am going to talk about some of the content in the paper. So let's talk, you know, like what is happening in the wider world of change. And what I'd say is happening in the world is that there are seismic shifts taking place. And you know, the main reasons for that is because we are in an era that is, you know, because technology has opened up, you know, so many opportunities for us, that we're living in a world that's much more social, we're connecting with each other, and also it's a world that's much more open in terms of our ability to gain knowledge and think in different ways. So what are some of these seismic shifts that we talk about in the white paper? The first is that, in general, change is becoming much, much more disruptive. So, in a sense, the solutions of the future are less small-scale incremental change, where there's absolutely a place for that, and it's really important, and much more big and disruptive changes. And the other thing that's happening is change is happening at a quicker and quicker rate. The second thing that's happening is that digital connection enables us to connect with almost anyone in the world 24 hours a day, very little effort, very little cost. And, you know, I just put this slide in actually because, you know, it just really made me think about how much things have changed, you know. So this is from Thomas Friedman, and he was looking back to 2005, not even a decade ago. And Facebook didn't exist, and Twitter was still a sound that a bird made. A cloud was a thing in the sky. 4G was apparently a parking place. I didn't know this, but LinkedIn was a prison. And applications were what you sent to go to university. And finally, Skype was a typo. And we can like laugh about this, but you know, these are things that in our world, you know, we see all the time, and we take account of, and it's just, and yet, you know, even 9 years ago they didn't exist, and I think it just shows how much things are changing. And this is, you know, great and gives us lots of opportunities, but it also creates a lot of additional challenges. And a lot of us have seen this slide already. But getting information off the internet is like taking a drink from a fire hydrant. And I'd say we are overwhelmed with unprocessed and raw data. You know, we don't know whether the knowledge that we're taking comes from a trusted source. We don't know how relative it is for us. The third shift is that work is becoming more and more complex. It's a global phenomenon across the world, and we certainly see it in our world of health and care, where, you know, just talk to anybody who works in hospitals on wards, you know, in terms of the sheer complexity and the acuity of the patients compared to even 5 or 6 years ago, or in primary care in terms of, you know, changing demographics, changing technology, and, you know, supporting patients who, I don't know, even 5 years ago would have been in a hospital bed. The issue for that, for us as change agents, is that what it means is that a lot of the techniques that we used before, you know, best practice databases, trying to replicate things from one setting to another, guidance and reference manuals, they just don't work as well in this new world. What also happens is that work complexity means that that hierarchical power is diminishing, because it's not about people doing discrete jobs that you can organize through command and control anymore. So in a sense, as leaders, as change leaders, we need to work with hierarchy but beyond hierarchy. And final thing that's happening is that changes are moving further and further to the edge of organizations. And again, what that means is that, you know, previously organizational development and change was happening at the core or the center of organizations. But the trouble is that if we frame or position our change activities at the center, then they tend to be kind of status quo incremental. And if we need really big radical changes, we have to position our change away from the center. And when we talk about the edge, it means actually having people who are leading change, who can like look over the edge and connect up with all sorts of other people all over the world, but also look inside the organization as well. So the change is, so the edge is where change is going. Now, this is interesting. This is actually an article that was in the Roy Lilly blog a couple of weeks ago, and I thought really made a great point. And if you look here on the right side of the screen, this is a survey that Bain, the management consultancy, carries out on a regular basis. It's been carrying out for the last 12 years. And it asks leaders from multiple industries, what are your favorite management tools? You know, your favorite tools for change and performance management. And what's interesting is that if you look back to even like to 12 years ago, okay, leaders are saying the same thing. So they're saying the change approaches and the tools that we used 12 years ago are essentially the same as the ones that we're using now. They're still our favorites. So our world has changed massively. Okay? Our ability to connect and learn and make change as change massively, and yet very often as leaders we're stuck, you know, with the same change approaches that we were using a decade ago. So, you know, part of the point that we make in the white paper is that many of the ways that we go about improving health and care were designed in a different mindset for a different set of circumstances. And I so see this in my journeys around the health and care system in the NHS, you know, that in a sense, the way that very often we're trying to manage some of our really big difficulties at the moment around cost and quality is by trying to create more control, more order, and reduce risk, when it's probably the opposite of what we should be doing. And I think I take this quote here from Gary Hamel, who is one of the leading influencers in the world around change. And he says, the organisations that survive in the future will be those that are capable of changing as fast as change itself. And that's how our organisations have to be. We need to become as capable of changing as fast as change itself. So, when we think about leading change in this new era, what does it mean? The slide's gone a bit funny here in translation, and there should be two labels on it. One of them saying dominant approach, and the other one not saying community, but facing the other way and saying emerging direction. So what I want you to do is to imagine that on the same level as dominant approach, there's another arrow facing the other way that says emerging direction. And what we did on this slide was to compare, you know, the dominant approach, which we see in, I don't know, 80–90% of large-scale change programs and strategies in particularly in the NHS, with this emerging direction. And I mean, just really quickly, in the dominant approach, you know, power comes from hierarchy. It's about positional authority. But increasingly in this emerging direction, power comes through connection, because those hierarchical levers don't work as well anymore. When we look at the dominant approach, we talk about the mission and vision of the organisation, you know, because in a sense what we've done is that we've tried to transform through a single organisation. But in the future, we're working with our patients, with our families, with communities, with other organisations in different ways. So we have to focus on shared purpose. Okay? In the dominant approach, we talk about making sense through rational argument, through data, and through, you know, objective planning processes. Whereas in the emerging direction, it's very much about how we make sense through emotional connection, because, you know, large-scale change, mobilizing, you know, lots of people, connecting, building relationships, people do that on the basis of emotions connecting with values. Innovation in the dominant approach tends to be come from the top of the organisation. So somebody says, well, we've got to take £67 million out of our base budget next year, and we'll do that through a massive innovation program. So, you know, we, the senior leadership, will kind of enable innovation. Okay, and that's important. But on the other side, it's about grassroots-driven, bottom-up, frontline, viral, patients, you know, patient and frontline staff-driven creativity. Okay, on the left-hand side, the dominant approach. The methods that we use for change are tried and tested and based on experience. And these are the kinds of tools that I've been using as an improvement leader in the NHS for 20 years. And, you know, when I think about Lean, I think about Six Sigma, I think about many quality management tools. You know, they're great. They're really helpful and appropriate, but they're not enough, because in this new open era, what we're seeing is we're finding, you know, ways to share ideas, to co-create change, to compare data, and we're connecting and learning in very different ways. The dominant approach is about, essentially, you know, much of the thinking is transactional. So when we think about compliance mechanisms, we think about regulation, we think about inspection, we think about performance management. It's about holding people to account for performance. It's transactional. Whereas with the emerging direction, it's, you know, it's relational. Relationships and connections are the basis of change. So what's important about this, we're not saying that the dominant approach is going to go away and be replaced by the emerging direction. I think the many levers of the dominant approach will be with us for a very long time. But in a sense, what we've got to be able to do, I think, as leaders of health and care, is also, you know, build the tools that are part of the emerging direction. And in a sense, we need to be able to operate in both worlds. So in our white paper, we have got 5 enabling themes, which are about, how we, how we adopt, if you like, the kind of change practices that will move us more towards the emerging direction here. And again, it's not either or, we link them up with the dominant approach. And here are 5 things. And so the first one is about activating the disruptors, the heretics, the radicals, the mavericks in our organisation. The kind of boat rockers who took part in the School for Health and Care Radicals. Because, no longer is the small-scale incremental change going to be enough. We need the brave people who will stand up and challenge the created status quo, who will think differently, who will open up new fields for action. So we're saying to leaders in health and care, embrace your disruptive innovators and heretics and make them part, give them roles in the mainstream change. Secondly, this whole issue about leading transformation from the edge, and we can think about the edge in different ways, and we talk about this in the white paper. So the edge might mean taking your improvement teams or your innovation teams and putting them at the edge of the organisational system, so that in a sense they're incubating new ideas and approaches, in ways where they've got a lot of space to do that, and they bring it back into the organisation. Leading transformation from the edge can also mean how I, as an individual change leader, choose to position myself and think. So in a sense, as a change leader, I want to be looking over the edge and linking up with all sorts of other people in other organisations and getting lots of new ideas, as well as looking inwards. Number 3 is about changing your story. And there's a quote behind this, which is change your story, change your organisation. Because again, many of the prevalent approaches particularly in the NHS, are about very diagnostic approaches to change, where we say, oh, we're going to transform our urgent care service or our urgent care strategy. So what we do is we look at the whole system and we say, let's analyse and diagnose what's going on, and then we create a whole set of work streams and hold people accountable, and we create a whole set of planned change interventions. There's this kind of power in that, and we've been doing it for a very long time, but it's not actually on its own delivering what we need to deliver. And what we're basically saying is that there's a whole set of new approaches to large-scale change, which are about actually bringing different voices into change processes, and getting people to connect with each other and have different kinds of conversations. And if we change our story, we change our organisation. Number 4 is about curating rather than creating knowledge, because we think that the change leader or the change agent of the future will need to be a curator of knowledge. And if we can link up, with other people, if we can seek out, new ideas and other people's experiences, if we can make sense of them for our own organisation, and take those ideas and make them relevant to us, and we can share them widely, then actually it's a way of creating knowledge for improvement that is much less resource intensive and more likely to deliver results. And then finally, our 5th enabler is about building bridges to connect the disconnected. And what we mean by that is that very often the way that we go about change in health and care is peer-to-peer change. So GP to GP, nurse to nurse, dementia champion to dementia champion. And there's real power in that, because people will be influenced to change by people that are like them. Actually, the number 1 reason why people will be influenced to change by people like themselves is an issue of trust. I trust somebody who's been through the same education as me and who's had similar kinds of experience, who sees the world the way I do. But this peer-to-peer change only takes us so far. And the problem is that we don't necessarily innovate, and we don't necessarily take our change very far when we're connecting up with people like us. So a really key job for us as change leaders is to actually build bridges, to be the bridges between people who aren't like each other. You know, how do I bring different people and different voices into change? Because it's by building bridges and connecting people and ideas and knowledge that aren't currently connected that we will get the most insights and the biggest innovations. So when we look at those 5 enablers, there's one big theme that like unites them all, that is like a golden thread through them all, and that's the issue around diversity. And diversity is such a key issue for the future. And you know, very often when we talk about diversity, we talk about it in the context of like human resources and making sure that we have a workforce that reflects the local community, and that is really important. But you know, when we look at all the leading edge approaches and thinking about large-scale change, diversity is the issue that underpins them all. Because unless we get different voices in, unless we can have different conversations, unless we embrace different views, dissent, disruption, and you know, the change isn't going to happen. And in a sense, what we're not going to be able to do is take like our existing group of health and care leaders, and all of a sudden they have like a mental conversion to a different way of thinking about change. It ain't going to happen like that, you know. It's about having change processes that bring other people in and enable different kinds of conversations and different kinds of ideas to flourish. And I really like this quote here from Idris Moore, you know, the basic, not so secret formula for building an innovation culture. And that's the kind of innovation culture we need in health and care to deliver our transformational goals. Is pretty simple. You know, embrace diversity, start to attract, retain, and promote a diverse workforce. And you know, do this before you start hiring consultants and rethinking your innovation process. There is no process that works without true diversity. And you know, the evidence on this is so clear. Every time when you put 2 teams together and one team is like a mega talented, you know, really, really clever group of people, okay, and you get them to perform tasks, and you pit them against a diverse team that isn't star performers, but has got those different perspectives and experiences. You know, the diverse team wins nearly every time. So this has to be a very, very big focus for us going forward. And final slide. What we do in the white paper is set out 15 actions for leaders that are based on, you know, our analysis of where we are and where we want to be. And you know what I'd say about this? It's kind of going back to that diagram earlier on that talked about the, you know, the traditional way that we do things and the emerging directions. And in a sense, this is about how do we balance ourselves as leaders and bring more of the strength of the emerging direction into the way that we're working. So I'll stop there.
Great, thanks, Helen. We've got a few minutes for questions. We're going to cut the end of this session a little bit short, and we're hoping to show the video that you produced while you can go off and get ready for your next session. But in the next 10 minutes, if anyone has any questions or comments, if you can just raise your hand, your virtual hand will unmute you and allow you to pose your question or ask comments, or just write it in the chat box as well.
Yeah, would love to get some comments. Yeah, would love to get some comments.
Some people's thoughts. It looks like anyone has their hands up right now. So maybe if we go to Pip and Rosanna while some people have some time to think about any questions or comments. So Pip, we're going to unmute you in a second.
Okay, hi Nina. Hi Helen.
Hi Pip.
Great, really interesting to hear all of that. I have a feeling that people were probably so engrossed in what you were saying that there hasn't been a huge amount on Twitter, but I think one of the interesting comments was about how we've got to stop our reliance on outdated tools and really find up-to-date and the latest approaches to change. That was one from Charlie Keeney. And I was also wondering myself about you talking about building bridges and diversity and the extent to which that could or should include interprofessional education and interprofessional practice. So I think that's, I think the other thing that people kind of connected with was your statement about the need for emotions to connect with values in order to bring about change. I think that's a really lovely reminder that we've got to always bear in mind the heart and the head.
Yeah, yeah. No, thank you for that. And I'm just, it's Jackie on now. Can we? Because I was really keen to kind of hear Jackie Linton's voice in this as well.
Yeah, I was just, am I on?
Hi, Jack. I can see you.
Oh, hi there. Hi there. Yeah, you know, one of the things I was reflecting on, Helen, is that we have just become, you know, the top in the trend, you know, across the world. The NHS is the #1 organisation in the world. So what does it take to be the #1 organisation in the world when it comes to change?
Yeah.
And it just made me reflect on some of the things that you were saying. What will it take us to be able to take on some of these new tools and new ways of working? Because there's something about it that is about having a belief in actually it's going to have an impact. And I think that that's an interesting kind of thought for me about some of the things that you were saying around, you know, using new methods. You know, that thing that you put up about Roy Lilly, you know, the Roy Lilly tool, and that we're using this, and there is a belief that actually this is going to have an impact. I think that is a massive question for leaders in healthcare, to really believe that this is actually going to have an impact.
Yeah, it's a great point. You know, the other thing I was just going to say is the reason why where it says 15 actions for leaders and certain words are in a different colour is because the whole thing is peppered with resources, and we've got I think there's over 100 references and you know, resources that we relate to. So the whole thing is kind of peppered with hyperlinks and sources of evidence around the things we're saying in it.
What do other people feel who are on the call about, you know, these actions and what they might mean to you as either as a change leader or as someone working in an organisation where you may be struggling with, you know, as a lone voice? I wonder if we could maybe ask somebody. Shall we be brave and just ask somebody direct?
Yeah, go on then. Let's see who we've got.
I wonder if we could ask. Tim Rawson. I see that you have a completely different perspective, maybe. Tim Rawson from the USA. Well, what's your kind of thoughts on this? And then I wondered if we could ask Jill Saunders. Jim Rawson. And maybe we could ask Jill Saunders as well.
Jim's been busy tweeting.
Okay.
We're just trying to unmute Jim. Just hang on 1 second while we do that.
In the meantime, Helen, could you repeat the question, Jackie? We've had a request from Damien on the web chat to repeat the question. You'd also like to answer.
I was just thinking about the 15 actions that are up there for leaders, and whether you're a leader of change or whether you're a leader, you know, of an organisation or have a leadership role, how do some of those actions feel to you in terms of, you know, your everyday practice and your everyday, you know, trying to make a difference and a change within your organisation? How do some of these changes or these points resonate? Oh, Jim's having audio problems.
Yeah.
But Jill is unmuted as well now.
Hi, Jill.
Oh, no. She's back on me.
Not doing very well. Oh, well.
Well, I think we have got to 12:10, and I'm just aware that we need to set up the next Google Hangout. So, Helen, it would be great if we can get you to start setting up the next Google Hangout. And what we'll try to do in the next 10 minutes is play your video that you just produced about the white paper.
Okay, so
we're going to try and do that.
This video, if it works, it's embedded in this document, and it's about the change leader of the future, and like imagining what the future change leader might be like. So if it doesn't work now, you can just play the link from the white paper when you get it.
Yeah, and we might be able to get the sound for sure working, but the video image might be slow on your computer, so just bear with us.
Okay, and I'll see you shortly from the Google HangOut in North Bristol. Brilliant. Yes. Thanks so much.
So
okay, bye.
The Google HangOut in North Bristol will be starting at approximately 12:20. Yeah. For those of you who want to take a quick break,
I'm going to do it.
In the 10 minutes, we'll say. Yeah, thanks, Helen. Bye. Okay, so the video will start soon, and for those of you who want to take a break, if you can come back in about 10 minutes, that would be great. Similar thing as last time, you're going to have to hit play on your screen. You should see it show up on your screen right now. It's a little YouTube video. So if you hit play, hopefully you'll be able to see and hear it. And I'll speak to you guys soon. Hi everyone, we're just getting the Google Hangout sorted right now. So basically what we're trying to do is have a Google Hangout in Bristol and then stream that Google Hangout to the WebEx. So just bear with us for a few minutes and hopefully we'll get the stream showing on the WebEx very soon. Oh, hi everybody, it's me again. We're just still waiting for the link to kind of show up on the screen. So actually, if you guys want us to, we can potentially play you another video. So if you want us to play you another video, in the meantime, can you put up your hand so I can see whether we should go and explore that option or not? Just raise your virtual hand. Jackie Linton says yes. I'm looking over at Paul, just to give you guys a little description of what's happening in Coventry in the meantime. We've got our technical team in Coventry, so I'm going to use this opportunity to give a little shout out to Paul, Cassie, Jeremy, and Arsha, who are all sitting in a room with me here. We're just making sure things are trying to run smoothly on our end. There's Paul. Hi, Paul. Thanks for your work today.
My pleasure.
Cassie, I'm going to put on your, do you have it? Cassie, do you have your video? You want to wave at everyone? Everyone can see Cassie? Oh, we can't see you. Yeah, hold on. I'm just gonna angle my computer. Okay. Got Jeremy here. Waving. Okay. Okay, so we're going to, in the meantime, we're going to get a video up on the screen again. So when it shows up on your screen, you just have to follow the same drill, which is press the play button, and it will be a change day video. So Paul, over to you to do that. Okay, it should be up on your screen now. Just press the play button. Hi everyone, just to keep you updated, I hope you enjoyed that little video if you watched it in Trafalgar Square. We had a little bit of a technical glitch with our Google HangOut, but for a little bit of, I was told, a technical crisis, but apparently it has been averted now, and I'm told that the Google HangOut will come on in about 2 or 3 minutes. So just bear with us, and hopefully it'll show up soon.
They've already started. That's the problem. They're not Yeah.
Hi, everybody. Okay, we've got the Google Hangout up on the screen now. Again, you're going to have to follow the same procedure, which is just to click the play button on your own screen, and you should be able to follow the Google Hangout live. Okay, going back on mute. Hi, everyone. I hope you were able to hear, see what was happening at the Google HangOut in North Bristol. We've got our next session, the Guardian Service 1 Year On. Jackie Linton will be chairing that, and we'll be joined by Ashley Brooks, and that's due to start in about 2 or 3 minutes. If you want to take a really quick break, now's your opportunity. Hi, Ashley. I just want to do a sound check with you. So can you just respond? Yeah, great. We can hear you. Excellent. Okay, so we'll talk to you in a couple of minutes. And Jackie, okay. Can I do a sound check with you as well? Are you there?
Hello, can you hear me?
Yeah, we can hear you as well.
Okay, I'll be back in just 1 minute.
Okay, sounds good. Talk to you both in a minute.
Thank you. Bye. Bye.
Okay, great. Should we get started with the next session then? So Jackie, over to you.
Hello, welcome back to everybody from our Google HangOut. And we're now going to listen to Ashley Brooks, who is patient and staff champion, and working with Barking, Havering and Redbridge University Hospital. And they're celebrating their first pledge that they made in 2013, which is and it's now the anniversary of the gardening service, which they launched as their part of their pledge for 2013. So Ashley, welcome. It's really good to have you on the call. And you've got about 10 minutes or so to share with us, and then we're going to have a conversation, if that's okay. So over to you.
Okay, thank you, Jackie. And hopefully everybody can hear me clearly. First of all, thank you for inviting me to take some of this time up on this great day of celebration, and happy 4th of July to any American brothers and sisters we've got on the line. I was asked to come on the line today and tell you about what it meant to us here at BHRUT Hospital Trust in East London, what Change Day meant to us, what we've done about it, and what the future holds. So if I go firstly back to before Change Day, and when Change Day wasn't even spoken about, and I started speaking about Change Day with Jackie around about the November 2012. But before that, to try and raise an idea and get it quickly actioned in the NHS, especially in a busy hospital trust as BHRUT, it was a very, very slow process. It still is in some respects, but a very, very slow process to get any creative idea moving quickly through a system. And so when we first started talking about Change Day and what it was and understanding what we could do with it, and at the beginning we didn't really understand what it was being asked of us, but we very quickly saw an opportunity that Change Day was presenting us, and it was presenting us with this, that we could as a trust put a stake in the ground on that day, on that first Change Day, and start talking about the positive sides of what we do, because it's very easy and we're surrounded by the negatives of what we do. But Change Day gave us the opportunity to say, hey, look, we're good at this stuff, we're really proud of what we do, and we're going to pledge to do more of that. And so we started to gain momentum early on in sort of December and then January 2013. And we put a team behind it to think, we've got 6,000 staff here. How can we disseminate the message? How can we get people motivated to do and say and pledge positive things to their colleagues and to their patients? And over the course of a couple of weeks, certain things were pledged, and we carried them through. People were pledging singly, I'm going to smile more, I'm going to talk up the hospital, I'm going to talk about research more, you know, I'm going to help my colleagues when they look under pressure, and all these great things that we are allowed to pledge. But as we started talking, we wanted one overarching, something different, something that had power over and above these great things. And it was discussed that, you know, in light of reports coming out about mid-staff, in light of the culture of the NHS of whistleblowing and raising concerns, or people, you know, not raising concerns, as it were, we were thinking about how can we impact on that agenda. Let's learn from the Francis report. Let's use Change Day. Let's use the pledge system to try and address that problem. And so we did. So what we did is work up an idea, how different should it be? How different can we be? Pledges, Change Day, gives you permission to do something different. And, you know, that's exactly what we saw in it. And we were energized by Jackie and Helen and the team who were, you know, heavily involved in Change Day 1. And they were literally saying, it can be anything you want it to be. There was no boundaries, no rules really, just anything you want it to be, it can be. So we really took that to heart. And we created something that has never been done before. And just, I'll say it again at the end, if it wasn't for Change Day, if it wasn't for the pledge system, attached to Change Day, this idea would never have come off the ground, or it would have taken 4 or 5 years to possibly get off the ground. So what the ask was, and it was asked of me personally, was if I would begin design the first truly independent, patient-led, concerns whistleblowing, issue-raising service within the NHS. And so we worked that up, and I did a lot of work in the background, and I interviewed people who had whistleblown in the past, quite high profile. I interviewed staff of the NHS around the country, all different bandings and levels, and pitched them this simple idea, and this was the pledge of Change Day 1 for us. Would you use a service that is completely confidential, has your anonymity at heart, where you can come and just talk about your concerns, raise issues, and you know that there's no vested interest in your career, no vested interest in where you work. We don't even need to know your name at this moment in time. Just come and talk to us about it. Just let off steam. And everybody that we asked around the NHS said they would absolutely use that service. So we worked the service up based on our pledge, and on Change Day 1, 2013, we had many hundreds, if not thousands, of pledges across the organisation, and we were really privileged because Jackie Linton, who was one of the leads of NHS Change Day, came to visit the hospital, and that was a big boost for the staff here to have someone of that sort of stature and that national level to come and help us. But the pledges were thick and fast. The pledges meant something to everybody who were pledging them, and we've carried a lot of those on. But the one that has stuck, the one that has gained momentum, the one that is, if you like, the one we're most proud of, and I think NHS Change Day should be most proud of, is the Guardian service, because that's what we called it, and that's what it still is. And we launched the service. It took us time to work up the governance, the structure, the reporting around that. And we launched on the 27th of June last year. We've just had our first anniversary. And so far, we've had 103 people come to visit the Guardian service. Now, that might sound an awful lot of people. That averages out about 2 a week. But if you look at the year previous, the calendar year previous, not one person used the official trust whistleblowing policy, not one. And so far in a year, we've had 103 people come, and we've had some very serious concerns, and we've had some not so serious concerns, but we've helped everybody. And the staff survey here has absolutely improved when it comes to their confidence in raising concerns. And we can only put that down to the Guardian service. It's absolutely been successful. It's just been commissioned now for another year. It's going to be embedded into the trust-wide policy. We're making a film about it, and we're really proud of it because it's really worked. Every single person we've helped has said thank you, and it's been a great mediation situation for the people of this trust. But if we can get back to NHS Change Day, the second one, NHS Change Day 2 this year, we again were supported by Jackie Linton and her team, and we put on a big show. We made a bigger event of it this year. We had far more pledges, and we had almost everyone in the trust doing something on that day for the betterment of their colleagues and patients. Again, this only can happen, it seems, when there's a momentum of social movement, social media, social coming together to say, do you know what, on that day, it's okay if you do this. It's okay to take your own leadership and empowerment and say, I'm going to do this. You're okay, run with it. And no one can say no to you because you can badge it, you can cloak it, and you can hang on to Change Day, and that gives you permission. And I've seen many people in this trust use that permission and do some great things on Change Day. And what's next for us? Obviously, the Guardian service is going from strength to strength. We're going to be doing an online version this year as well, and so we're growing the model. But in this trust, we use the pledge system in every workshop we do now, in everything we do. We've got a huge OD piece, here, cultural development called Pride, and in it we pledge to each other what we're going to do. And NHS Change Day has gave us that idea, gave us that gift. We pledge to each other what we're going to do for each other. So long, tall and short of it, NHS Change Day was amazing for the NHS, but I've got to say it was amazing for BHRUT. It's a trust that's under fire at the moment. We're in special measures. We've got a lot of challenges, but NHS Change Day gave us confidence in ourselves. It gave us some respite. It gave us belief. And all I can say from the staff here, the 6,000 staff and myself, thank you to Jackie, Helen and the team for allowing us to be what we can be and giving us that confidence. How does that sound?
Sorry, thank you, Ashley. Sorry, I was talking and I was on mute still, but thanks very much for that. That was a really passionate and kind of heartfelt presentation, and really, really interesting. I mean, I've got some questions, but I just want to ask if anybody else has got any questions for Ashley. I can see Jeanette Williams saying that the Guardian service sounds amazing. And I wonder, Jeanette, whether you could sort of just post in the chat, why it sounds amazing to you. But I just wanted to, is there anybody else got their hand up asking questions? If not, I will go straight to just ask Ashley a couple. No? Okay. I mean, I know the Guardian service very well, actually. But some of the things that really kind of struck me as you were talking was you mentioned a lot about this giving permission and not being told what to do. How important was that? Because that sounds really simple, but how important was that to you actually making this a successful thing?
I think, Jackie, it's the key to it at the beginning. Not now, because it's gaining momentum, but at the key to it, that's when I was, if you like, trying to sell it into the organisation, people's focus was elsewhere, obviously, at the time, because there's, as I say, challenges. But that permission, when you can see the penny drop in someone's mind that, we're not used to being given our own empowerment. We're not used to being given, look, it's your NHS, it's your department, it's your ward. Do something. Do something for the betterment of your colleagues or patients. We're not used to permission, Jackie. And we're still not. But the more we talk about it, the more we say, do you know what? You can come in today and smile more. You can come in today and, and talk to patients more. You can come in and treat your exec members with more respect. You can. People aren't used to permission. People aren't used to, you can do this. People may be a bit scared of taking their own initiative, because it might go wrong. We're defined by our problems, never by our achievements, Jackie. And that is uncomfortable to some people to realise that.
Yeah. The other thing that you said, Ashley, was this would never have got off the ground if we didn't have that sort of momentum. Could you just tell us a bit more about that? You said, it might have taken 5 or 6 years. So why do you feel that?
I think when we were having our initial discussions here, we were, if you like, we were searching for something big. Everybody was coming up with, all the good stuff. I'm not decrying anything, not more important than others, but we were coming up with kind of like the generic pledges that you see that are very popular. But that's a big tell in itself, that if lots of people think smiling more at patients and their colleagues, right, then there's work to do there. People want that if there's lots of them saying it. But we were looking for something big that we could say that's an overarching. Now, from my experience in the NHS, I'm national patient champion. It's still an uphill struggle sometimes to get a point of view across or a feeling. And for me to come to a hospital trust and say, I want to introduce an independent whistleblowing service led by me, a patient and others, it's completely confidential and you've got to trust me on that, then that would never have got off the ground, Jackie, not in a million years. Or it might have taken me 5 or 6 years to get someone to listen to that. But because of Change Day, because of the position it put me in personally within this trust, it gave me permission and it gave other people permission to say, yes, okay, we'll do it. We'll go with it. We'll trust it. And we can, if you like, blame Change Day if it doesn't work, celebrate Change Day if it does. You know, there was a certain risk, you know, so, you know, it enabled, Jackie, it enabled us and me to be credible and do it.
Yeah, fantastic. So I'm glad it works on both sides.
Yeah.
In that sense. But I was really struck with that comment really, and that kind of leads me on to, you know, the other thought, and you mentioned it again just now, and Janine has just sort of mentioned it in her chat as well, that, you know, this idea of if we just go straight now to the actual Guardian service itself, this idea of taking something really simple. So Change Day is a simple tool. It's not complex, it's make a pledge. It's really simple. But actually what you've done is you've applied it to a really, really complex area. Very, very complex. And I mean, I've shared with other people about the Guardian service, and I know other people have heard me speaking about it. But for a patient to be a patient champion, to be put in charge of that service, I think is phenomenal for any organisation to be doing that. And so I just wanted to get your views on, you know, how does that happen in the NHS? We've got a patient champion running a whistleblowing service. You know, tell us about how that's possible.
Well, it's a really good question, Jackie, and it's I think the wave of acceptability that's coming over the NHS over the last 2 years, that it's okay to have patients seen as equals, and you know, I've had that struggle, as you know, for 12 years, and only over the last couple of years have I personally been starting to be accepted into, you know, higher circles, if you like. But within this environment, don't forget, we're under a BHRUT. We have been for a long while. We're under scrutiny. We've got a focus on us. So any decision made here has to be cast iron. You know, we can't make decisions willy-nilly. We're under too much scrutiny. So it lends even more importance to the fact that certain individuals in this trust said, you know what, let's trust our gut feeling on this. This seems right. It seems to be the right thing to do. And there was two really big, if you like, personalities within the trust that really supported it, and that was Dame Donna Kinnear, whose idea it was originally, who was head of governance at the time, and our director of nursing, a lady called Flo Panel Coates, who both of them absolutely, as exec level, said, let's go with this. This seems right, and you know, let's give Ashley the chance, and let's give this trust the chance. And so, Jackie, it's a really good question. You know, I find myself in situations that I never would have dreamt in, for even 5 years ago. This morning, I'm on stage interviewing Sir Bruce Keogh and Jane Cummins. That's never happened before. The Guardian service has never happened before, and we are seeing coming to fruition. No decision about me. Patient-centred care. We are seeing the signs of it actually happening.
Well, I think it's absolutely fantastic, and I applaud, you know, CR Queen's Hospital.
Yeah.
I applaud them really for you know, being brave, being courageous, and doing the right thing. And I applaud you as well. And I think somebody asked me recently, you know, in terms of your skills, what does it take, you know, to be able to do that? And I think that it says something about you and how people trust you to be able to do that. So
yeah.
I think it's fantastic. Is there anybody else who would like to ask Ashley a question? I know I've taken up, but they've been a little bit shy this afternoon. So, is there anybody else who wants to ask Ashley a question or make a comment? thanks, Jeanette, for your comments. Jeanette was saying listening into action methodology and supporting staff to make changes to benefit patients and staff. And you were just speaking to a member of staff to look at this very idea in their trust to see whether they could actually make it happen. And I think that this would help a lot of organisations, and I think it would build a lot of bridges as well. I think between staff and patients and so forth. Actually, I can't see any more hands raised. Is there anything on Twitter or anything else some of our organisers want to comment on? Tips or Rosanna?
Hi, Jackie. I think that the Twitter themes are kind of staying quite stable and quite similar, but I think people are obviously incredibly impressed with Ashley's work and the Guardian service, which sounds like it's making huge changes. And I think a few people have actually been posting in Twitter talking about their own Change Day pledges, so it's quite nice to be reminded of many of the things that other people are doing. So I think those are the main things, really, and a little bit of kind of preview of what's to come. People have started posting about other talks and events that are going to be happening this afternoon and this evening, so it's quite nice to have a little bit of a trailer of the tweets that are in store for us. So I think that's about it from Twitter now.
Okay, thank you. Well, before you go, actually, I just want to say thank you. And just to give you the last word, really, on just summing up, what we'd like to say.
Okay, Jackie, all I can say is thank you for letting me come onto the line and brag about the Guardian service, because we're all very proud of it here. But I'll leave you with this. It couldn't have happened if it wasn't for Change Day.
Thank you. Thank you. That's fantastic. What an inspiration.
Okay.
Shall we give Ashley a round of applause on if we just use the feedback and just to say a big thank you to Ashley. I know you can't stay, or I think you can't stay, but just a huge thank you. I hope it went well this morning.
Yes, it did.
With your interviewing. Yeah, that's great. Okay, thanks a lot.
Okay, thank you, everyone.
You'll give Ashley a round of applause. Thanks.
Bye.
Bye, Ashley.
Bye, everyone.
Bye. Bye. Great, thank you. So we're going to move on now to talk to Jill Phillips, who is the Director of Nutshell Communications Limited and who's with Ken Howard. And their pledge was about enabling people living with dementia. So I'm going to hand over to Jill, and I think you're going to start us off, Jill, and then we'll have some questions. They're really great. People can think about a question that they might want to ask, and you just pop it in the chat, and I'm more than happy to ask that question on your behalf if you want me to. Okay, so over to you, Jill.
Jackie, we're just starting with Jill's video, so we're just getting the link up there right now. That's what the delay is.
Great. Okay, that's no problem. So we're just waiting for Jill's video to go up, and then we'll start in just a few seconds.
Same drill here, guys. Click on the play button on your screen and you should hear the video.
No.
One more connection that we wait to say.
Hello. So are we live here?
Yes, we can hear you.
Oh, you can hear us. Okay. It's Jill here and Ken.
Hi there.
And everything that we do around Who Shoes is informal. So we thought we'd do this WebEx as an informal conversation and see how it goes. So we're here live in Coventry. Can people hear us? So this is our pledge. You've seen the YouTube video, hopefully, and this is a lovely graphic that Sarah Spiz did for us. And I'd like to talk about the kind of global side of our campaign, and Ken's going to tell you more about the more local side of our campaign, but really it's a kind of pledge within a pledge. So the global side of our campaign is around the Dementia Alliance International, fantastic global network of people who have got dementia themselves, and everything that they do is by, for and with other people living with dementia. And I'm very privileged that they've asked me to be an associate and to help support people, and obviously that's linking in incredibly well with my work with Ken Howard. So I went to Puerto Rico, and as part of our campaign, which seemed incredibly ambitious at the time, but since we made our campaign pledge back in March, I've presented 2 presentations at the World Alzheimer's Conference in Puerto Rico, and co-presenting with my Australian pal, Kate Swaffer, that some of you might follow on Twitter, and other people living with dementia, and actually met a lot of these people in real life. And we've got a slide that shows you the logo for the Dementia Action, the Dementia Alliance International. Can we show that slide? Oh, that's the Puerto Rico conference, which was absolutely brilliant, and so much energy at that conference with all the young students bringing music and dance in. And I was just sorry that Ken couldn't be there with me. So perhaps, Ken, you'd like to tell us about the kind of local aspects of our pledge and the key ideas that you've got around diagnosis and how that could be different.
I firmly believe that the 15, 20 minutes following your diagnosis are absolutely crucial, and they can change the rest of your life if it's helped with properly. As in the video you've just seen, I firmly believe that you should be allowed to spend quiet time, if necessary, or talking time with somebody who's living well with dementia, so you can see firsthand that it really isn't a mental death sentence, that you can live well and you can do things. You can talk to them about important things like their home life, what they do, how things work, where they go shopping, what they like to eat, where they go to drink, what football team support, but definitely not about dementia. That shouldn't really be included in the conversation. It's there purely and simply so that people can get an understanding of what they will still be able to do for a long time if they're proactive about their condition.
Fantastic. And specifically, Ken, what happened to you? One of the things that, quite honestly, I'm most proud about in terms of my work and the work we've done together. I mean, sometimes people say, well, what are the outcomes? And sometimes outcomes like the starfish can be very small. And I think the day that I introduced you to Chris Roberts at the NHS Expo was pretty special.
Yeah, that was an amazing day. The whole day was wonderful. But the high point for me was when I met Chris. I've told Jill previously that I've never really been introduced to anybody who were similar to me with living with dementia. And so she introduced me to Chris. Now, Chris is a great guy. He is absolutely fantastic. And he's got similar interests to myself, similar age to myself. Obviously the same condition, although it affects us both in very, very different ways. And we formed this instant connection and bond. And it was amazing. I found myself talking about quite intimate things with him and he with me. To do with our condition that we find difficult talking to, even with our partners. And at that point I thought it would be absolutely fantastic if this same opportunity was given to everybody who received a diagnosis. And so as a follow-on to the other work we're doing, we're trying to create this situation as well.
That's brilliant. And I think in terms of our slides, which are probably getting a little bit out of sync, the next slide is the Dementia Alliance International. So if we could have that one, please. And we've talked about the fantastic link we've got with them, and Ken's starting to get involved in webinars via Zoom, and we're having a few problems with technology.
Oh yes, always. And me, of course. It's a huge thing. Talk to people who are extremely well known when you're joining a new group and knowing the group dynamics and how to go about it. So my first session with them is purely listening. Next time I will join in properly.
And I think that's not a bad way to join any group. But you know, I want Ken to know that he's got as much to contribute as anybody, and incredibly inspired by him. So our next slide, I think, is a photo of Chris and Ken together at NHS Expo, and myself and my lovely colleague and friend Dorothy, who is one of the best Whooshoes facilitators there is, and actually is here in Coventry, but not here today with us. So in terms of kind of the impact that we're starting to have, we've been doing some workshops down in Kent around dementia-friendly communities, which I'm absolutely thrilled with, and particularly the way it's been kind of handed over to local people, because for me it's all about the assets in the room. It's about enabling people to take power and control and do things for themselves. But we'll tell you more about that perhaps in a minute if there's time. But someone from the National Alzheimer's Society came along to our last workshop, and I think for both of us it's quite exciting potentially, because Ian McCreath came, and he came because he was very interested, and I'd already met with him, and he's going to be asking to run some sort of pilot Whooshoes project with the Alzheimer's Society, which is exciting. And also he was very, very interested in your pledge, wasn't he, Ken?
Oh yes, I think that would be absolutely fantastic if they looked at it, maybe piloted it, because the Alzheimer's Society is the biggest organisation really dealing with dementia, and they have amazing resources, fantastic people, and a whole raft of volunteers who are living with dementia, so they're ideally placed.
And we've been taking forward our at all our workshops, we take every opportunity, don't we, Ken, to tell people about the NHS campaign and the pledge.
Oh yeah, very, very loudly.
Very loudly. Until people get fed up. And also inviting them to make their own pledges. So I think the next slide is one of our workshops in Kent with somebody, a council, I think it was, standing up and making a pledge. Have we got the next slide? And this guy, lovely guy, come along to 2 or 3 sessions, and we've jumped on now. This is okay. So this is our one of our workshops in Kent. We have people there attending from the police, from local shops, from the WI, and we set out initially to make a graphic record of just the initial event, but the local people decided, Alison Waters and Sandra Springett, who've been absolutely amazing, decided that they wanted to learn graphic recording, and they produced a record for every session that we did, and are now using Prezi to kind of drill down to see what outcomes we're actually delivering against what people said needed to change. And what do you think about the graphic recording, Ken?
I love it. I have incredible difficulty now with reading, and obviously writing as well. But the images in a graphic recording, I can read and I can understand. And I suspect it's probably similar for an awful lot of people who are living with the condition like myself. And maybe there's a whole new method of communication there that we didn't know about.
The next slide shows Ken actually at one of the Whooshoes workshops. So I love having Ken there, but I like to have everybody living with dementia, carers, get them sitting around the table with the chief executive, get them sitting to, as it happened in our workshop at NHS Expo, Ken, Becky Mulby from the University of Leeds Innovation Centre had a wonderful chat with Ken, and Ken had no idea who she was. It's just an interested person.
Well, yeah, I mean, that's the glory of Whooshoes, the fact that you will sit next to somebody and it's irrelevant who they are. There's no badges, no titles. You're just people. And all I knew was he was a very dynamic, interesting person that I enjoyed talking to.
So again, we'll come back to her in a minute. So I think I've got slides in different places. But so here's Ken at a Whooshoes workshop. What does Whooshoes mean for you, Ken? What does it actually bring into your life?
Well, it gives me a voice. It allows me to speak and be listened to. People at the sessions, they listen to everybody, so obviously they listen to me. And it's fantastic to have this forum. And there's no hierarchy. Everybody is totally equal. And the game forces even quiet people who would rather sit and say nothing to talk. So everybody has to have a voice, and which is wonderful.
We talk about some quite difficult subjects, don't we?
Oh yeah,
fun, but
I mean, it's a very light-hearted approach, which means that you can approach difficult subjects without getting too upset or carried away with them. But it doesn't mean that the core message is treated like that.
And I'll come on again to fantastic opportunity we've got later in the year together to deliver a short session to the European Alzheimer's Conference. It happens to be in Glasgow, but I'm absolutely longing to introduce Ken to Helga Rohrer and other members of the European Working Group of people with dementia. And Helga's been a fantastic champion because she sees the tool and the approach as authentic and like Ken, really about listening to people and people having a voice. So, for example, at the conference in Malta that I did with them last year, we had Jeremy Hughes from the Alzheimer's Society sitting alongside Helga and other people, whoever they were in that particular group. I was going to say sitting around the table, but actually they were the table without the table, because it was actually pretty oversubscribed, which was good fun. So we've got Ken there at the workshop. We've talked about different things. Perhaps we can move on to the next slide. Now, I don't think the audio is going to work, is it, Paul? We could try it. This is a card taken directly from...
Sorry, I had to unmute myself. I'm running it through my desktop. If the sound would have played, it would be playing now. Unfortunately, we can't hear it, and no.
That's okay. We can live without sound. We have lots of things go wrong, don't we, Ken?
Yeah. Chaos is part of the game. This is part of the Who Shoes tool, the electronic version. And what we do is to take the voices of real people. Ken's got some cards in the game. This is my mate Kate Swaffer from Australia. But we also bring in managers, care providers, frontline staff who are colour coded and all saying quite powerful scenarios from their own perspective. So I'll read you this one, and imagine it's with an Australian voice. I want to make my own choices. As someone living with a diagnosis of younger onset dementia, I want to make my own choices. I don't want to go into a care home and be made to do activities that I hate, things like bingo that I've never played before. My biggest fear is that I would then be given medication being difficult if I didn't agree. Now, in terms of how that's used within a Who Shoes workshop, there's all sorts of levels there. You could talk about how people would feel themselves going into a care home, what personally they might hate, the fact that it's all about choice and control, and actually, if you didn't want to do things in the first place, then why would you want to start doing them just because you're in a care home situation? So perhaps you could tell us, Ken, about your sartorial clothing shorts yesterday. Yeah. We were privileged to be included in something at the barbecue yesterday, which was name dropping, which was a fantastic experience.
Name drop away.
And I was encouraged, or should I say bullied by Jill, into taking part in a Pecha Kucha session, which is awful. It is so difficult to do, but ultimately it's fantastic. I'm sure it was invented by the devil.
That wasn't.
No, I'm sorry. It basically is where you have 20 seconds to talk about 20 slides, and I'm afraid I tend to waffle, so it's very, very difficult for me to get the timing down. But it seemed to be very well received, and people enjoyed our session, and they had an opportunity to see what the new dress code is going to be for all conferences next year, as I was modelling it.
And Ken was there in his shorts and promising us that if anybody tried to make him wear a suit on a hot day in June, there might be some challenging behaviour. And I think the key message behind that was just around choice. And if Ken's always worn shorts, then why would he suddenly wear what somebody else chooses for him to wear? So we've probably gone on too long about that. And if we go on to the next slide. So we weren't able to take, this was at NHS Expo. People might like to type in who came along to the Who Shoes workshop, because we didn't happen to have a photo of Ken and Becky, but we did snap these rather eminent people. And extra points if you get the guy who's got his back to us, because he's an important person in dementia circles. Have we got any prizes, Ken? I'm not sure.
Oh, I don't know. There might be sweet.
So, what's the next slide? So this is important. This is a graphic that was done at the beginning of our West Kent Dementia Friendly programme, so a programme of 16 workshops. And Sandra Springett in particular and Alison Waters have been on a Prezi course that was completely unexpected at the beginning of the project, as was the fact that they did graphic recording for all the sessions. And I don't know if you've come across it, but perhaps you'd like to tell us about Prezi as a way of drilling down into, I think perhaps if I just say we're picking out key things on the graphic and trying to link them with what outcomes we're actually having and what impact we're having, but you love it as a way of recording, Ken.
I think Prezi as a way of navigating around. I think Prezi as a way of navigating around. Image driven. It's all and so it's driven. It's very easy, and so it's very easy for me and people like me to use it. And you can navigate through a presentation by using the images. And you have menus under menus and menus, but as they're all images, it's very, very easy to navigate, and it's so effective. And it looks very slick.
And we're doing a lot of other as well, aren't we, Ken? So I think if we go on to the next slide, it's about quality of life. And perhaps Ken could tell us just a few things in terms of other things that you're doing alongside as part of the work that we're doing together. So things like the films we've made.
Yeah, in absolutely really symmetrical. I mean, I'm going to say encourage, but I mean bullet. Me into making 2 small films, which was quite an experience, very, very enjoyable. And she encouraged me to write up a blog for her in shoe sessions, which was no mean feat because I'd actually given up on writing. But I managed it, and it seems to be quite well received. I'm quite proud of it. I created all of the images myself because I was assured that if I carried on using the downloaded images off the internet, I could get them copyright infringement. So I spent the next several weeks
and so could I.
Creating my own. Jill got me onto Twitter. I struggle with Twitter. It's very, very difficult. I find it like whole conversations, but I do like to make comments and be included. And it's a perfect forum for me because all the messages are quite short, so I can read them.
And really our network, I think, is the key thing through social media. I just thought it was such a shame to have someone like Ken, and I could go to an event and talk about Ken, people on the day would see him. Through social media, you're building your own network, aren't you, very powerfully?
Yeah, absolutely. And the friends that I'm making now are really wonderful because they really don't mind, but I can't remember the names when I see them there. Which is fantastic, really, because I don't know the names.
And I think in terms of our myth-busting program, the fact that Ken is doing all this communication and hopefully at least keeping neural pathways open and
creating new ones.
Yeah. And having some fun.
Yeah, and I am trying to design a website which is going to be truly event-centered. And I want to start with a pilot and ask people to contribute to it, make corrections about things I get wrong. So it can, through mutual cooperation, become something that is quite useful.
So we enjoy social media. I've got my In My Shoes guest blog series. So if anybody listening in wants to write a blog about any aspect of health, social care, dementia, that you're doing really good work in, then have a look at some of the blogs in the series and perhaps consider writing one. We've also set up a Pinterest board and using HeiQ Deck and all sorts of imaginative things. So if we go on to the next slide. So this was supporting really what Ken's just said. We always get out to think the slides, but who cares really? That's such an important one, staying involved in life and all the wonderful things you've talked about. So can we have the next slide, please? That's us on Twitter, so please follow us. I'm sure people doing the chat could link in and send us 1 or 2 tweets. Would be great, wouldn't it, Ken?
Yeah, I can't promise to answer you, but I'll do my best.
And enjoy them.
Yeah.
So next slide. So in terms of, we're now getting lots of opportunities to spread the word about our campaign pledge. This was a wonderful opportunity that I had earlier in the week to meet Samantha Jones, Chief Executive of West Hertfordshire, NHS Trust. Lovely, warm person, very, very open and transparent. And here we are, of all places, so honoured to be standing outside and visiting the Kate Granger suite. Lovely in all respects. And we've mentioned one or two other opportunities that we've had, such as yesterday and the Alzheimer's Conference in Glasgow. And we're hoping, but we don't know yet, to have a session perhaps at the Quality and Safety Forum in London next year, and to talk about our NHS Change Day campaign, and hopefully some more outcomes by then, because it's next April. It's a long time, isn't it?
That'd be fantastic.
And to you, Ken, and that's an interesting point. That's a long time ago in terms of the urgency of your...
Yeah, I mean, one of the things that happens when you are given a diagnosis like that is that everything I mean, I know one of the now today. I know now today I'm fine and I'm doing really, really well. But I honestly don't know how next year is going to be, and I don't know what I'm going to be capable of doing next year. So I truly hope that I can do things now and maybe make a change for other people, make their lives better before it's too late for me.
But in the meantime, Ken is now Hushi's workshops on. Can we have the next slide and give people an idea? Here he is.
Yeah. That's actually in the States on Bike Harley when I went to Bike Week quite a long time ago now. But I haven't been very keen on having my photograph taken, and I've managed to avoid it for a long, long time till very recently.
Sorry about that.
No problem.
This is the one of Ken's films, and if people like to look, I've published a blog that I've been holding back really for the NHS Change Day celebration today. Very important part of Ken's story about how he basically recovered. That's the word, isn't it? After your diagnosis, got your life back.
Yeah, I mean, it is possible. My message is one of hope. I mean, and really you can. You need help and support by other people to fill in the gaps that you have. But if that happens, there's no reason at all why you can't have a long, active life and extend your thinking life, which is what you really want to do.
And I think that runs into the next slide. Very key message from Ken that diagnosis of dementia doesn't have to be a mental death sentence. And you built that into your film, haven't you?
Yeah, I mean, it is everything I'm doing, trying to make people realise that, because when you're actually given the news that you do have some form of dementia, it does feel as if you've been given this mental death sentence. And all of the media and everything else goes to reinforce that. So we really do have to change an awful lot of things to make people feel better and empower them enough to actually take a more active role in their own lives.
Yeah. So if you could go on to our next slide, please. Talk amongst yourselves, Ken. There we are. So I think we've got Ken there. It was Ken's birthday last week. Happy birthday, Ken.
Thank you.
And the swinging 60s start here, I think, don't they?
Life begins at 60.
And that was a very nice gesture, a nice touch by Sandra, who did that wonderful graphic at our workshop that we did together in Kent last week.
I was incredibly embarrassed, but it was lovely.
No, you mustn't be embarrassed. If people want to play, there's a children's book game called Where's Wally. If you look closely at our Get Graphics, they started to become Where's Ken, didn't they?
I was slightly larger than Wally.
So I think probably we've completely overrun. It's time for some questions and answers, is it? So we'll have to get back to them.
Oh, hello. Jackie back here. Can you hear me?
Yes, we can hear.
Yeah. Okay.
Can you hear Ken?
Hi, Ken. Yes, hi, Ken. Hi, Ken and Jill. What a fantastic presentation. Thank you to both of you. And you made that sound so effortless, and the work that you do just sounds so effortless, as though you kind of just get up in the morning and you go off and do all these amazing things, and you just go back home and then start another day. It just was absolutely fantastic. Thank you so much to both of you. But
thank you.
I know, yeah, you just made it sound so easy. So first of all, I'll just check whether there is anybody who wants to ask a question of Jill or Ken. I have a few questions. But
if I could say, Jackie, that Ken calls us the Pete and Dad of social care and health, and I prefer that to Laurel and Lucy, really.
You're absolutely amazing, the pair of you. Fantastic.
We get on well, don't we?
Has anybody got? Yeah. No, you can see, and I can see the chemistry and the kind of just the connection is just absolutely fantastic to listen to both of you. It really is. Is there anybody who wants to ask a question? Oh, I've got Pippa Kelly. Are you raising your hand?
I am, but can you hear me?
Oh, yes.
Yes.
We can. Please go ahead.
Okay. Actually, I haven't got a question, but I just wanted to say that I have met Ken and Jill, and I think they're the most fantastic team. I think they complement each other perfectly, and I think that Ken is so much more than just an ambassador. He just shows absolutely that it's possible to live extremely well with dementia for some people, and I think his ideas are brilliant. And so Ken he's just a walking example of how if you turn to people living with dementia, you will get probably the best answers.
Absolutely.
Thank you very much.
And I think, for me, I suppose my little company, calling it originally Nutshell Communications, and it's kind of evolved and become Who's Shoes. But I've kept the company name because I think what Pippa's just said sums up what I'm trying to do, to take complicated stuff and make it simple. And someone like Ken has got really kind of simple but very, very effective ideas, and you keep coming around to this phrase, it's not rocket science. We've got one thing we kind of toyed with doing, solutions to help people with dementia for under £5. That was your idea, wasn't it, Ken?
I really think that would be an interesting thing for debate.
Like your keys by the front door?
Yeah. I mean, for example, I have a photograph of me putting keys in my pocket that is taped to the back of my front door, so I never forget my keys. I have a hook on the wall for my keys, so I never lose my keys. I get my keys misplaced because my family take them, but I never lose my keys. And silly things like that, which are very, very expensive, but very, very worthwhile, very useful.
Yeah, that's great, Ken. I was going to. Is there anything else you want to ask, Pippa?
Sorry, can you hear me again? This is the first time I've ever done this, and I'm very un-IT.
And me.
You are doing a fantastic job. Trust me, you are doing a really good job.
No, I think that was just, that's just another example of how you cut through all the sort of rhetoric and theory, and you talk to somebody who really knows what it's all about because they are living it. And so it can be simple, it can be cheap, but it's incredibly effective.
Yeah, absolutely. Well, one of the things I was, as I was listening, you said right at the beginning about bringing hope to people with dementia. I think Ken, you said that, and how important that has been to you. Just bringing hope. Can you just sort of tell us a bit more about how when you feel that, what does that feel like, and when people do that, what does it mean?
It means everything. I mean, if you have no hope, then you're hopeless. So you have no expectations, and you don't really expect to achieve it. But once you have hope, you achieve things, do things, become more, and it's all about becoming more, and maybe even changing who you are a bit. I mean, I in my previous existence, I was putting sewers in drains. I would never have dreamt of speaking in public, but now this is my new existence. So this is what hope can do, and helping people.
Fantastic. Could I ask you just to come a little bit closer to the microphone? Both of you. Yeah,
Is that better?
That's brilliant. Oh, that's much better. Yes, that's much better. Yeah, and I wondered. Yeah, thank you. Yeah, that's brilliant. Jill, I was just wondering, could you? I mean, Ken's given us some fantastic examples, and I just wondered, Jill, whether you could just give us, just like a little hint of, just one simple action that, or more, because I know you've given us a lot already, but one simple action where people have been shown hope, or been given hope, and what that looks like.
Actually, you have. At the Kent conference, we met a guy who's been dealing with his mum. He didn't know how to deal with it. He didn't know how to deal with dementia.
It was fantastic.
And it was an amazing thing. He came to 5 sessions.
With his sister and his daughter, 3 of the family members came to 5 different sessions.
And we managed to make him feel more comfortable with looking after his mum and how to treat her as a real person rather than some fragile little thing in the corner. And that was a fantastic area.
They literally started and they said that they'd come along to the sessions really feeling very lost, that they didn't know how to, they loved their mum to bits, but they talked about being impatient with her and being embarrassed by her. And actually they got somebody with learning disabilities in the family, and they couldn't see why they hadn't made that kind of mental leap between the patience and tolerance that they very naturally exercise with this family member with learning disabilities. And then when they realised that their mum really was just still the same person, the key message that really comes through the Who Shoes workshops and reinforced obviously by speaking to Ken. I had a long chat with you, didn't they, as well? But this was at the end of the 5th workshop. And to see them going away saying, now we feel confident to look after mum. And it wasn't as if we told them a lot of facts about dementia. We hadn't told them statistics. We just let them talk to normal people and have conversations around just different aspects of just the variation between different people. And, you see Ken sitting here today talking so fluently and turning up on his Harley. I was on the back. But actually, we've got some notes here, and in terms of Ken's reading and writing, it's something that's difficult. And we're working through, how best to kind of develop that together. And different people have got very different issues and problems, haven't they?
We're all very, very different. How to deal with it. You didn't know how to deal with dementia. And that was a fantastic.
We've got some feedback at the moment. Is anybody asking anything?
I'll ask another question. Is there anything either in the chat, if Rosanna and Kathy want to come in and mention anything? If there isn't, then I've got another question. But just Kathy and Pippa, if you let me know. But I just wanted to ask, what's the kind of the most challenging thing that you have to deal with on a day-to-day basis?
Most challenging thing? Cooking a nice meal, making my wife happy with what I've cooked. That's a challenge.
Is that to do with your condition, Ken, or is that?
Oh, certainly, yeah. but there is one thing my condition does not allow me to do, and that's the ironing. I'm sorry, that's completely out of the frame. I can't do that. Well,
I somehow thought it might be.
I didn't want to say that, Jill.
But on a more serious note, in terms of the kind of myth-busting stuff that we're doing, I'm pushing the barriers, I guess, and I think, your whole healthcare school for radicals, and it's encouraging us all to kind of just get up a little bit bolder, which is fantastic. And at the very first workshop in Kent, I heard one or two sort of quite interesting conversations, and I decided to set up this kind of Mythbusters thing. And I said, apparently, I didn't realise this, people with dementia can't peel potatoes. And there was this kind of silence, really. And then we asked people in the room what else people with dementia can't do. Well, apparently they couldn't go out on their own and they couldn't choose what clothes they wore and so on. And we used these, didn't we, in the Pecha Kucha that we did yesterday to kind of bounce off each other. So Ken and the potatoes, what did you say?
Well, I just didn't realise that, so I'll have to start using rice instead of potatoes.
Well, I'm very impressed that you were able to do a Pachuca presentation.
We did actually cheat a bit, Jackie, because it was my idea, and we had the other 4 presenters doing it properly with 20 seconds on auto time.
Well,
we were a bit to that. We didn't quite do it right, did we? But
Jill had a clicker. Realised that, so I'll have to start using rice.
You had a go. That's the main thing. You had a go.
It was within the spirit, wasn't it?
It was
brilliant.
Absolutely. Yeah, absolutely.
I mean, the event was lovely, and it was really nicely included.
Yeah.
And to work alongside other innovators, we had 5 presenters, and all of them were fantastic in terms of both the presentation and the work that they're doing.
Yeah, yeah.
Small people making a big difference.
Yeah, and
absolutely, and that's what it's all about. Absolutely.
It is, yeah.
So, Kathy,
and working together.
Yeah, absolutely. Kathy, did you want to just share some thoughts?
Yeah, just some feedback from the chat room for Ken. Ken, you're being described as inspirational.
Oh.
And your blog's very popular, and people think your idea is a simple, straightforward idea. Newly diagnosed dementia patients meeting with patients who are successfully living with the illness and their families. Great idea. So very positive support.
Fantastic. And Ken, I would say thank you for that, Kathy. Ken, I would say that you embody hope. You really do embody hope. And
I'm not
you know, it's been absolute pleasure having both of you
lots
on.
of people doing the same as me. They just haven't been given the opportunity to speak.
Yeah,
and I
understand that.
I think for me that's probably one of the best outcomes. I want to find more Kens, and I actually put quite a big challenge out to Kent for these workshops we were doing, to find local people and make sure that we've got some people at every workshop. And I don't mind whether they identify themselves. You know, they don't need to tell the group that they're someone living with dementia, but we know they're there in the room. And we've had people coming along from the Age UK day centres and some people with quite advanced dementia just enjoying being included and contributing however they want to. It's been fantastic.
Fantastic. Any last words from any of the participants?
Thanks for letting me talk. Yeah.
And Ken and Jill, do you just want to give us your last words as we finish?
It really was brilliant. I mean, the event was lovely. And it was really nice to be included.
Yeah. Good partnership. I don't know who's getting most out of it. It's fantastic. It's part of the work I'm doing, obviously, with people like Kate and you know, people with all sorts.
Yeah, and working together. Thank you.
Well, I just wish you both well.
I'm not unique. I'm just one person, you know, and there are lots of people doing the same as me. They just haven't been given the opportunity to speak.
Yeah. So I'd just like to wish you both all the best, and just to say to just keep up the partnership, really, and to thank you very much. So can we just give a round of applause on your WebEx, on your feedback, to Jill and Ken. Thank you so much. It's been absolutely brilliant. And I'm going to give you some laughter as well, because you made me laugh as well. Okay, thank you. Thank you both.
Bye.
Bye. That was truly inspirational. That was a great presentation. So we're going to move swiftly on then to Community in Action, and I'd like to introduce somebody who I've met recently. I met him first on Twitter when he did his first pledge for 2013, and then I actually met him at Confed this year, and that's Dr. Jonathan Griffith, And we're also going to hear from Emma Donaldson, who I also met over Twitter, I think. And so welcome to both of you. So Jonathan, you're going to be on first, and you're going to be talking about your place where you spent some time on the reception in your GP surgery. And then I think we're going to go straight to Emma, and then we're going to have the questions and answers. So a very big welcome, Jonathan. Lovely to have you here, and it's over to you.
Thank you, Jackie, and apologies that I can't get my webcam working, but I hope everybody can hear me.
Yes, I can hear you well.
Great. Hi, Jackie. Nice to see you again. I can see you at least, even if you
can't
see me. And thank you. And I'm
hello, Jonathan.
Hi.
Just quickly, Jonathan, your camera should work now.
Jonathan, do you just want to try your camera?
Oh, okay.
Do you want to try your camera again? It should work now.
Okay, looks like it's about to work. Yes, how's that?
There you go.
Okay, thank you. So I think you can see me now, and you've got my slides up there as well. And thank you. So hello, everyone. My name's Dr. John Griffiths, and I'm a GP. I work in Cheshire, and I'm also the chair of NHS Vale Royal Clinical Commissioning Group. And I want to talk to you this afternoon about what I've learned from the 3 pledges that I've made for NHS Change Day. That was 1 last year and then 2 this year. And my main question to you all is, can you be a change agent? And I want to start by asking the question, why? Why would you want to bother going through all the effort of making a change? And many people maybe sat there thinking, well, I'm all right, thank you very much. I don't need to change anything at all around me. And I want to just challenge that and ask if that's really the case. And I think there are many things, if you stop and think about it, that perhaps aren't working quite so well around you, and things that you might wish to make a change with. Change is not compulsory. Evolution is not compulsory. And extinction is always an option for us. So stop and think, are you really happy with things that you see around you, particularly in your workplace? Are there things around you that you would like to change? There are probably processes in the system that you work in that don't work quite so well as you would like. There might be little things, they might be much greater things. And you may already have thought of a solution, but not done anything about it. And if you stop right now to think, what could you change? What would you like to change? There are undoubtedly things that you could. Do you fully understand what's going on around you? Do you understand how you fit into the wider system around you? I remember when I was a student and I had a summer job working in an insurance company as a post finder. And I was just told a very specific task that I had to get on and to do. And it took me 1 or 2 weeks to work out how on earth my little bit of job fitted into the wider system of what was happening in that insurance company. Is that how it feels for you sometimes? Do you understand how your job fits into the wider system? And possibly even more importantly, do you understand how everybody else's jobs and work fit into the wider system around you? Can you be a change agent? If you can see the things around you that you want to change, if you can see things around you that you would like to understand better, then what can you do to bring about that change and to bring about that understanding? Can you be a change agent? Of course you can. And NHS Change Day is here for you, and that's what it's all about. It gives you permission to make those small changes, and it's for everyone. Anybody can make a change. And I would like to suggest 3 simple steps that you could make to help you lead change wherever you are. To live, to learn, and to lead. If you want to understand something, then live it, experience it, and feel what it's like. So, last year, I placed a day in a wheelchair. So, for me, this was all about a day spent actually in the office. I wasn't doing my clinical work as a GP that day. But what did I experience? Well, I experienced having to wheel myself around an old building with uneven floors and with no lift. I experienced having to sit with a different team downstairs because I couldn't get upstairs to my usual team. I experienced the social isolation that came along with that. I experienced struggling to open heavy self-closing fire doors and struggling to close the door behind me after I'd got into the toilet. I experienced being strapped into a wheelchair taxi. I experienced relying on others to fetch me cups of tea throughout the day because I couldn't get to the tea and nor could I actually carry it on my lap while I manoeuvred my wheelchair. I experienced the frustration at the person who'd left a cleaning bucket in the corridor that I couldn't get past, and frustration at whoever had parked in the disabled bay so I didn't have room to get out down the disabled access ramp. If you want to be wheelchair friendly or design a wheelchair friendly service, why don't you live this first? Experience what it's like, live it, and understand it. So live, learn, and lead. So learn from it. What do I mean by that? So once you've lived it, once you've experienced it, make sure that you learn from it. For example, this year I spent one of my pledges spending an hour on reception in our surgery. I experienced taking phone calls, making appointments, speaking to people queuing up at the desk, and also receiving urine samples from patients and dealing with doctors' queries. And what did I learn? I learned that it's not an easy job. Although I thought I knew our computer system really well, there were huge parts of it that I didn't know. I learned that there are processes that take place in our surgery that I knew nothing about, such as what to do with those urine samples when a nurse needs to dipstick it, where we keep our controlled drug prescriptions, and what we do with those. I learned that you have to multitask as a receptionist, something that I am not that good at. I learned that the simple task, an idea of logging out of your phone when you're unable to answer it, while you is not as simple as it sounds, which leaves the phone ringing and patients trying to get through not knowing what's happening. I learned that the staff don't stop. Even if the phones do stop ringing, which they don't, and the queue is gone, which it never does, they always find something else to do. So I was able to live and experience being a receptionist, albeit for an hour. I was able to learn from that and share my understanding and learning. Well, the great thing, I wasn't the only person that day to spend some time on reception, so 3 or 4 of the other GPs also decided they would like to spend some time there as well. And one of the main things that came out of this was that the receptionists were delighted and a bit amazed that we had done this. And it made them realise that we took their job seriously and understood the importance of their role. I don't think you can underestimate the impact that that can have. Thinking back to my wheelchair experience, I learned to this realization that if you can't mobilize yourself somewhere, you can find yourself socially isolated. If you can't get out to meet with people, then you might not meet with people at all. And when you live through something, through experience, you learn things that you were not expecting to learn. So I never thought I would learn about social isolation spending time in a wheelchair. So live, learn, and then lead. So this year, one of my other pledges was to introduce myself to all of my patients using the phrase, "Hello, my name is Dr. Jonathan." And this was inspired by the campaign started by Kate Granger. And when I talked to my fellow GPs about this, some of them were quite sceptical. They didn't really see the value in introducing myself to my patients at the start of every consultation. And they said things like, well, they know who you are already. You know, they've booked to see you. They've been told by the receptionist who they're seeing. Your name is on the call screen when you call them through, and your name's on the door. And they've probably seen you before anyway, so why would you need to tell them your name? And I wasn't sure that that was the case. And I know for a fact that patients don't always know who they've seen, And sometimes they'll come into my room and they'll say, "Oh, I thought you were a woman," which obviously is not the case. And also they will tell me that they've seen a particular Dr. So-and-so, and looking at the records, that clearly was not the case. So I thought this was worth doing, and so I did it. And I learned that it was well received, that also changed how the consultation felt for me. Introducing myself with my name made a difference. It made things feel less formal and more friendly for me. I found it was a helpful thing. And because I'd done it and experienced it, I could say that with confidence. I could talk about how patients responded positively to this. I can talk about how I've continued to do that. That I now often will give out a small slip of paper with my name on it to my patients when I leave. And I'll write things on there sometimes. So first it tells them who I am, who they've seen. I can write their blood pressure of that day. I can write their blood pressure targets. I can write their diagnosis. I could write their next appointment date and time on there. And you can lead this process with confidence because you have experienced it. You can talk about your experiences with others, like I'm doing today. You can tweet about it. You can blog about it. You can lead it with confidence. And that means you as well. I think we all can lead. You don't have to be a CCG chair or a chief executive. I think you've realised that if you've listened to their presentations today. Anyone can make an NHS Change Day pledge. Anyone can learn from it. Anyone can lead in their organisation. So live, learn and lead. You can do it, so why don't you? Thank you.
Fantastic, Jonathan. Thank you so much for that. That was really, really inspiring. Live, learn, lead. That was a real call to action. Absolutely. Thank you so much. So I'm going to move straight over to Emma, and then we're going to come back and have questions to both of you. I'd now like to introduce you to Dr. Emma Donaldson, and she's going to tell you about her pledge to ask patients what matters to them and truly hear and act on their responses. So I hope we're able to get you on camera, Emma, and it's over to you.
Well, hopefully that should be coming through now. Thank you very much, Jackie. Can everybody hear that? Is that okay?
Yeah, we can hear.
Okay. Thank you very much for giving me the opportunity to share what I've been doing since NHS Change Day. So I pledged on my birthday, which is the 3rd of March, to ask every patient what matters to them and to truly hear and act on what they said to me. And when I made that pledge, I was a registrar in gastroenterology, and on the 10th of March, I became a consultant. At a similar point in time, my 2 consultant colleagues who look after the liver patients in Salford, one retired and one went on sabbatical for a year. So I became a new consultant with 2 consultants worth of patients to look after, and a pledge to try and act on what they want me to do. So the first thing I realised is that, like a lot of other people, I had a tendency to listen. Can we go back, please? Thanks. With the intent to understand. I was listening with the intent to reply. So when people told me about things that were going on in my service and the service that I was providing, the instinct was to try and defend that service, to explain why we did it that way, why things had to be the way they were, and to explain it away. And what I realised quickly was that in order to fulfil my pledge, I had to learn how to listen, to understand what people were telling me and why it was important, and then do something about it rather than justify the way things were. And it's complex, so navigating your way through the NHS is a difficult experience if you're ill, if you've got complex medical conditions, if you're not sure what's wrong with you, if you're frightened or worried or concerned. The system in which you're trying to operate is a massive complexity that's very, very difficult to navigate. So one of the first things that people told me when I asked them is, why do I have to come to so many clinics? So I look after liver disease primarily, and the liver forms part of many people's comorbidities. They have lots of medical problems, and some of my patients are coming to see 4 or 5 or 6 different specialists, of which I am one. And one of the things that we've done as a result of that is try to set up some joint clinics. It's not rocket science, but it's more patient-centered. So for patients whose liver is involved in other conditions, I'll go and see them when they come to see the neurologists. I'll go and see them when they come to see the cardiologists, when they come to see the dermatologists. So they only have to come once. Set up joint clinics for people who've got conditions in which the liver is a part and there's another big component. So they come and see 2 of their consultants simultaneously about their problems and give them less time spent in the hospital and more holistic care. Can I have the next slide, please? Next slide, please. So there's several conditions that we now run joint clinics for. I run a joint clinic with the neurologists, a joint clinic with the inflammatory bowel disease specialists, a joint clinic with the metabolic consultants, allowing patients to come less often. Next slide, please. I think the most common question that I've asked is, can I contact you directly with any questions that I've got? What I think is very common in my practice is relatively rare in general practice, and therefore patients were finding that their GP would say, oh, ask the specialist next time you go to clinic, and that's entirely reasonable. When I was ill, I wanted to get an answer when I had a question. So one of the things we have developed is a Hello, My Name is card. Again, as part of the Kate Granger campaign, with our contact details on. So I give out my email address to all my patients, and they can contact me directly by email with their queries, concerns. They tend not to come to clinic as often. They're quite happy. They just want to know the answer to a very simple question that's bothering them, even though it wouldn't particularly bother me as a health professional. It meant a lot to me when I was a patient, and it seems to also mean a lot to my patients that they have that backup even when they need it. Next slide, please. The other common things that came up in the next slide, please. The other common things that came up in the clinic was, I can't remember all the things I wanted to ask you, or I won't remember all this information that you've given me. So we've expanded on the personal care files that we use for our cancer patients for all of our patients with long-term liver conditions. In their personal care file, we, similar to Jonathan, we write down the discussions that we have in clinic. We draw pictures and label them so that they can have a look at them when they get home. We put leaflets that are relevant to the tests that they're having or the condition that they have. So we also encourage patients and their families and loved ones to put in their thoughts about their condition, records of their symptoms, questions that they'd like to ask, and then we discuss those when they come to clinic. Again, giving patients the opportunity to own some of their condition and have some control in the consultation appears to have been very well received. For a lot of our patients, I want to be able to see somebody when I have a problem. So clinical problems don't confine themselves to clinical appointment schedules, and a lot of the patients I look after have problems that come and go and require inpatient admission. And these patients were having to attend accident and emergency and coming through that pathway. So we've developed a self-referral pathway to our medical investigation unit where patients with advanced liver disease can just phone up when they need their tummy drained, and we just admit them directly and do it as and when they need us to do it. We can also review their bloods, review their medication, make sure they're okay, involve other services as required. But most importantly, patients and their loved ones can directly access the care that they need as and when they need it. So to summarise, can we have the next slide, please? So here's one of my patients with, tense ascites, really uncomfortable, difficult to breathe, distended abdomen, really painful. Quick and simple procedure to drain all that fluid away makes a huge difference to quality of life, and it can often be difficult to predict when that's going to need treating. So patients being able to phone up and go, I need something doing this week or today or tomorrow, huge advantage for them, less waste for us for admitting people to check they're okay and not needing to go to accident and emergency because they've got a problem. Next slide, please. So in summary, listening causes a lot of work. Having said that, we've got patient-held notes for patients with chronic liver conditions. All the patients have our contact details, so they can phone us and contact us directly if they've got a problem. We've got self-referral in place for common conditions. We've developed integrated clinics. I've started going out and seeing patients with complex disease with their GP in primary care so that their GP is more confident in the times between appointments to be able to help that patient with their queries. We've developed tertiary clinics with transplants so patients don't have to travel from Salford in the northwest down to the West Midlands. We've started early end-of-life planning for patients with advanced disease who have a terminal condition even though that's not cancer. We've developed rapid access clinics to get patients out of hospital earlier but not wait for a routine clinic review, so we can see them as an outpatient quickly as and when they need to see us. We've developed alerts in our electronic records, so when these patients with complex disease come into hospital, we get emails so we know they're in, so we can go and see them wherever they are in the hospital within 24 to 48 hours of them arriving. So those patients get expert care early in their admission, and the teams looking after them get appropriate support. And we have an MDT every week to discuss these patients and make sure that the ones who need us have been able to contact us. But this is a work in progress, and there's a huge amount more that I need to do if I'm going to act on the things that patients tell me need to change. Can I have the last slide, please? So I think in summary, last slide, please. However difficult it might seem and however much work there is to do, if you change your own practice in the first instance, you can make a huge difference for the patients that you're looking after at the same time as leading change within your organisation and providing an example of what can be done to your colleagues who might not think it's possible to do it. Thank you very much for giving me the opportunity. Thanks, Jackie.
Yeah, thank you. Thank you very much. Again, another very inspirational presentation. And it was great that you gave it some time on your birthday as well, Emma. So that
I think it's more. It was
3rd of March. We'll all remember that now.
it was a good day to have Change Day.
Yes, absolutely, absolutely, fantastic. So I'm going to open it up now, see whether anybody's got any questions. But I just sort of thinking about that. I was really struck by both of you that Jonathan's presentation was live learning and you were all about listening to another L really, living, learning, listening and leading. And both of you, examples for actually living the change that you want to see. And both presentations, to me, it really struck me that you were both had it was a personal impact for you. So bringing your kind of personal sort of values, living your values, and also a kind of a personal impact and learning for you. And I just wondered, just as a starter question for both of you, and Jonathan kind of alluded to it in his presentation, was how the impact on other people, and when his GP said, I don't see the point of this, and how you kind of manage that on a day-to-day basis. I think especially as clinicians, and I think especially as doctors, So, Jonathan, can I sort of ask you to comment first?
Yes, absolutely. So you're right, and all of my 3 pledges had a big impact on myself and how I felt about things. And the people that I think I would hope it had the biggest impact on would be my patients, and certainly that I'm hoping through with my hello, my name is Dr. Jonathan, and it did quite significantly change how those consultations felt in an unexpected way, and it seemed to break down some of the barriers. I was having conversations that weren't just entirely about the medical problem that they were coming with that day, but more about them as individuals and as people. And I know my patients better because of that. I think then it can be a slow process, can't it, in disseminating some of that learning and spreading it out. And I have tried to do that by blogging about it and talking to my colleagues at work, just to say, look, this has made a difference for me and for my patients. And they can then see for themselves whether they want to give that a try or not. And the idea of the slips to hand to patients as they leave, we've talked about as partners, do we get proper business cards drawn up? And we've not gone as far as that. But I'm kind of the pilot in the practice that we may roll that out to in due course.
Yeah, I made my business cards on I'm sorry, Jackie. I made my business cards on Vistaprint on a Saturday afternoon as a bit of a test, rather than waiting for the organisation to design them and print them for me, because I can't remember all the phone numbers that I have to write down. But I would completely echo the hello, my name is makes an enormous difference, and there is something about consciously introducing yourself and setting the consultation in that way that makes a huge difference. There's a question in the chat box about self-referral for other specialties. I don't know. We do a couple. So we do patients with chronic anemia. When they become symptomatic, they can self-refer in for assessment for transfusion and various bits and pieces. And I think heart failure have some pathways as well where they can come in for assessment. But I think just getting on and doing it is the key. Because if you spend your time planning how to do it, A, you'll probably get it wrong, and B, nothing will ever get done. So actually just starting, just doing something, and then next week in the next clinic, just trying something else and just building it one step at a time, you can make a huge difference very quickly.
Great, thank you both. I'm just going to go over to Wayne Connor Shahil. He's got 2 questions. One from Jonathan's presentation. How do we get staff involved in doing things differently and feeling it's part of their mission or their day-to-day job? We start with that one. Jonathan, do you want to take that one?
Yeah, I think it's about giving permission, isn't it, to your staff to make these changes. And that has to come from the leadership that you want to put in place, and being very open and upfront about that, and saying, if you see things that you want to change, we want you to feel enabled to do that, and then leading by example. So, so the staff at the CCG see me as the chair doing these things and talking about them very publicly. And some of these things were big, so the wheelchair was a big thing, to be fair. But hello, my name is a small thing that every frontline member of staff can do. So there are lots of things that you can just get on and do. And I agree absolutely with Emma that it's finding that small thing and making the small incremental changes rather than trying to do some huge thing all in one go. And saying to our receptionist, do you want to come and sit with me in a surgery? Do you want to sit and look how I go through my blood results? Do you want to sit and see how I manage the tasks that you send me on the computer system? What things are going on in reception that you could see done better? And giving them that permission to make those small changes.
Fantastic. And it does, a lot of it, again, comes down to sort of giving permission. And some of it is about our sort of self-efficacy and our belief that actually we can make a change as well. And I think it's those two things coming together. I did say for Emma to take the next one, but actually I've just realised that it is directly to you again, Jonathan, about how much a consultant is engaging with community services and primary care to deliver services in communities in a more streamlined way and in a real patient-centred way away from hospitals.
So I think this is our big challenge, is how we make this shift from work that's been done primarily in hospital settings that actually can be done just as well, if not better, closer to home in a community setting. And we're starting to make that shift, and GPs are feeling that and doing more of that work. And the next step really is, how do we get consultants engaged? And I don't have an answer to that one. I'd be very interested to see what Emma, as a consultant, has to think about that. But we've been focusing on community care for the elderly consultants, and seeing if we can try and get that kind of role, that generalist role, a specialist generalist in the community, and that's where we've been starting to look at initially. But yeah, I don't know what you think, Emma.
I think it's a big challenge, because I think a lot of it's around how we commission and fund and all of those really annoying side bits to actually delivering care to patients. What we've tried doing locally is within my services, we have community services out in general practice for certain groups of liver patients, so patients with high-risk alcohol behaviour and things like that. And what we've just started to do is to set those clinics up on a rotational basis in GP practices, so patients can choose to have their next available appointment wherever it might be, or they can wait until the clinic rotates through their GP practice and we'll see them in the community. And that gives us huge opportunities to then, have lunch with our GP colleagues and talk about people that they're worried about, or people that we've got on the books together, and see those patients together. I've got a couple of patients now that I go out into primary care and see the patient when they attend their GP, because the secondary care bit is complicated, but certainly doesn't need to be done in hospital, and the GP is much more important for that patient in their long-term overall health care. And my bit is tiny, but difficult for the patient to understand, and very, very rare in terms of general practice and what you might see on a day-to-day basis. But they don't need to come to hospital for those appointments, and those appointments are much better being undertaken with the GP. And those patients that we've started doing that with have reported huge benefits from actually feeling like it's not all being done by telephone and email and handwritten letters, and having that link there in a more established way. And I think we need to be creative about how we do it, but it needs to be done. I don't think I do anything in my clinics that couldn't be done in primary care, but I also wouldn't expect the GPs to look after all my patients. I think that would be unfair.
And so for me, it's about how we make that care more joined up right across the pathway, isn't it? So,
yeah, absolutely.
And we have these artificial boundaries that patients don't see between why do I have got a primary care need, or a secondary care need today, or a social care need. Actually, they've just got a need, and that needs to be met by somebody.
Yeah,
who do that in
absolutely.
A more intelligent way.
Exactly. Yeah. And I think some of that is about reframing as well. And it's just got a need. I've got exactly. So, has anybody? Thank you both. Has anybody else got a question, or Wayne? Is there anything else that you want to kind of reflect on as you ask the question? Is there anything you want to say? No? Okay. Any more questions? Anything in the chat box or on Twitter that you want to reflect? No? Okay. So I'm going to give Emma and Jonathan just to kind of, just your last words really that you want to share, and then we're going to do a round of applause. So Emma, do you want to go first?
I think that you just need to get involved. I think just do it. Don't look for consensus. Look for something you can do as an individual that will make a change for patients or raise awareness. And it doesn't matter how big or small that is, but just do something rather than talk about doing something or think about doing something. Actually just do it. It's exciting, it's quite addictive, and it's a hell of a lot easier than you think it's going to be when you look at it from the outside.
Absolutely, and I remember when we did the first Change Day, that was my mantra in the office was, just do it. We broke every rule in the book, but it would never have happened if we didn't. And thank you for that, Emma. And from you, Jonathan?
It's exactly the same. And I'm going to say, of course, live, learn, and lead. And the fact that actually we are all leaders and we all can be leaders. You don't have to be the CEO, top of your organisation. Anybody can make that change, and if you've done that, you can lead the change for everybody else.
That's fantastic. And just to follow up from Jonathan's presentation, one of the call to actions that we think will probably spring out of Change Day is a call to action around the use of wheelchairs and more access for wheelchairs. So really looking forward to that, and if anybody wants to get engaged, and I've already asked Jonathan that, so that's fantastic. So I hope, Alison Phillips, that answered your question, one message from either of the panellists, what they can share and what that was. And can we give them a virtual round of applause, and just to thank you both for such an inspirational presentation. So thank you very much. It was great.
Thank you. It was a pleasure.
Yeah, thank you. Look forward to next year.
Absolutely.
Thank you.
Okay. Yeah,
thank you.
Absolutely. Thanks both. Bye. Bye.
Bye.
Bye.
Bye. Okay, so we're moving on swiftly. Hope everybody's kind of holding up. And we're going to now move over to session 12, which is getting over 300 and 5,000 people mobilised to take action on 2 campaigns. She is a stalwart. She is, a massive connector and engager, Alice King-Cole, and she's with, and we're also going to be hearing from Katie Turner, but we're going to hear from Alice first, and Alice is going to be sharing with us the You Can Cope campaign and her pledge about positive well-being. So a massive welcome to you, Alice. It's great to have you on the call. And so it's over to you.
Jackie, and just we can't see that Alice is connected yet on the audio. Okay. So Alice, can you just say hello if you are connected on the audio?
Do you want?
Okay, maybe if
you want to start with Katie?
Yeah, if we could start with Katie. And Katie, are you okay with that? We thought you connected through audio, so you should be unmuted now. Katie. Yeah.
Hi, yeah, I'm here.
Okay, excellent. I'm going to unmute now.
Okay, so Katie, you're going to go first, and you've got 10 minutes.
Brilliant. Okay, thank you very much. Is my presentation up as well?
I think we're just going to fast forward. Yeah. Okay.
Oh, there it is. Fantastic. Okay, thank you very much for having me here today for NHS Change Day. So basically, we run a very small campaign. We're just a group of what we call frontline nurses, so junior nurses and healthcare assistants that got together to talk about safe staffing and about how that could change patient care and also staff well-being. So our campaign is called 4 to 1, and it's about trying to get mandatory minimum staffing ratios for patient to nurse ratios in the NHS. So if you can go to the next slide, please. So we started the campaign because we basically got together because we were worried about staffing levels in our own hospitals and what we'd heard from other reports as well. So we got together around the time that the scientific report on mid-staff was coming out. And we wanted to do something that would be a positive campaign and hopefully would impact people across England, patients and staff members, to be able to give better patient care. And we decided that staffing was a major issue. And with the COAG report as well as the BOEC report, staffing was one of the main aspects that came up. That was something that could be changed and should be changed. But we've kind of seen drips and drabs of things that have been happening now since, but it's taken a long time. So basically this is from the nursing perspective and hopefully eventually from the public perspective about what we want for staffing in the NHS. So yeah, that's, if I can have the next slide please. So why did we come to NHS Change Day? Mainly because it's a really positive ideal. It's about what we can do as nurses, it's what we can do as staff, and what we want as well for a change in the NHS. So it's something positive that we can do. Okay, it's very different from the kind of pledges that we've been hearing because they've been very specific to specific places. This is more a kind of general campaign to make staffing better for everyone. So it's different in that way, but there's no reason why it can't be something that anyone can do in their own workplace. So we've kind of joined the pledge because we think that safe staffing will make better patient experience. More nurses mean less stress and burnout as well. And then if legislation was achieved, then it would make a significant difference to healthcare in the NHS across England, and it will kind of equalise the standards as well across England. Because at the moment, each trust can choose its own staffing levels, and that's going to be difficult to change as well. So, yeah, it's about positive change in a big scale, I would say, but you can do little things in your workplace, which we'll come to in a minute. So next slide, please. So we've gone and looked at quite a lot of research around this. There isn't actually a great deal with British research. We've seen a lot through the RCN and we've seen a lot through Rafti, who's on the Safer Staffing Alliance and doing the research for that. And there's lots of common sense research to say that when there's better staffing levels, there's less effect on patient care. So patients are getting better care, safer care, there's less mortality rates, and there's less complaints as well, less falls. So it just makes for a safer working environment, not only for patients, but for staff as well. So less sickness, less burnout. It's a good way to keep your staff, if they're happy as well in their working environment, and they'll come to work every day. And you won't have sickness levels for stress that we're seeing at the moment. We also have an amazing amount of nursing vacancies, and that may be due to the conditions that people are expected to work in. If they're coming to a shift where they feel like they can't give that quality patient care and going home feeling that guilt, feeling that burnout at the end of the day, and they're less likely to join up to a ward where it's like that at the moment. But if we can change conditions to be better, then hopefully we can recruit more nurses and make for a better team environment as well. And then I guess the thing is that tools have already been produced for safe staffing. We've seen them produced across the country before, and obviously we've got the NICE guidelines coming out gradually now. But the worry and concern is that these tools have been produced before and they haven't seen much change. There's been a little bit of change in some places where they've been able to afford the change, but it hasn't been as widespread as it needs to be. So the point of legislation would mean that everyone has to staff to a particular level. Okay, next slide, please. So we've kind of gone over this a little bit. So why is understaffing important? So less can be work undone. It could lead to poor care, so a deterioration in acutely ill patients that's not detected. Later interventions means less successful and high mortality rates, which is seen in the research. Patient mortality as well is higher when there are more patients to nurse ratios. So that's mainly the research that's come out. And we've seen massive improvements across the world where ratios have been implemented. So we've been working together with some Californian nurses where ratios have been in place. And then in Australia as well, we've had people over to talk about how they run ratios in certain states in Australia and how that's really improved the working environment. And there's loads of research to show that actually those mortality rates drop significantly when they have safer staffing ratios. Next slide, please. So we've got a video of our lovely Californian nurses and how it impacted them. I'm not sure, have we got time to show it?
Yeah, maybe we can show it towards the end because it's going to just take us a couple of minutes to get it up on YouTube. So
Sure.
maybe we can just continue and we'll try to get it ready.
Yeah, it might be a nice way to end the presentation anyway. So next slide, please. So what have we done already as a very small campaign of just a couple of nurses? We've spread ourselves a little bit across the country. We've done that mainly through using unions. So we've had backing now from Unite. We've got backing from some branches of Unison and RCN, who've been brilliant. And we've been to a couple of meetings to talk at branch meetings about the campaign. So we're trying to spread ourselves around, trying to get groundwork support for the campaign. We've produced a website, leaflets giving information, also a fact file as well with all the evidence that backs up what we're trying to implement. We've also unfortunately had to produce whistleblowing pamphlets due to the nature of people coming forward to us and telling us the situations where they have experienced unsafe staffing, and when they've tried to report it or do something about it, they've been bullied. So we've produced a whistleblowing pamphlet trying to give guidance about what people can do when that situation happens. We've had an e-petition with 38 degrees, where we've had 21,000 people, over 21,000 people now sign up. And that's been a combination of NHS staff and the public as well, and support for having mandatory minimum staffing levels in the NHS. We've also tried to start some of our own research. So we have tried to get some of the figures that are coming out from wards now, where they're producing about what their staffing levels are right now, which has been useful. We're also talking to student nurses about their experiences and what they've witnessed on the ward and how it's kind of impacted on their learning, which will be a really interesting article once that comes out, and hopefully will help the NMC sit up and say, actually, this is impacting our new nurses that are coming into the NHS. So it's an important issue. So we'll have a follow-up article as well with mentors and how it affects how they can support nurses, student nurses in that way. And we're also producing some research onto overtime as well. So how much people are doing overtime, whether that's in bank work as well, staying late after shifts, or as well, if you're missing breaks on shift, how that's impacting your day-to-day nursing life, and how it's impacting patients as well, obviously. And then we do a fun thing as well. We try and make it a little bit more social. So every month in our local area in South London, we have a social, so we show films or have talks about current health issues, and it's just a good environment for people to get together and talk about any problems that are on their ward, whether it's due to safe staffing or any other issues, and try and support each other. So that's been a nice extra curricular type of thing that we've been able to do. Next slide, please. So that's just an array of the posters that we've done for our social and the types of films that we've shown, including kind of the making of the NHS and what it was all about in the first place, about the Mary Seacole campaign, some MSF films, and a lot about kind of international healthcare and what's happening around the world as well at the moment. Next slide, please. So what are we going to do next? So obviously we need to gain more and more support for this. We are holding meetings more in medium branches in some hospitals as well, to kind of build a campaign at a grassroots level. We will be contacting public groups and patient groups as well to see what they feel about the issue. And then we're on the process of lobbying the Department of Health to talk about their response to staffing levels, which has been very, very slow at this stage and very delayed. It's starting to happen, but we just want to see what they're going to do about the numbers that are produced by the wards. We need to do more research as well, particularly research in the UK, because there's very little at the moment. So we're going to build on the research. And then also we've been supporting some political campaigns for staffing. So in Wales currently at the moment, the Liberal Democrats are putting through a bill in government for mandatory minimum staffing levels for nurses in the NHS. So exactly what we're campaigning for, which is brilliant news. And we've been able to be part of their consulting for that bill to give some advice on what our opinions are and what safe staffing should be from the nursing perspective. So that's been a brilliant opportunity. We're hoping that perhaps we can spread that to some English campaigns, political campaigns in the future, and particularly coming up to election time. Next slide, please. So this is the situation that we see quite often now. So in places that are understaffed, nurses are overworked, burnt out, and environments can be unsafe. And this is what we hope if safe staffing will come along as well. The next slide, please.
Okay, so you've just got just 1 more minute?
Okay, I'll try and wrap up. So next slide, please. So what do we want people to do in their workplace? So you can raise issues about understaffing with colleagues. You should also fill out incident reports as well. If you feel that the situation has led you to be unsafe due to unsafe staffing, please start reporting it in the internal systems as well. Build links and supports with other nurses. If you want to get in contact with us and find out how you can start up your own campaign group about safe staffing, you can get in touch. And get nurses as well to publish staffing levels and participate in some of the research that we're doing. And realise that you can turn around the whole idea of what we call pin fear, where people are scared that actually the situation means that they're going to lose their pin, but actually it's a situation that you've been put in. It's the system that's been created that's made us unsafe. So we can turn that around and try and work with managers together to say this is something that we want to make our environment safe for everyone in the future. And so we don't have to break our code of conduct by being unsafe. Next slide, please. Lovely. So that's our website and our email. So if people want to get in touch, that's great. Thank you.
Thank you. Thank you very much, Katie. That was great. Before I go over to Alice, can I just check how long your video is?
It's about 2 minutes long.
Okay.
So it's okay if we don't show it, but it's on our website. want
Yeah,
to
if we
see
can
it.
do that at the end of, if we can do that at the end, then we will definitely.
Okay, brilliant.
Okay, thank you so much, Katie. And that is such an important subject that you were talking about. It kind of takes me back to, you know, when I was working on the wards and as a kind of an operations, you know, lead. So really important stuff there. And as somebody said on the chat, you know, some really important data there. So I hope we do get some questions at the end of this. But I would like to now introduce to you Alice Colking, who's going to be sharing her pledge and what she's done around developing well-being and emotional resilience. So a very big welcome to you, Alice.
Thank you.
You've got 10 minutes, so it's over to you.
Lovely, thank you very much. And I'm absolutely delighted to be here today, but actually it's not just me, I'm representing a lot of people. And essentially this pledge is about developing our emotional well-being and our resilience, because actually people with a good well-being and good resilience actually have fewer health problems, not just in terms of their emotional health, but actually their physical health as well. And I think it's actually worth mentioning that people who work in a high pressure environment, for example, the NHS, actually stress-related illnesses are one of the commonest reasons to have sickness absence. And so it's a really vital pledge in terms for us to be able to deliver compassionate care for our patients. But also it's a really democratic pledge because it puts everybody at the same level. And, you know, it's been absolutely lovely to be able to invite people from all walks of life, from all ages. We've had people joining us, not just from around the UK, but actually beyond the UK. And it's lovely that we've been able to do that. And the key thing about this pledge is raising awareness, because people don't strategically think about ways of increasing their well-being. People sometimes just think they either have it or they don't. So that was the main reason, but obviously to look at some tangible changes. If I can have the next slide, please. Thank you. And the whole point of this pledge is to build everybody's emotional resilience. And if we look at this diagram, it illustrates the population as a whole. Studies have previously suggested that perhaps as many as 1 in 4 people have problems, mental health problems at some point in their life, but actually new research has suggested it's closer to 1 in 3. Other research has demonstrated that about 1 in 10 people have experienced suicidal thoughts in their life, but again, more recent research shows it's probably far more than that. And what we're trying to do is raise awareness across every sector of society, because we know actually that the majority of people who die by suicide have not been in touch with specialist mental health services. And however, these people don't live in a vacuum. They have friends, families, communities, but actually they can build their own resilience. Next slide, please. And as well as being an NHS consultant with the Betsy Cadwallader University Health Board in North Wales, I'm also Clinical Director of Connecting with People. And the goal of Connecting with People is to increase awareness, to reduce stigma, to promote compassion, and improve the understanding between those people experiencing thoughts of suicide and those people trying to help them, but actually to increase everybody to improve their well-being and resilience. And we've got some main strategies around this. One is our bite-sized training. The next strategy is actually embedding a consistent assessment framework, because if we're not talking the same language, then how can we talk about the situation or help people move forwards? But the key thing about what we do is to help people help themselves. And a key element are the self-help resources we developed on behalf of the Royal College of Psychiatrists, but actually raising awareness that people can learn to help themselves. And I think particularly in the NHS, we don't always look after ourselves. We're so busy looking after other people that sometimes we're almost forgotten in the way we look after ourselves. And I give the example of using a seatbelt. When I get in a car and go on a car journey, I genuinely don't think I'm going to have a head-on collision, but I always put on my seatbelt. And actually this may be a good way to view life. We hope that none of us will have an emotional crisis or difficulty or an overwhelmingly stressful life event. But actually, if that happens, and if we've got a pre-made plan of how we'll cope, if we're already investing in building up our well-being and resilience, then we'll cope far better. And this is the whole point of the pledge. It's to get people to act early. We recognise that changes do need to be made, perhaps in a way so we can be more compassionate towards each other. I'm not talking about the NHS now, I'm talking about society as a whole. But actually, while we're waiting for those changes to take place, there's still things we can do for ourselves. And that can also increase our sense of self-efficacy. Next slide, please. So the whole plan is, I don't know if you're able to get the next slide or if there's a technical difficulty. Lovely, thank you very much. So the whole thing about this pledge is that it's been wonderful to work with NHS Change Day, and it's been wonderful to use it as a platform to reach more people and to really join in the exciting buzz of Change Day. And so we've used the theories of social movements, but also the theory of planned intent. Because if you commit to doing something, and if you commit in writing to doing something, you're far more likely to do it. And so what this pledge is so democratic, and it really helps reduce stigma, because we're saying that anybody can join this pledge if you have a mental illness, if you have difficulty, if you have adversity, whatever your age. And people have been invited to commit to doing 3 things. You'll see my pledge on the screen because wherever possible I try to be authentic, and actually I don't think I should ask someone to do something if I'm not willing to do it myself. So you see I've chosen 3 really simple things which may appear to actually be almost too simple, but don't underestimate the power of doing something small regularly and perhaps even every day. So for example, the idea is to have family time with no gadgets. And I must say, I don't know if everybody was as enthusiastic as I was when this was first mooted, but actually it's become part of the culture now and it's wonderful. And again, going out for a picnic every week, I must say it's much more pleasant now the weather's improved. The other thing is exercise. Sometimes people think they're too busy to exercise, but actually I think if we considered the alternative of perhaps becoming ill, we realise that nobody is too busy for 15 minutes exercise a day. And the other thing is connecting more with family, friends, but actually with yourself. So that's why the 2 things I've chose were connecting with family, friends, but also undertaking some mindfulness practice. And as I said, I'm just one of all the other people that supported this pledge, and I've been hearing some fabulous things that people are doing. So, for example, the Royal College of Psychiatrists have really taken this pledge to their hearts, and we're actively also promoting helping other people with this pledge. In my own health board, for example, my own team, the liaison team where I work, we now include the patient leaflets of how people can improve their resilience in our every single assessment pack. So every patient we see, we now explain to them ways they can improve their well-being and resilience. Apparently there's even a hairdresser in North Wales, Enigma Hairdressing in Llandudno, and it's absolutely wonderful because they are supporting the pledge, and they've even put their resources amongst their beauty products. And this is what we're saying, it's so so democratic that anybody can join in. Next slide, please. And you can see from the next slide, we've got a picture of each of the 3 resources. The first, the one in purple, You Can Cope, has been designed to actually give people very useful tips and strategies of how they can build their resilience. And actually, it's designed to be suitable for children and young people. But to be honest, it's just as practical for adults. And I often say to adults, you know, when we buy a new television, do we spend hours reading the in-depth instructions, or do we look at the quick guide? And I think most of us look at the easy read. The next leaflet, The Feeling Overwhelmed and Staying Safe, is designed for people who are already feeling a little stressed, who perhaps are noticing that things are getting on top of them, or maybe they're working too hard, or some distressing life events. And these are really simple strategies that people can use to actually help themselves. And it gives very practical advice on how to make a safety plan, and it gives an overview of the fantastic national organisations that provide support and how to contact them. And then the next resource, Feeling on the Edge and Helping You Through It, is for people who are very distressed, or perhaps people who have already self-harmed. And these resources are available in leaflet format by the Royal College of Psychiatrists, but they're also available online, and you can see the Connecting with People website address. And what I've actually found out is that people are now, when they perhaps see a patient in distress, or if they know family and friends, when they're there with the person, they actually type in the website address so that somebody has got it on their smartphone, got it on their laptop, so that they have it then when they need it. And I think the whole thing about this pledge is encouraging people to do things for themselves and actually to strategically improve their resilience, because we never know what life will throw at us. But, you know, let's make sure we're in the best possible position, both emotionally and physically, to be able to deal with that when anything arrives. Thank you very much.
Thank you. If you could put my camera back on, please, Paul, that would be great. Thank you, Alice, again, for another inspirational presentation. So I'd just like to open it out to anybody who wants to ask a question. My little scroll button has gone missing in my chat, so I'm unable to scroll to see whether there are any questions. But Kathy, are there any questions in the chat box? Or does anybody want to raise their hand to just ask a question of either of Alice or of Katie? Kathy, are you raising your hand there? Just to...
Yes, we've got not specific questions, we've got lots of comments, lots of enthusiasm. People are getting all their colleagues, they're leaving their laptops running with this WebEx, their colleagues are walking past, their colleagues are asking them questions. It's all about sharing today. People are increasing their multitasking skills as well, and they want to do it every day.
Good. And have we got any questions for Alice or Katie? Have we got any questions for Alice or Katie? No? Well, I've got a question for you both. I think what really struck me about both your presentations were, I think these were the sort of, you know, the big campaigns that came out for Change Day. And clearly, you know, they are campaigns in their own right. So I wanted to kind of ask a bit about how you built those campaigns outside of Change Day. and how Change Day has helped do that. But before that, I just wondered whether you both could give just a small example of how these campaigns have actually directly helped patients. And I know you may have done a bit of that through your presentation, but just give us a couple of, or one sort of just a small example of how they've actually helped patients. Katie, could I ask you to go first? Alice, are you?
I'm here.
Are you there? Do you want to?
Yeah.
Go?
Would you like the tangible?
I'll go on then, Katie.
Yeah.
Yeah. Sorry, whoever is available. Sorry, it's difficult to distinguish voices.
It's Alice here.
Yeah, Alice, you go ahead.
Yeah, I think in terms of tangible examples for patients, in terms of the way that we built the campaign, we built it in a cost-neutral way, and so no investment other than a small amount of time was required from the people who joined the campaign. And I think that's the beauty of joining the NHS campaign, sorry, the NHS Change Day, in that it's got a fabulous camaraderie, it's got a feeling that we're doing something positive together. But in terms of how it's benefited patients, it's meant that so many more people are aware of these practical and compassionate resources for patients in a way that I and my Connecting with People colleagues in the college would not have been able to engage so many different NHS organisations without collaborating with Change Day in this way. Yeah. And so it means that, I mean, for example, we've had nearly 40,000 hits on the page of our website where we host the resources. And that means that 40,000 extra people who needed to see these resources have been able to.
Mm. And have you seen that change, Alice, over the last 2 years?
Yeah, oh, absolutely, definitely. And I think the beauty is that because of working with NHS Change Day in this way, it's meant that I've been able to directly engage with the head of comms of many different NHS organisations, and they now know these resources exist when before they didn't. Several of them have actually, I know they've gone on and to order some of these resources for their own patients. If they were unable to have the financial situation to buy the resources, having said that, they're only about 40p each, they can use them for free from the website. And so that's been amazing because new research has now come out showing that social media does have a significant role to play in suicide prevention. If you speak to someone who has been suicidal or someone who's been distressed or somebody who's maybe worried about a relative, most people do not know how to respond if somebody they care about is distressed. And it gives them such a sense of relief knowing that there's these really sensible and practical resources that they can access and show the person in distress. And it means that we've been able to achieve that in a way we couldn't have otherwise across the UK, but actually beyond the UK. I think it's also given a real buzz and it's been able to engage with people outside the NHS. Because, you know, like you, I feel strongly that NHS Change Day is not just about the NHS, it's about all of us. And it's been wonderful to engage with the Professional Cricketers Association. I mean, only just yesterday, Young Minds have joined. And that's wonderful because, you know, we want to reach people early to help people when they're children and young people to start building their resilience. You know, it's never too early to build your well-being. And perhaps, and it meant that it was almost, there's a wonderful platform to engage with organisations that I wouldn't normally engage with. And of course, the more people know about these resources, the more lives will be saved.
Yeah. And I think, you know, Alice, you know, as I just kind of reflected back on Helen's white paper, on the white paper that Helen presented earlier, and it was all about how we make connections. And I remember the very first call that I had with you, which was just us speculating and saying, how can we help each other? And I just think it's fantastic to know that you continue to stay engaged for the last 2 years. And it's just absolutely heartwarming to know that actually it's had an impact on the campaign that you're part of. It's truly inspirational. Thank you. So Katie, there is a specific question for you in the chat, but I'd also like to know how you've kind of built your campaign as well. So the question in the chat was, great presentation. Have you done any work around staffing levels and falls incidents? So that's a specific question. So if you want to answer that one first, and then you can talk about how you built the campaign.
Sorry, could you just repeat that question? I didn't quite hear the end of it.
So, have you done any work around staffing levels and falls incidents?
Falls incidents.
Yes.
Okay. So basically, we've been given some data through one of the trusts in London, and they've basically shown that when there's been unsafe staffing levels, or there's been higher patient to nurse ratios, there have been more incidents in falls. So we've actually had concerns as well from occupational therapists and physiotherapists that have said that when there aren't enough nurses on shift, that it's more likely that people are going to have falls and accidents while they're on the ward, because they're more likely to try and do things themselves rather than ask a busy nurse to come and assist them, unfortunately. So yes, we have been working with one particular trust already with their data on falls research, and we hope to look at a few other hospitals around the country and just compare those, because it would be good to have a wider case study that we can produce with that. So yeah, we have been looking at that, because I think that's a big thing about health and safety that we can use as evidence to say that if we have better staffing levels, then hopefully we can reduce those incidents. So that's for that one. I think in terms of NHS Change Day and the pledges, we didn't really use it to the full capacity that we should have. I think it was at a very busy time for all of us when it came up, and I think it's something that we really will implement for the future and for next year, and try and raise the profile a little bit better and spread it around all our networks as well, and use it as a kind of mobility for people to get involved, and for the public as well to become interested in what we're doing. So yeah, we'd like to build on that for next year. But it's been a really good campaign to be involved with. I think it's so important that we all work together to produce positive change, because there's been so much negative press about the NHS and about nurses. And I think we really need to do things that change that for the good, and show that we do really care about our working environments, and that these are the things that we want to do to make it better for patients.
Oh, that's fantastic. And Alice, do you have a last word? I don't know whether we've got time to watch the film. If I can just ask the technical team to get that ready, if we've got time.
We do.
But, Alice, in the meantime, have you've got the last word on this section?
Thank you. Well, again, we're so grateful for the opportunity to collaborate with NHS Change Day in this way, and I would just urge everybody to have a look at the webpage and to join if they haven't. And it's great. I'm actually keynote speaker at a National Samaritans conference this weekend, and we'll be having a mass signing. I think there'll be about 120 of us. We've got certificates all lined up. So, and it's never too late to build your well-being, and it's never too late to join this pledge. Thank you.
Okay, thank you so much, Alice. What a positive note to end on. And I just really wish you all the best, both of you in your campaigns. And can we just give them a round of applause, a virtual round of applause, and to just say thank you. And I'm going to give you some laughter as well. It's all about building resilience. Thank you so much. Thank you, Katie, and thank you, Ali.
Thank you.
Have we got time to? Okay, we haven't got time, unfortunately, to show the film. So just to say goodbye to both of you, and hope you're able to, you know, stay on if you can. If not, it's been a pleasure having you both. So we're going to move on now to thinking outside the box, pre-love and patient experience. This sounds really exciting. And this is going to be presented by Michaela first, Mark Yerrell, and we're also going to have a separate presentation from Martin Ferrier. So I'm going to hand over to Michaela, and they're going to be talking about their pre-love campaign that they had, which was about saving a lot of money. I'm going to let them share how much through innovation and efficiency. So is Michaela and Mark, are they on the call?
Good afternoon, it's Mark. Michaela couldn't make it today, I'm afraid.
Hi.
Am I still with you?
Hi, Mark. Yeah, we can hear you.
Excellent.
Go ahead. We've got your
Yep.
slide up on the screen.
Okay, wonderful. Yeah, so Michaela couldn't make it today, as I say. But hello, my name's Mark Yerrell, and I'm the Support Services Supervisor at Milton Keynes Hospital NHS Foundation Trust. Truly honoured to have been invited to speak today, so thank you very much for having me. So I'm here to share the story of my pledges for NHS Change Day 2014. Now, back in April last year, I was undertaking an inspection of our recycling and refuse area, as I do on a regular basis. And I happened to notice two members of staff breaking up some furniture and throwing it into a skip. So I went over and spoke to them, and they told me although the furniture was perfectly reusable and in good condition, they had nowhere to store the items, and the only option was to either immediately redistribute the items or dispose of them. So after witnessing this, I paced up and down a little, very frustrated with what I'd seen, and I thought to myself there must be a better way of handling used furniture and unwanted items. But I was fully aware of the space limitations we had within the hospital. Now, I suddenly had a eureka moment, and this is how Pre-Loved was born. I originally called my scheme Reduce, Reuse and Recycle, but a few months into planning, a colleague from communications suggested that we use something a little bit simpler, so we decided to change the name to Pre-Loved. Now, my idea for Pre-Loved was pretty simple. I wanted to have a dedicated area to store items, a catalogue system, and a website so people could view and ask for any items that we had available. I also wanted to ensure that we reviewed every single piece of furniture or equipment that was picked up as junk to see if it could potentially be reused. With the help of some senior colleagues, I drew up an informal business plan. I secured funding from my general manager for a shipping container, and this is what we used as our dedicated storage area. Now, our Chief Executive, Joe Harrison, he was very supportive of Pre-Loved. He gave me all the support and backing I needed, whenever I needed it. And this wasn't the first time Joe's taken an interest in my work. He previously supported me with Lock-in Wheelchair Initiative and helped me to secure some wheelchairs in the past. So Joe was very much in there with me, and we jointly launched Pre-Loved on a small scale in December 2013. Our dedicated internet site went live at Milton Keynes shortly after. Within an hour of putting our first furniture online, it went within the first hour. It's been very successful. Now, the full launch of Pre-Loved was on the 3rd of March for NHS Change Day, and I pledged to save the hospital £20,000 in the first year by encouraging wards to reuse and recycle as opposed to buying items from new. The more furniture we reuse, the bigger the savings we get. Now, Pre-Loved's not about reusing items that have clearly served their purpose. It's about finding those items that might just need a little bit of TLC. For example, a new lock on a filing cabinet, or a few adjustments to a chair, or maybe some cleaning solutions to remove some marker pen off a whiteboard. Any item that's clearly not suitable for Pre-Loved is recycled in the most environmentally friendly and cost-effective way possible. Now, we've had all manner of items appear on Pre-Loved, from desks to filing cabinets, chairs, small electrical equipment, lockers, and even stationery. And as I previously mentioned, my team and I assess every single piece of furniture that is unwanted in the hospital to check for its reusability factor. Since NHS Change Day in March, Pre-Loved has reused over 120 large items, saving an estimated £7,000 and around 2 tonnes in weight of material from the scrap heap. We are set not only to meet the 20k pledge targets, but to exceed it, and well before March 2015. Now, this isn't just a one-year project. Pre-loved is an ongoing thing, and it will continue to generate savings year after year. In addition to fully launching pre-loved for NHS Change Day, we decided to hold a special pre-loved clothing sale for both staff and outside people to enjoy. The clothing sale quickly grew into an organisational pledge, and what started as a fairly low-profile event actually became something a lot bigger. The whole of MK Hospital got behind the initiative, and we received hundreds upon hundreds of bags of used clothing from members of staff to sell during the sale. We extended into the local community, and we managed to get the backing of the MK Dons and a local Scouts group. The event itself was very well publicised, with both our local papers getting on board, and the MK Dons actually had an electronic advertising board during the home match, which promoted the scheme further. The sale itself was a huge success. Many people visited, and we raised over £500 for the hospital charity on the day. And we also generated a lot of interest and publicity for Pre-Love, the main scheme. Other NHS hospitals contacted me saying they wanted to set something up similar. So in summary, Pre-Love started as an idea, and it's now an established brand at Milton Keynes Hospital. All staff know about it, and they all use it on a daily basis. Now, I'm confident Pre-Loved will only get bigger and better as we continue on our quest to reduce our carbon footprints by reusing and recycling. The hospital actively wants to be a good corporate citizen, and I'm proud that Pre-Loved is helping us meet our objective. I may have come up with this idea, but so many other people have helped make it all possible. They know who they are, and I thank every single one of them. I'm extremely proud to be part of the team at Milton Keynes Hospital, and I cannot wait to implement some new initiatives in the future. Now, if anybody does want to know more about the scheme, feel free to get in touch with me, and feel free to contact me on Twitter. It's @Yerrell1, and I think that's come across your screen a couple of times now. Once again, thank you for your interest in our Pre-Loved campaign and pledge, and any questions are appreciated.
Thank you, Mark. Absolutely amazing, and I'm really looking forward to chatting a bit more with you after Martin's presentation.
Okay, thank you
for that. Yeah, so don't go. We
I'll still be here.
Questions in a moment. Yeah. Okay, so I'm just going to go over now to Dr. Martin Ferrier from Wigan and Foundation Trust. And I'm going to ask you to present, Martin, for about 10 minutes, and then we'll come back with any questions. So over to you. Tell us about your pledge.
Hello, Jackie.
Oh, hi.
Hi.
How's it going?
Waiting to use my screen share, so I need to be able to share my screen. I haven't got a button to share it yet.
Okay. Are you sorting that out, Paul?
Hi, it's Mina moonlighting as Paul right now. Martin, I've given you presenter control. So if you just go to the top of it, go to the top of your screen and click on share, and then say my desktop.
Share, yeah. My desktop. Okay. Paul sent me a button last time.
Oh, sorry. Don't know how to do that. Sorry about that.
You'll need to tell me when I'm actually actively sharing and when I'm not.
Yeah, you're sharing your desktop now.
Great. Okay. Can you see my desktop now? Is that okay?
We can, yes.
Excellent. Good. In which case, my name is Martin Farrier, and I'm Associate Medical Director at Wigan. I wasn't actually when I made this pledge, and I wanted to talk to you about the pledges that I have made. I've actually made 3 of them. Funny thing about pledges is that when you make them, especially when I made this one, I didn't actually expect to be sharing it with anybody other than myself. And so it was a pledge to me, really. But in order to explain it properly and explain why it links up with the other 2 pledges, I need to tell you a story. But my first pledge was that I would work tirelessly as Associate Medical Director to ensure that our patients got the best care we could deliver. And that was at a point in time when my job was changing. I was becoming Associate Medical Director. And it's about core values. It's about me not stepping away from the things that I absolutely believe in. But I need to tell you the story of what I believe in. The cartoon there is one of my favourites. It's a Larson cartoon. It's about lemmings, and lemmings who are diving into the sea, and one of them has a life buoy on. I love the cartoon. It's when Larson did it, it was about evolution of the species, and you can see it that way. But you can also see it in about leadership and about finding life buoys. And I spent a lot of time trying to find life buoys to make a difference to outcomes for people. Our story has lasted some 7 years, and I will tell you the story of our life buoys, if I may. We spent a lot of time trying to work out what it is that we could do in order to change outcomes. 7 years ago, we had problems with raised mortality rates in our organisation, and we didn't really understand what the problem was. So we set off on a journey which was to try and understand why people died, what happened, what went wrong in our organisations we cared for people. We set up a process which I've been doing every week for the last 7 years. In fact, I've only just finished doing it today. What we do is we go down and we look through all of the notes of the patients who died, and we concentrate on the ones who didn't go to intensive care and the ones who weren't on the care of the dying pathway. We do that on a Friday, so I've just done that. I'll go home a bit later on and I'll write that up, and then on Monday morning I will send the results out to 500 of my best friends. The 500 is probably a little more than a 500, it's somewhere under 1,000, but it's a lot of people within our organisation, and of course it includes all of the clinicians. If you do that, you can imagine it generates a fair bit of discussion, and the discussion is really the bit that we're trying to get to. The discussion is about what we think is wrong, whether we can agree on things that aren't as they should be, and whether we can do something better in the future. The discussion leads to us making some agreements, about life buoys that we think we might be able to do something about. So here's an example of something which has been a problem and something which we've been able to get to. So if we find an area where there is raised mortality, evidence of harm, so for instance, I could find evidence of antibiotics not being given in patients who have infections, and something which we could do about it, meaning that we could treat sepsis better, we can make sure that we give the antibiotics and we give them quickly, then we can do something better with sepsis care. Now that happened in our organisation, and we did a lot of work on improving outcomes from sepsis. But it isn't the only thing that we've done. We've done various other bits and pieces. We've looked at our escalation process and changed the way in which escalation happens in our organisation. We've looked at checklists and provided various different sorts of checklists, including the one that you can see, which is a ward-round checklist. We found various bits and pieces that have gone wrong. So the guy in the chair is about frail elderly people. He isn't frail and elderly, but what we found was that frail elderly people often got cold in our hospital, and we thought that was possibly about the environment. We thought maybe we weren't turning the heating on enough, but actually that wasn't the issue. What is that frail elderly people don't generate much heat, and if you put lots of blankets on them to keep them warm, you actually insulate them from the warm, and they don't get any warmer. You in fact make them colder. What you have to do is put on an active heating blanket and warm them up. This was something that we hadn't really understood, and when we bought the active heating blankets, it made a world of difference to being able to make sure that people stayed warm when they were ill. We found various other bits and pieces. Here's another one about Parkinson's disease. We know that when people come in with Parkinson's, they're often put nil by mouth, which causes an absolute mess with their medicines. They then go stiff, they can't swallow even more than they could before, and it all goes wrong. So what we did was we put packs into our A&E and set up a new drug chart for Parkinson's in order to make sure that people got their medicines delivered quickly. Talking about aspiration pneumonia, because Parkinson's are particularly at risk of aspiration pneumonia, we've set up work to try and reduce the rate of aspiration pneumonia. That work goes on about raising bed ends and about mouthwash. That's something that's happening now. We then set up work, or rather, as a consequence of that, we set up work which is about trying to identify the things that we thought were the most important preventable harms. That's our list we generated last year. We generated a list for that about 2 years previously as well. And it's a list of work which we think that we need to do, and a list of life buoys, things that we might be able to do to change outcomes in our organisation. With the list of life buoys, we decided that we needed a whole set of people in order to help us deliver those, to find out ways of making sure that we could improve things for the patients who are at risk or who have problems in our organisation. So we set up something called Quality Champions. We did that about 2 years ago. Quality Champions are people who volunteered to become part of our process, to take on work. And we provide them with a 3-day training in quality improvement technology or quality improvement techniques. And we then ask them if they will take on a project. And if they do that, we give them a bronze badge. That's their badges that we wear around the organisation all the time. And if they deliver some improvement, we give them a silver badge. And if you do that on a big scale, you get a gold badge. That's my badge, incidentally. We share that with a lot of people, and we now have 190 people who've joined in with our Quality Champions program. They've volunteered to do so, and they've taken on about 60 projects now to improve outcomes in our organisation. And things have generally gone well. We know that at the beginning of our organisational problems, we had more deaths than we thought was appropriate as we measure against everybody else. And the number of people who die in our organisation has come down a great deal. That's not just about the work that we've done, it's been about all sorts of other things that are going on in society around us. But the fact is that fewer people die in our organisation. Now, that was our story. That was the things that have happened to us. So back to my lemmings. The lemmings are diving into the water. They are leaping forward, and the person at the front is running forward and taking them quickly, which isn't necessarily the right thing to do. I know that in my world, I've moved forward in the hierarchy. I'm a little further to the front of the hierarchy. But the thing is, and that was the pledge that I made first, I need to remember the core values that I have and make sure that I hold true to those core values and don't just leap off the front like the rest of the lemmings. Now, if you want to improve things, improve outcomes, then we need a system by which we can hand out the lifebuoys. It's one thing to have a good idea of how I might be able to swim, but it's an awful lot better if I can find a way in which I can get other people involved in doing that. And so the Quality Champions was about having people to help hand out the lifebuoys, and in fairness, but also to invent the lifebuoys, to find a way of being able to do something better. And that was a social movement. It wasn't particularly how we set it out or intended to, but that was kind of how it began. And so, as I was thinking about pledges, my second pledge was to find and always seek the shared purpose, the one that we have, and to continue it and to maintain it and refresh it. And it linked in with the fact that my first pledge was about not losing core values. Second pledge is to make sure that I remember them and refresh them for each of the people that are in our social movement. That's me. I was in Paris. I was lucky enough to be in Paris. That's at the top of the Arc de Triomphe. Now, that pledge is important to me in the same way as my first pledge. The third pledge was about social movement. It was about the fact that I value social movement. And the more I understand, the more I think that that's important. We've begun to develop that here, but my pledge was to try and involve ourselves in social movements wherever we can find them, both to develop here and outside. Which is, of course, therefore, why when NHS Change Day was about, that became important to us too. And I encourage lots of other people to get involved in making pledges as well. It's also why I therefore value what's going on in NHS Change Day and wish to be here now. So part of my doing the do is actually doing this speech, or doing this talk to you. And so I wish to be involved in social movements, understand them better so that I can help generate change, both in our organisation and outside. In a funny sort of way, my pledges for the future are as much about our organisation as our organisation joining in elsewhere. And as with all pledges, the fact is it's got to start with me. So I make my pledges. They were initially personal. I thought they would stay personal, but they're now shared. And that's okay, because that was part of the deal with the NHS Change Day. So I share, and now I do, and I hope to inspire too. Thank you, Jackie. I'm going to hand back the control, he says, flipping back out of his system, to you guys.
better with the screens. Sorry, one of the presenters has dropped off, so I'll try and take over for now. Give me 1 second.
Am I still going? I can't tell.
Yes, Martin, do carry on, please. Thank you.
Hello. I can't tell from my screen whether I'm still talking to you or not, but I can now. Hello. Was that Jackie?
Hello.
And Paul.
Hello, Martin. Yes, Martin, do carry on.
Okay, I think you're back on screen. I've no idea whether I'm still sharing my screen with you or not. Can I also say, to Mark, if he's still listening, I thought your pre-loved idea is absolutely fantastic. I love it. Well done.
Yeah, the screen share's ended. If you'd like to carry on with it, I can put it back on for you now. There's a glitch then for some reason, so I'll pass you the presentable back if you'd like to finish up.
Okay. Forgive me, Paul, before you do, how much did everybody hear? Did they hear all of that, or do you need me to repeat any of it?
I heard it all the way through. It's just we lost the presentation towards the end, I think. Can people just put in the chat box what if they felt differently, if people lost anything? No, it does look like it was just the picture that went there, Martin. So if I pass you back, you just carry on from where you'd left off. Thank you.
I've more or less, don't worry, I've finished. Don't worry, you don't need to hand me back particularly. I've told you the story I wanted to, and I'm aware of the fact that we've exceeded the 10 minutes.
Right, okay, that's fantastic. Thank you.
It seems unfair to carry on beyond the 10 minutes.
Very democratic of you. Right, okay then. Well, thank you both for those presentations. Now, does anyone have any questions they'd like to ask? If people would like to either raise their hands or post them in the chat box.
Paul, I have a question soon, could I ask?
Yeah, you'd like to ask?
Mark, are you still there?
Yeah, I'm still here.
Yeah. Just to ask you, really, this is a fantastic idea. Has it spread to other local hospitals in the area? Is it spreading widely around your part of the world? Do you have feedback from other hospitals?
I'm very keen on other hospitals getting involved, and we'd quite happily share the ideas with them. We've had a few expressions of interest, but don't know of any other hospital that's actually set up a scheme as involved as this. Certainly, hospitals do have recycling schemes, but I'm not sure about, yeah, as I say, something that's quite as involved with this. But we're very happy to share.
Thank you for that. We've retweeted your details, so you may get some people contacting you through Twitter to find out. I guess it's just starting off, isn't it? Other hospitals might think it's a fantastic idea, but it's just taking that initial first step of planning what you want to do, and then just taking that first step to go through it. And the local community, it sounds like you do have a lot of support from them. How did you actually start by generating that support from the local community?
We had some great people around us helping us. Michaela Firth, one person, she had some contacts and got us involved with the MK Dons. As soon as other people hear about these things happening, they latch onto it also. We want to engage with the local community, and we'll go out there and find these people to help us.
That's great then. Thank you for that feedback. Pip, I believe you're on there. Are there any conversations or questions taking place on Twitter?
Hi, Paul. Thank you. Just been quite quiet this afternoon. I think there's quite a lot of appreciation for both Mark's and Martin's presentations. I certainly really love the idea of the 3 left items, but also the kind of the metaphor of the life voyage was really great. But no, I think it has been fairly quiet, apart from just general appreciation and people really expressing their gratitude for the things that are being shared and the time that people have taken. So I think it's been a really fantastic opportunity for many people to learn from the stories that we've listened to today. Thanks.
Great, thanks, Kip. Do we have any other questions from the line? You can just raise your hand. Kathy?
Yes, can I ask a question on behalf of Alice O'Neill, I think joined us on the chat. Is that about the quality champions and the badges? Is Martin still with us? It was just a question about... Hello, who's that? Is that Martin?
I'm Martin, hello.
Yes, hi there. One of our participants on the chat room is commenting about the badges and saying what a fantastic idea that is.
Yeah, I love them too. They are things which we value enormously, because you wear them all the time and everybody recognises them and people will come and talk to you about it. They are well understood around the organisation. People now, everybody knows what they are and what they're for, and it's something which you become proud of, and so it's a way of valuing the quality champion movement and making it something which is desirable. It's literally wearing a badge of the thing that you believe in, which for me is actually part of the sort of social movement process. It's wearing it on your sleeve. The badges cost almost nothing to produce, and they just identify it, and it's a very simple way of doing so. And you can print whatever you need to on it, so I can identify myself as who I am, but I'm instantly recognisable as a quality champion.
And a great way, I guess, of sharing this project, sharing this idea, encouraging other people to join in, encouraging people to ask questions, I guess, as well.
Yeah, absolutely.
Thank you for that.
Okay, do we have any more questions on from the chat or just people in general? If you can just raise your hand. No? Okay, so maybe if we just get some final reflections from the speakers. So Martin, do you want to go first and get some your final reflections?
It's good to be able to share my pledges, even though when I made them I thought that they were entirely personal. It's good to be able to share them. It's almost in a funny sort of way, a way of almost recommitting to them. I remember them specifically. It's good to share them because I remember them more, and they guide the decisions and the actions that I will make in the future. I think that it's a lasting pledge. It stays with me. And by talking about it more, it stays with me more. So it's great to share.
Great to hear. And Mark, how about you? Any final reflections from you and about your pledge? Mark, are you there?
Oh, hello. Yes, I'm still here.
Do you have any final reflections?
No, all I'll say to people is if you've got an idea, stick with it, relevant to your grade, carry it forward, make sure people hear your voice, and your ideas will come to fruition.
Okay, great. Well, thank you both very much for spending the time today to talk about your pledges in action.
Thank you.
So if everyone, thank you both. So if everyone can give both of them a virtual round of applause, that would be amazing. So again, how you do that, there's a little bubble with a check mark on it right beside the hand. Click on that and click on the applause button. Thank you both. We're going to take then a 10-minute break, and we'll be coming back to what I've been waiting for today. One of my own personal highlights, the virtual graduation, which will start in about 10 minutes from now. So if everyone wants to take a quick 10-minute break, we'll be back with virtual graduation. Okay, thank you.
Thank you, everybody. I'm back. Thank you so much, Martin. I'm Mark. Bye.
Bye.
Bye. Hi, I just want to do a pre-test for the virtual graduation. So I see we've got CJ, Celine, and Victoria. Are you all on the line? We've just unmuted you and put you up to panelists. So I just want to do a sound check with you all. So Celine, are you there?
Hi, I'm there. Very happy to be here.
Excellent. Great to hear you. And do you have, I haven't turned on the video camera yet, but we'll turn it on. Hang on, we're just turning it on now. Let's just see if we can, we'll do a video check as well. So hang on a second. Okay, Celine, if you turn on your video, we should hopefully be able to see you.
I thought I had done it already, but let me try. Oh, good.
It looks like it's coming up. Yeah, we can see you. Great. Hi. Okay, so we're gonna put you back on mute now, and I'm gonna see if Victoria can hear us. Victoria, can you hear us? Excellent. And do you have a camera?
Yeah.
Okay, let's test your camera as well. So your camera should be enabled now. So if you just click on it on your screen, and then hopefully we'll see you in a second. Okay, looks like it's starting to come up.
Yeah, it is Max. Yeah, that's fine. And how many of those are there? There were 40.
Oh, hold on, we can see Celine again.
Hi, it's Helen as well.
Oh, great. Okay, we'll check your camera here in a second.
Yeah, I can see me.
See you, Helen.
Yeah.
Okay, Victoria, we still can't see you.
You can't see. We need to see Victoria.
Yeah, let's see if we can. So your camera should be enabled. So if you have a little camera, you should have a little camera button beside your name. That's probably grayed out. If you just click on that camera button, then hopefully your video will show.
I took it out. And then I couldn't find it, but I definitely didn't take it. I took it out. And
no, there's no
quite well, don't you?
It won't let you yet? Okay, well, we'll come back to you in a second, Victoria. And let me check CJ. So CJ, can you hear me?
Yeah.
Yeah, I can hear you. Can you hear me?
Yeah, we can hear you. And CJ, do you have a camera?
Yeah, is that on?
It looks like it's on. Just hang on. Yeah, we can see you now, CJ.
Brilliant.
Okay, great. Okay, so we just need to sort out Victoria's camera. So Victoria, I'm just going to go switch computers and see if I can check it out right now. So just bear with me for a second. Okay, Victoria, do you want to check one more time?
Yeah, the camera's working at our end.
Okay, that's very bizarre. It's not showing up for some reason. Let me see if I disable a few other cameras.
Clicking on the camera button.
Okay, let's try now. Yep, still can't see you for some reason.
Are you getting an echo when I'm talking?
Yes. Yeah, we're getting a little bit of an echo too.
We're getting a lot of echo.
What does it sound like now?
Better. Yeah, that's much better. Okay.
Can you hear me now?
Yep, we can hear you. There's no echo. Just good. It's just a camera issue for some reason. But as long as we can hear you, slides, and when Paul, my colleague, comes back in the room, I'll see if he can figure out what's going on with the camera. But for now, anyways, we can take a couple of minutes, and we'll get started in 3 minutes from now. I'm just going to go on mute as well.
Mina, can you just ring me around? Can you just give me a quick call and we can just talk it through what's going to happen? Is that okay?
Yep, I'll give you a ring right now.
Thanks.
Okay, when I'm here.
Hi, Celine, you look great.
Hey, hi, how are you?
I'm good.
Very happy to be there and very impressed again by this event that you're organizing.
I think we'll get to 8 p.m. and then I'll relax. I'm going to talk to Mina now.
Stop snacking.
horrible.
So Victoria, prior to the event, we just want to check if you can get your camera working okay? And check your sound. Thanks, Lee. Victoria, can you hear me? Because I can't hear you.
Yes, I can.
Yeah, I heard something then.
Hør på konferencen. Så skal du bare... Ikke?
Hvordan kommer jeg til?
Du er inde.
Okay.
Du er bare ved telefon.
Nej, jeg har ikke været noget. Det har ikke været noget, det startede. Welcome graduate. Ja. To all.
You don't have fun with a link on YouTube. That's a place for YouTube if you can find out how to use it.
Hello, everybody. I'm very excited to welcome you here today to this graduation for the School for Health and Care Radicals. This is the first time we're doing something like this, and I'm really, really excited that this is happening right now, and I hope all of you are excited as well. We've got a bit of a packed program, and I'm going to be your master of ceremonies and guide you through the program today. So first of all, we're going to start off with the welcome and opening speech by our keynote speaker, who is also the Dean of the School for the Health and Care Radicals, Helen Bevan. So I'm just going to pass it over to Helen right now to give the keynote address.
Here I am. Can you hear and see me okay?
We can hear you.
Yeah. Can you see me?
We can see you. Excellent.
Fantastic, yeah. So, congratulations to the graduating class of 2014 of the School for Health and Care Radicals. What I wanted to do was to just tell a little bit of the story of the school. So what happened was that after Change Day 2013, we conducted a learning review of the level of activism for change and improvement. And what we found was that the biggest issue that was stopping our frontline clinical staff, trainees and students, as well as patient leaders, from taking action to create improvement in their own areas was a sense that they needed to have permission to make a change. So what we decided to do was to set up a school. And, how do we set up a school so that people, felt that they had the power and the permission and the confidence to make change? So we set up the School for Health and Care Radicals as a virtual school in the 5 weeks leading up to NHS Change Day 2014. And the response was just so amazing. We got, in the end, 1,600 people went through the school from 40 different countries. And, the school was virtual. There was, for 5 weeks, there was lectures every week and lots of opportunities for people to connect. And I think that what kind of surprised us and amazed us was the extent to which people really connected with each other. So I think that the best thing about the School for Health and Care Radicals was, the extent to which people in many different countries, in many different contexts, came together and connected and united around their roles as being agents of change in health and care. And I think the impact of the school was amazing. Do you know that the materials from the School for Health and Care Radicals were downloaded from the school website more than 25,000 times? At the time the school was happening, the reach was over 2.5 million every week. And about 150 people became certificated change agents and were really pleased to graduate so many of our change agents here today. And those of us that were part of the organising group of the School for Health and Care Radicals, we got far more than we gave, and we learned so much. Okay? We learned that change agents are all around us, that there are so many people. There is a well of potential energy for change. Okay? And we learned that these change agents are everywhere, and people who can rock the boat and stay in it, and who want to link up with other people and want to create change. So we're very proud that our graduates are going through this ceremony today, and proud to be supporting you. And we hope that this will be a long-term relationship, and we hope that you will go on rocking the boat and being the disruptors and the dissenters and the game changers in your organisations. And so, what we wanted to say really was, please keep going. Please stay in touch with us. We are thinking about what we're going to do next year, and the graduating class of 2015. And it will be great to get your input. And finally, I think what we wanted to say to you is to think about how you keep going, how you keep your energy. Please keep these connections. And we very, very much look forward to the ceremony now. So thank you.
Great, thank you very much, Helen. I'm pleased to now move on to our first valedictorian. So we've got Catherine J. Wilson, who we're just going to turn on your camera right now, and we've unmuted you, CJ. So please go ahead with your address.
Hi, can you hear me?
Yep, we can hear you.
Brilliant. So hello and happy Friday, everyone. I'm CJ. I'm a business manager for clinical haematology services at Imperial College Healthcare, NHS Trust. I'd like to start the address by just offering a little bit of context to my NHS Change Day pledge. And this year, NHS Change Day came at a really interesting time for me. I just left the NHS Graduate Management Training Scheme to start a new job, and I'd only been in post for 5 days. For those of you who don't know the scheme, it's an intensive 2-year training program to develop up into NHS leaders. The transition from being on the scheme to being off the scheme was one that I knew would be really hard. I knew I'd be not only learning a new role and a new organisation and a new service and a new team, but that I'd be dealing with a lot more responsibility and accountability in my role. When I was thinking about what to pledge, I wanted my NHS Change Day pledge to be something that improved the experience of patients and but also helped to establish me in my new role. One of the only things that I knew about the service before I joined back in February was that we really struggled to achieve good cancer patient experience at Trust. So my pledge was to explore outpatient areas in our department and seek out opportunities to speak to patients and family members and carers of those patients. It struck me that when you're a patient, you might not feel as empowered to share your experience, especially if it has been a poor one. And that's especially true of our patients in our department who stay with us for a very long time and generally for the remainder of their life, however long that might be. This wasn't just a case of finding an opportunity to speak to patients. In our line of work, it's surprising how easy it is to lock yourself away in an ivory tower or a magnolia dungeon in my case, and never see any patients. And being the new girl, that would have been even easier. This tendency was just exacerbated by a completely irrational fear that I was going to do something wrong. Because as I kept getting reminded when I started in the NHS, I'm not clinical. The School for Health and Care Radicals really opened my eyes to how I could make this change in myself to improve my interactions with the department and its patients. The whole school process was a bit of a revelation. It was such a unique opportunity to interact with hundreds of healthcare professionals with such a variety of backgrounds and levels of experience. The success really lay in everyone's wholehearted engagement in the subject matter. Tweets are flying in from all over the world, and I know I'm not the only one who is impressed by the transatlantic night owls that joined us. And Deborah, that's you. Although we discussed a huge amount over the 6 weeks, there's one thing that really stuck with me, and it still does. And the whole of Change Day itself, while I was pushing the boundaries of my comfort zone, I kept repeating to myself the quote from Robert White that was presented, which was, all the concepts of stepping out of your comfort zone mean nothing until you decide that your essential purpose, vision, and goals are more important than your self-imposed limitations. When I first heard this quote presented, I just remember thinking, wow, that's so true. My comfort zone is just a self-imposed limitation. So on Change Day and on every working day since, I've gone out of my comfort zone. I've gone out to my clinical areas, visited staff, identified myself as patients, and had cups of tea and biscuits with SHOs and healthcare assistants. Having that light bulb moment at the school and the pledge that had me out and about totally changed my mindset about what it meant to be part of the department. I've had some pretty strong feedback since implementing my pledge, and although sometimes and often I get teased for visiting the wards just to say hello with no medical purpose, the teams have told me that they feel that I'm always accessible enough that if there ever was a problem, they could just ask me, and they have a lot. I remember one example, we had a pyjama shortage on one of our wards, and the patient was left without any pyjama bottoms. He hadn't said anything to the doctors or nurses. I was talking to his wife, and she mentioned this kind of non-clinical aspect of his care, and off I went to find some PJs. I remember being just so baffled by how surprised everyone was that I'd managed to find some pajamas, and thinking to myself, gosh, that was so easy, and I would have never have thought that I would be allowed to do that anymore. So Change Day and the School for Health and Care Radicals gave me the permission to redefine my comfort zone and be a better manager for the staff in my department and for the patients in my department. And I'd like to end by saying a very, very big thank you to everyone who's involved.
Thanks so much, CJ, for sharing your inspirational story with us. So we've got a few more valedictorians. So I'm going to move on to the next valedictorian. We have the next slide, Paul, please. And so here we have Dr. Victoria Hewitt. I hope we've sorted out the video camera. We have our fingers crossed here. So Victoria, if you can just go ahead, hopefully we can hear you and see you. Are you there? Victoria? Hello? Can you hear us, Victoria? Okay, so why don't we go first to Celine and see if then we can come back to Victoria.
Sure. Can you hear me?
Yep, we can hear you, and I think your video. Yep, we can see you and we can hear you. Excellent. Go ahead.
Thanks a lot. We have chosen the harder path. We could have made easier choices, but we haven't. Some feel the world is quite acceptable the way it is, but we don't. We're here together attending this graduation ceremony because we chose to be change agents. We want to change things for the better. The small difference with not being a change agent, but it's actually a huge one, is that we take action. Not necessarily a revolution, action. Many of us have been involved in change initiatives for a while already. Some started as early as in primary school. I was still very disciplined at this stage. But then earlier this year, we've attended the School for Health and Care. We've dedicated time and brain power to this. Can you hear me? Yes. There's a strong echo. Okay, good. So earlier this year, we've attended the School for Health and Care Radicals, and we've dedicated time and brain power to this. We've made pledges, we've implemented our pledges, and today we're graduated. That feels great. I'm so happy. But graduation is certainly not what drives change agents. We're not seeking honors or rewards. We're thriving for impact. We want to see results. Being graduated is a concrete indication that our change agency has an impact. It also bonds us together, and this connection is what will push us to continue to move forward with bringing change relentlessly, because we're not alone anymore. And since we're connected, and since we're numerous, we're going to be more efficient. This is of paramount importance. Why? Because we're not dealing with trivialities. Most of us who attended the course are linked to healthcare as professionals or future professionals, as healthcare providers, consultants, employees, whatever. Our raw material is people's health, our fellow human beings' health, meaning their life, the confidence they can have in the future, their well-being, the well-being of their families, their communities, our nations. We know, everybody knows, that some things have to change. There's a lot of frustration with the way healthcare systems and companies are run today, and it's very difficult to change such complex organizations. Inefficient and costly structures, bureaucracy and complacency, outdated management practices, etc., are none of the lesser evils. But I believe, in fact, no, I'm absolutely convinced that we can viralize good change. We can spread innovation, efficiency, and humanity in our systems. And we're doing this, among else, through our pledges. I pledge to motivate people for taking an individual responsibility into driving change. This was my pledge. Shortly after the School for Health and Care Radical sessions ended, I was to deliver a keynote speech to 50 top leaders of French university hospitals who gathered for their annual meeting. And innovation was the overarching theme of the meeting. I decided to focus my speech on innovating oneself and to leverage the school's resources for my speech. My aim was to inspire the audience and turn them into agents of change. The speech tried to explain how and why the world is changing, and what it means, and how it makes structural changes mandatory. And then it focused on change starts with me. Changing oneself, challenging our own perceptions, and changing the way we drive change build the foundation for our transformation efforts. I spoke about communities, networks, social collaboration, inclusion, and open approaches. And as a result, some of them declared they had been convinced and they had changed their mind regarding those topics. Some asked me for contacts to implement initiatives in their hospitals. Some opened a Twitter account. Many acknowledged a different perspective on inclusive collaboration for engagement. So, of course, I would have loved to convince the entire audience at once, but we know change is hard, and it takes many more conversations to change behaviors. Conversations, well, in fact, conversations are far from sufficient. What the reluctant must see is concrete applications of modern thinking, successful, tangible initiatives. And this is where I believe lies the main value of the NHS Change Day and the School for Health and Care Radicals. This is change in action, not just in words. Change that bonds us together for a better world in practice. So in the name of all change agents and for what we are fighting for, I would just like to say a big thank you.
Thank you very much, Celine. We're giving you a virtual round of applause right now, people. If you can use your little bubble with the check mark, you can do that for both our first two valedictorians. Okay, so we're going to try with Victoria now. So Victoria, can you unmute yourself?
Oh, right, yeah.
Excellent. We can hear you now.
Hi.
Okay,
Hi.
go ahead.
Can you see me?
We can hear you, but we can't see you.
Can you see me now?
No, not quite yet.
Okay, I'll start talking then. Thank you so much for bearing with us for all our IT problems that we're having at our end today. I'll also just start by saying I'm very emotional at the moment because my husband graduated yesterday from his MBA and my daughter's had a speech day this afternoon, so there's already been plenty of tears all around. No doubt there'll be more to come. I'm just so honoured that you've given me the opportunity to deliver this valedictorian speech on behalf of all the graduate change agents from the School of Healthcare Radicals. Now, like most of you out there, I was compelled to answer the call for all healthcare radicals everywhere to rock the boat but not fall out. First of all, I absolutely love the word radicals. That sort of chimed with something in my own heart. And in common with some of the best change agents, I don't have an awful lot of power in what I do. I have more than some, but not a lot. But like many of you, I'm a frontliner, so I work on frontline clinical practice. And I see healthcare in all its raw, painful, often awe-inspiring reality, driven by passion and a belief that when it comes to caring in health, we can do better. Through the school, we were given some absolutely brilliant quotes to motivate us along the way. And here's one that I particularly like from the famous raconteur Will Rogers. He said, "Even if you are on the right track, you'll get run over if you just sit there." He's right. Even when things are going well, we know it won't always be like this. And we, as radicals and change agents, will never settle for less than the unobtainable perfection. Radicals want to change the world of healthcare. Change agents know how to change the world that they work in. And that change starts from within, by acknowledging the ugly bits of ourselves, the bits that maybe don't work so well, and by celebrating the successful parts that do. Through this school, we've learned to accept ourselves and accept the changes that we want to see in our lives, making them genuine and authentic for us and for others. And perhaps that's the greatest challenge. I know it has been for me, but this is where change truly begins. And we as radicals relish a challenge, don't we? Right? Now that we're change agents, we have the skills and courage to overcome the fear that can so often hold us all back. We will be optimistic in the face of adversity. We will roll with resistance. No longer do we see barriers. Now there are only opportunities to talk, to share, understand each other and grow together. But we can't do this alone. The school has taught us how to connect with others and build communities for change. It's our job now to inspire others and ignite that fire for change that not only burns brightly, but smoulders long. So I'm now going to take the opportunity to thank Helen, Jackie, Naomi, and the amazing team who educated, supported, enthused, and enabled us to follow the school's motto with head, with heart, and minds. As I said earlier on, the quotes and stories we share were truly inspiring. So I want to end with this one from the 13th century Persian poet Rumi. And this was actually the quote that I came across that really inspired me to answer the call to action. Yesterday I was clever, so I wanted to change the world. Today I am wise, so I am changing myself. Graduate change agents, we are now both wiser and cleverer and ready to continue our mission towards a better healthcare future. For us, this is the start of something great. For our patients and those that we truly care for, it's the beginning of something even greater. Thank you.
Great. Thank you very much, Victoria, for your inspiring speech. And we also give Victoria a round of virtual applause, and we can see you. Yay! Thank you. Thank you. Okay, so in the spirit of true virtualness, we have another valedictorian who's actually recorded a message for us, and we're going to play the recording and show his image at the same time. So Paul, who's our technical genius, is crossing his fingers right now, and we're really hoping that we can hear this audio. So just bear with us for a second. Okay, once again, I would like for everyone to please congratulate our 4 valedictorians. So if you can just put your hands together for the final sign in this section, that would be great. And you can do that using the applause button. Great, I can see that all happening. Okay, so now we're moving on to our roll call ceremony. So as we move on to this part of the ceremony, I'm going to explain what exactly is going to happen right now. I would like to thank all of our graduates who are currently on the WebEx, and you can see them all if you look at the attendees list. Some of the graduates have written down that they are graduates, and if you scroll through that list, you can see the names. Please take a minute to look through those names and see the people who have been graduated as certificated change agents. So what will happen now is we've got the lovely Pip Hardy from the school who will be doing the roll call. And what Pip will do is she'll show a picture of the certificated change agent and read out a statement from that change agent who they sent it in earlier, reflecting upon their experience of becoming a certificated change agent. So thank you again for the graduates and also for the people who have joined to be part of this ceremony and to congratulate as we're going along. Okay, Pip, we're going to unmute you right now. You're unmuted.
Thank you.
And let us know when you'd like to move to the next person on the slide.
Well, all I can, yeah, perfect. That's wonderful. So, yeah, shall we start with Carolyn?
Yeah.
So Carolyn said, as agents of change, we've innovated and created, often critical, analytical, sometimes practical. We've stood on the edge, steered a path, cleared the way, rocked the boat, persuaded, cajoled, facilitated, taken a vote, and on graduating the school, now officially certificated as a health and care radical. So, we're not going to applaud each person, are we? No. I don't think so. Lana. Lana said, I'm very honoured and, as they say in Scotland, well chuffed to have been part of the school and to learn and share so much with an amazing bunch of people. Despite the criticism that the NHS sometimes endures, it's fantastic to be reminded of the wonderful, motivated, compassionate and committed teams and individuals who go the extra mile to make things better for the public, our families and communities. A great experience. Steve Collis said, although the certification is virtual, the power behind it is very real. This should inspire us all to make change and support others to do the same. It certainly has inspired me. Amelia Randall. I'm proud to be a certificated change agent and will use what I've learned to make a difference. Helen Sanderson. Being a certificated change agent means recognizing that I'm still learning by thinking and doing. And I'm grateful to be connected to a group of people who share the same passion for making change in a thoughtful, real way that always starts with ourselves. Julie Smith. I'm very proud to have achieved this new qualification. Now to use it. Linda, we actually have the same quote for Linda as we had for Lana, so I think we might have had a bit of confusion there, but I'll read it again, because I imagine they're similar sentiments. I'm very honoured and well chuffed to have been part of the school and to learn and share so much with an amazing bunch of people. Despite the criticism that the NHS sometimes endures, it's fantastic to be reminded of the wonderful, motivated, compassionate and committed teams and individuals who go the extra mile to make things better for the public, our families and our communities. Maxine Craig. I love feeling like I'm certified as a boat rocker, and having it on my email signature starts so many interesting conversations. Mola Imaduddin Ahmed. I'm really proud and happy to be a certificated change agent, and this inspires me to work harder towards improving patient services in the NHS and spreading awareness among doctors regarding medical leadership
and quality improvement. Philip Pearson. How I feel that being a change agent isn't so much a reflection of what I've done, so much as a statement of who I'm becoming. Analogous to a medical registration, you graduate as a doctor and then you start work. Rebecca Rose. I pledged to remember that change begins with me, and being recognised as a certificated change agent helps maintain that positive mental state. Ruth Sadler. Becoming a change agent is being at the forefront of the movement of change within the NHS. It's about celebrating our teams and diversity through good leadership. Su Chong Ma. Being a certificated change agent makes me feel like I will never be scared of change again. Stephanie O'Brien. I'm so proud to be a certificated change agent, as I have proved to myself how I can change and how much I have changed, achieved and developed in the last 2 years. Actually, I'm immensely proud of myself. Jonathan Richards. I'm part of a network of passionate enthusiasts who value the NHS and want to make things better for staff and people using our services. Our shared passion keeps me going through hard times. Mandy Hollis. I feel immensely proud to be recognised as a certificated change agent and honoured, no, actually humbled, to be amongst a company of so many inspirational people. Congratulations to everyone who's graduated, and thank you to Helen Bevan, who's been a key inspiration to me throughout. Joanne Pons-Laplana. I feel over the moon to become a certificated change agent. Completing the course, I feel I gain the license to encourage and advise other people about change after doing the walk. Finally, I found my tribe and a place I can call home. I love being a change agent. Martin Farrier. I feel empowered. Joe McRae. I'm proud to be a change agent. I'm proud to help friends and colleagues rock the boat with NHS Change Day and the School for Health and Pararadicals. Alison Jones. I feel very lucky to have been a small part of the School for Health and Pararadicals, and I'd like to thank my wonderful mentor, Carol Reed, for all her support and guidance. I'm excited about rocking the boat and staying in it as a newly qualified nurse in the near future. James Rawson. Many people see the problems in healthcare, but lack the tools to improve and solve them. For me, becoming a certificated change agent is about learning new skills about how to bring about positive changes in healthcare and teaching those skills to others. Erica van der Schwick-Deluve. Being a certificated change agent and taking part in the international group of change agents makes it possible to expand the movement of change in healthcare and to show all of us why it's necessary to start change by yourself in collaboration with others. Joanna McCormack. I'm delighted to be part of the community of change agents working to make the healthcare experience better for patients and staff. Madeline Rosboom. How I feel about being a certificated change agent is as belonging and having permission and strength to think and act differently. Anu Aurelio. Being certificated as a change agent is like obtaining a driver's license. I'm now legally not knowing what I'm doing and need to continue to learn every day. Jennifer Verma. Being a certificated change agent gives me that extra energy boost, that stamp of approval, that motivation to keep at it, working with clinicians, healthcare managers and patients
to make healthcare better for all Canadians. We all know the saying that if you want to go fast, go alone. If you want to go far, go together. As change agents, we can go far together. For that, I feel fortunate. Lily Sorensen. I love to be part of an international network which can support me to fulfill my vision, transforming healthcare to human care. I'm not a lonely and fearful rider anymore. Temptation Chigola. I feel like if I can dream it, I can do it. Julie Smee. Here is the sentence. I'm feeling very excited to be part of this grassroots movement, and I feel invigorated to continue to support change across the NHS.
Next. And finally, we have Pip Hardy. Thank you very much, Pip, for reading out the roll call today. And Pip says, I'm really proud to be part of a movement with wonderful people who are trying to be the change that they want to see in the world. And I wear my badge with pride. So I'd like to take this moment to thank all of the graduates. And I would like us all to applaud, give a round of applause for the graduates. If you can do that again, just using the controls on your website, that would be great. I'm not going to do it in real time if you can see me on the camera. Okay, so we're going to move on to our next technical challenge on this one. We've kind of put together a little bit of a celebration video. So we're going to attempt to play that celebration video now. So Paul, we get that up onto our screen. Just give us a second. Coming up. Okay, so all you guys need to do is press the play button on your screen, and you should be able to view the video. Okay, I hope you enjoyed that video, and we'll be putting it on YouTube as well. We'll send out all the graduate links just in case you weren't able to view it right now. So finally, right before we do our closing, unfortunately, Naomi wasn't able to join us today on the WebEx, and she's flown off to Portugal on vacation, but she's recorded a message for all the graduates and everyone on the line, and we're going to try and upload that video right now so you can see the message from Naomi. So just give us a second and another one will come up. Okay, same thing here. Press play on your own computer and you should be able to see the message. Okay, great. I hope you were able to hear the message from Naomi. Yes, and Naomi is drinking actually only fruit juice, unfortunately. I'm pretty sure we videoed that at about 11 o'clock in the morning, so it's probably a good thing that there was no alcohol in that glass. Okay, so we've completed the formalized part of our ceremony, and I'm now going to hand it back to Helen Bevan, the Dean of the School, to give us our closing of the ceremony. Helen, you there?
Hang on a second. Can you hear me?
Yeah, we can hear you.
And can you see me?
Not yet, but hopefully soon we can.
Okay. So, health and care radicals from around the globe. Go out into your world and organize, mobilize, and change. I wanted to end with a poem. So when Victoria read part of a poem from Rumi, it really made me smile because I've chosen a poem from Rumi to end the ceremony. And it's called, It's Your Turn Now. It's your turn now. You waited. You were patient. The time has come for us to polish you. We will transform your inner pearl into a house of fire. You are a gold mine. You are a gold mine, health and care radicals. You are a truly amazing community of change makers. Go forth and make it happen wherever you are in the world, with your head, with your heart, and with your hands. Our patients, our families, and our population deserve you.
Great. Thank you, Helen. Thanks again to all of the graduates and to all the people who participated in the ceremony today. I hope you enjoyed it. We'll be posting out the links to the videos, and we'll also send out, I think there was a good idea in the chat box about sending out a bit of a yearbook. So we'll see if we can get the yearbook together. And all the graduates, I hope you're looking forward to receiving your certificate in the mail, and you'll receive those hopefully in a few weeks from now. So I just want to thank everyone again. I want to thank the Dean of the School, Helen. I want to thank all of our 4 valedictorians and PIP and all of the graduates for attending the ceremony today. So thank you, everybody.
Yeah, and well done, Mina. That was so, Paul, I mean, that was so beautifully done. That was the highlight of my year. And I think, you know, for all the hard work that kind of went into the school, I mean, oh my goodness, has there ever been anything that's been more worthwhile and you know, more of a sense of like a movement and igniting this just amazing passion. So thank you so much.
Great, thank you. And thanks, everybody. So for the rest of the WebEx now, it looks like we finished the graduation a little bit early. So we've got a little bit of a break here. 30-minute break. So we're going to just write that up on the screen, and our next session will start at approximately 5:30. So everyone take a little break, and we'll see you back here, some of you, at 5:30. Okay, thank you. Bye for now. Hey, Ade, you've been unmuted.
Hello.
Hi.
Hi.
Nope. Hi. Testing your sound.
Yep, the sound works. Hello, testing 1, 2.
Yep, we can see you as well.
Good.
Okay, take it away.
We're ready to go?
Yep.
Okay, so welcome back everybody. We're going to show a short video, just paying tribute to the Hubbies, our regional volunteers who up and down the country led the work for Change Day 2014. I think we featured most of them, but I'm sure there are some we're forgetting, so in spirit we want to thank them if we didn't explicitly mention them or show them in this short clip we'll be showing. They really were the force behind Change Day 2014, and without them, much of what we've done, or much of Change Day 2014 wouldn't be possible. So without further ado, I think let's just roll the clip.
Okay, same process here. Just press the play button on your screen and the video will play.
Yeah, I'm seeing.
Hi there. It's Helen Bevan. Can you hear me?
Yeah, we can hear you.
Great. So what we're going to do now is we're just, having seen that the film about the Hubbies, and like Adi says, the extent to which young young leaders, trainees, students, and patient leaders and volunteers, made such a difference. What we thought we'd do now is just have an informal chat about, about some of the kind of experiences that we can relate to with that, and just thinking, more broadly about other young leaders, trainee students, student leaders in the NHS that we could potentially get to be part of our movement. So I'm going to actually start off by Adi asking you some questions, if that's okay.
Yep.
What would you say about the spirit of the hubbies and how we can get more of that spirit in the NHS?
Well, I think one of the things that springs to mind is a resilience, a spirit of resilience. Sometimes when some of these younger emerging leaders come into organisations and they have a new way of looking at things, sometimes, as the School of Healthcare Radicals encourages us, that unless you keep plugging away at something, unless you keep going at something, unless you develop relationships with people who can strengthen you, sometimes you can feel, dejected or disappointed when you try to implement things. But one of the things the Hubby Network has shown is that resilience and strength in numbers really is true. And that's the spirit that I think we can sort of engender across young emerging leaders in the NHS, that, if one thing doesn't work, then you can talk to your fellow people in your networks and understand how to overcome that problem, and just have the strength and resilience to plug away at it again and try and resolve it.
Yeah, fantastic. So, in terms of colleagues that are on the phone, what we want to do is have a bit of an informal conversation now about, what were some of your experiences when you were at a kind of formative stage with the NHS, and the kind of changes that you tried to do, and what have some of your experiences been around volunteering? So if you'd like to say something, it would be really great if you could put your hand up, and we could hear from you. So, what were your reactions to seeing that video, and what did it, in terms of your earlier days, what did it make you think? And maybe I should tell you a little bit about my story. I mean, I think it's quite interesting. So, when I was a lot younger and I was a student, I kind of had the spirit of the activist, and I was very active in my community, and I linked up with lots of people. And then I went to work in local government, and then education, and then healthcare. And I stopped being an activist and an organizer and a mobilizer, and I went into very different change methods. I learned quality improvement, I learned tools and techniques for change, and really I'd say it's only in the last sort of 10 years that I've kind of gone back to being the activist again, because I think what I learned was that whilst the tools and the approaches, they do give you insight, they don't help you get lots and lots of people on board. And I think we have to have the spirit of the activist and the spirit of the mobilizer. And I think that the hubbies show that so beautifully.
Yeah, absolutely. And I think, Polly's just said here in the chat box that she's still in her early days, and I remember my very, very early days. I worked in a mental health trust, and what struck me was the amount of goodwill that's just around amongst frontline staff and even all kinds of staff in the NHS. Paramedics making tea for people on their next shift and staying 10, 15 more minutes later on before the next shift, just for good handover. Birthday cakes, just really small things like this that make a massive difference. And that's what Change Day has done in effect as well. Just small things that make a massive difference.
Yeah, no, that's great. And how do you think we ought to be, training and socialising young leaders, students, trainees to, in terms of this goodwill and this kind of spirit that in a sense sets us up for our careers?
I think sometimes, or most of the time, you actually have to go to where they are. So as we've seen a lot from, the social media engagement of Change Day, this was going on to Ween Nurses chat groups, other chat groups that had, tweet chats at particular times in the day. WhatsApp is a popular, social media app tool, and that's where some of these young emerging leaders are, on their mobile phones rather than at the desk, at the laptop. So going to them, tapping into those networks. The hackathon is another example. So to answer the question, going to their networks, going to where they are, and delivering the message in a way that they can grasp and understand.
Yeah, great point. And we're getting some really good comments in the chat now, so I'm going to put some of the chat people on the spot. So shall I start off with Philip? Philip Pearson. Could we unmute you, Philip? And add to the conversation. We got you there.
Can you hear me?
Yeah, great. Hi, Philip. It's great to have you on the call.
Hello.
So I've been saying some really interesting things about students and the kind of attitude that we teach students. So it'd be great to get your contribution verbally.
Mainly that. My perception when I was a medical student, and for that matter, junior doctor, and all the way up to consultant, is we are encouraged either implicitly or explicitly to keep quiet, to not rock the boat, and we're told lots of things that we can't do, either because it's too hard or that's never been done before. And particularly working with students over the last year or two, I've been struck by the fact that they are very keen to engage, they are very keen to do things, and they don't know what they can't do, they don't know what they're not allowed to do, so they just do it. And they also come up with some really, really exciting ideas about doing things differently that older, more mature people such as me wouldn't have thought of.
Yeah, and I think that really ties in with a lot of, of our theme around diversity and getting, different voices in the room and hearing different perspectives.
Very much so.
Yeah. So Pollyanna's adding some comments to this as well. So what do you think, Pollyanna, in terms of how we should be working with trainees and young leaders to get a different attitude?
I think we need to be listening to them, but also allowing them to connect us and get on with what they feel is the right thing to do. Yeah. And just enabling them to be able to have those conversations and then facilitating those conversations in the right way, explaining how the systems work so they can understand that, and also helping them discover their own talents and the other members of their teams or network talents so they can work together in the most beneficial way.
Yeah, yeah, very good, and a great comment from Claire here. I think that's sort of backing up what you're saying, Pollyanna. She says, "I like the idea that before they know what they can't do." I think yeah, that's absolutely spot on. Jackie Linton, what's your view on this? In terms of how we train and socialise and engage like young leaders, students, and trainees in change.
Yeah, I think one of the things that I've kind of just learned from my own experience and having been involved with hobbies is how much they value and how much they welcome the coaching and the feedback. And I think back to when I was that age, that if I could have had that some coaching or feedback, I think that would have really kind of helped me. It helps anybody wherever they are in their career. But I think sometimes when you're young or you're on the front line, you're not looking for it. But I think I would say look for it, and those people who can coach and support. So I think this whole idea of enabling and empowering, I think, is just so important. And it's about unleashing the energy that's there the energy is there. It just feels unleashing.
I know. I went to a meeting last week, you know, which was about young clinicians and change agents, and you know, these were the kind of you know, young people who were you know, really kind of passionate about change, but the stories that many of them tell about how hard it is, you know, to be a change agent or a change maker in the situations that they're in, and it just strikes me, you know, how can we make it easier for them to be leaders of change when they want to be.
Well, I think Helen, I think there's a lot of people in the system who feel worn down.
Yeah.
And you know, when you're young and you've got lots of energy, and you know, you spring back up, but you know, eventually you keep getting knocked down, or you know, you don't feel that your voice is heard, then you get worn down and you check out. It's what I call you check out, and I've been in that position where I just checked out.
Yeah. Yeah.
Because you know, the system doesn't allow you to breathe.
I also think it's about, I think like someone's mentioned earlier before, being a facilitator of discussion, pointing them in the right direction. The students from the Royal Society of Medicine are working on a really great project about developing multidisciplinary teams from undergraduate education. And I was working with them, and what was interesting was they proposed some really radical initiatives and changes to undergraduate courses, but they were pitched at, I think, or I suggested, the wrong level. And if they did pitch them at the governmental level, which is what they were proposing, then they would have got discouraged when their ideas were kicked back. So what I did was facilitate the discussion, helped point them in the right direction where, you know, they wouldn't go to senior a level or to a too bureaucratic a level where their ideas would be heard. So sometimes, you know, for people who are new to the system, and it's not always young or, you know, people who are young in age, it's people who are maybe just new to the NHS or the health and care system. It's just about facilitating and saying, maybe not here, you know, maybe here, that's a good idea, and, you know, saying and rather than but, and just being a facilitator of progressive discussions.
Mm. So, just looking, and it's great, some really good chat here. That's kind of adding into the, you know, into the system. So, Pollyanna, go on, respond to what Adi said.
Well, I think Ada had a really good point that we need to, when you're trying to come up with an initiative, a lot of senior leaders go straight to the top and they say, this is what we're going to do, and write a paper and a proposal, rather than maybe speaking to the people who are at their level or lower to just, or to engage them at the right level. And I think it's about formalising things too early on sometimes with an idea, rather than just shouting about it and sharing it at the beginning and letting people get involved.
Yeah, yeah. Very good. And Jonathan's making a good point here about there being a lot of passion out there. Jonathan Downham, would you like to speak? Can we unmute you?
Yeah, can you hear me?
Yeah, great. It's great to hear you.
Yeah, absolutely. I'd love to be able to speak to you. I'm just about to type something actually that.
Okay, no, say it instead. Yeah.
I've just got involved with a young lady called Claire who works at my trust. And she's a caremaker and also an RCN committee member. Now, she's only been qualified for, I think, probably about 8 to 12 months now. And she's probably one of the most passionate and innovative people I know. And one of the reasons she is so is because she's always been encouraged to be so. She's got a passion there, and she's met the right people who have said to her, move on, move forward, tell us your ideas. And we get excited with her, and I think that's probably one of the best things you can do for anyone who wants to develop things in the NHS, is to provide them with the right environment, the right encouragement, and the belief that things can change. It's not what we can't do, it's what we can do, and that should always be the emphasis.
Yeah. I really like your spirit.
Thank you.
That's great. So, anybody else who hasn't spoken would like to say something? Because we'd love to hear some more voices. If you'd like to, just put your hand up. Oh, Joan, great. Hi, Joan.
Hello?
Hello, can hear you loud and clear. Fantastic.
Okay.
I'll tell you what change they have done for me. I've been a nurse for 14 years now, and I was fed up of of going from job to job, not able to make a difference, shouting out loud, nobody wanted to hear me, and Change Day, and then I become disengaged and a vicious circle, then my care was compromised, and I just basically never left the profession 3 years ago. And then 2 years ago, then I came across Change Day, and then they gave me the license. It gave me to think about it, and it gave me the license to change. And I was waiting for somebody else to tell me that that I needed to do what I needed to do, and all the time the answer was in me. And it was not till I discovered NHS Change Day. Basically, they ignite my passion, and since then I met so many amazing people. Can you hear me?
Yeah, loud and clear.
Yeah,
hang on, I think
hello?
Adi wants to say something. Yeah, Adi, go on.
If you just step a little bit away from the microphone, just so it's a bit.
Okay.
Just a little
Is that
bit.
better?
Yeah. A little bit.
Basically, I found out that I'm not alone. I'm not the only one who's trying to save the NHS. There's a lot of people very passionate like me, and it made me basically I found home. For me, NHS has become my passion again. And NHS Change Day is I found a reason why I want to go to work every day and fight to make the better care and provide be a better nurse. And Change Day has been one of the channels that I managed to do that. It gave me a voice, and a voice that I do. Since then, I'm not shut up, and I keep shouting loud and clear, and hopefully, I'm bringing a lot of people with me.
So, Joan, can we just get you sorted out in terms of the distance you're standing from the computer? And the reason why we're saying this is because Joan, with Maria, another hubby, is next on in about 4 minutes. So, we just want to get you sounding right, because you're not quite sounding right at the moment, Joan. So I think, yeah. So what I think we should maybe do is, if we wind up this conversation now. I mean, I take a lot of hope from this conversation, because what we're saying is there's so much potential, there's so much energy, and it's almost like a kind of prevention strategy in terms of how we work with our young leaders, our students, and our trainees. And I think, lots to give us hope about there, because when we've got people like Philip, looking after education, and we've got people like Jonathan reporting back, the kind of experiences of young leaders that are so different and so supported, and then we've got people like Joan and Pollyanna and Ade, this kind of new generation of leadership coming up. I think we should be very hopeful. So thank you to everybody that took part in that conversation. I think what we'll do now, we'll just take a break for about 3 minutes, and then we've got Joan and Maria who are going to tell us about their pledge to inspire others to reignite their passion and encourage them to believe in their own ability to make a difference. So I think this is a really nice transition, actually, that conversation, before Joan and Maria's session. So I think we'll stop there, and we'll get Joan sorted out in terms of microphone, and we'll start again in 2 minutes. Thanks all.
Hi, Maria, Joan, and Maria. Nina here. I'm just going to test all three of your mics now. So, Joan, if you want to, let me see, just say something to me, and I'll let you know how.
Is Maria there?
Hello.
Yeah. Oh, Maria's there.
Hi, Maria.
Are you trying to kill me?
Am I what?
Are you trying to kill me?
No, I'm not near a pyramid.
You're going to hear me out of that,
Okay, so Maria, we can hear you loud and clear. And Joe, are you on the telephone or on your computer? Joe?
Maria?
Yeah, are you on your phone or on your computer? You're on your phone, right? Yeah, so when you're speaking on your phone, if you just hold it a little bit away from your mouth, then it should be a little bit clearer. Right.
Maria, just
If you just say hi, Mina.
Hi.
Okay, yeah, that's a little bit better. Okay, and Maria,
Wait,
we
should
can see
we
you
try?
now as
Sorry,
well.
hi, Mina. Should we try? Joan, just keep saying testing 1 2 1 2. Just.
Okay, yeah, let's try that, Joan. Say testing 1 2 3.
Testing 1 2 3.
You still need to be a little bit further from the phone, Joan.
What's up?
Your microphone is really strong, Joe.
Yes.
My microphone. Isn't it good up? I go, okay. Is that better?
That's a little bit better, yeah.
Your microphone's making you sound Spanish, Joan.
I'm Spanish.
Okay, Maria, you're sounding good. And Joan, I think it's better now.
Can you hear me now? Is it better?
Yeah, can we test your mic as well? Yeah, that's better, yeah.
Okay.
Lydia, are you there, Lydia? Okay, Joan and Maria, I'm going to mute you for now. I'll unmute you when we're ready to start. So I'm just muting both of you.
Hello.
Hi, Lydia.
Hi, Mina. How are you?
I'm good. How are you?
Good, thanks. Can I test my video as well?
Yeah, I'm going to turn on your video. Hold on a second. Okay, let's see now. You should have a little video thing show up. If you just click on that, let's see if that comes on.
Just need to check there's nothing incriminating in the background.
Fair enough. No, looks good.
Good, thank you.
Looking still bright and sunny for the end of the day on a Friday. So
yeah, maybe I should move a bit away from the window.
No, it's good. It's good.
Okay, yeah, that's a bit better.
Okay, perfect.
Thank you.
Okay, I'm going to mute you now as well.
Okay.
Okay, Joan, I'm just checking your video camera now. Let's see it.
Okay.
Let's see if we can see you.
Able to see me?
I'm just trying to see if I can see you now. Hang on.
Hi, it's Helen here. I'm going to be chairing the next section. For those of you that are on the WebEx, please bear with us. We're about to just start. We're just trying to get our sound right. A comment from Jackie Linton, my ears are throbbing, but all good. I know that feeling, absolutely. So are we now ready to go?
Yeah, I think we're good to go.
Okay, that's great. So what we're going to do now, we're going to have two presentations. So the first one I announced already, which is Joan and Maria, and then what we're going to do is we're going to hear from Lydia, who's going to tell us about her pledge to start a paired learning program to enable junior doctors and managers to get to know each other. So what we'll do is we'll hear Joan and Maria first. So are you both there, Joan and Maria?
Yeah.
Hello.
Hello, Joan. Hello, Maria. The virtual floor is yours. So over to you.
Hello.
Hi, I'm Bonnie. He's not talking. He's Clive.
Hello.
Hello. Can we all see the presentation now then?
Yeah, we can see it. We can see everything perfectly. We can hear you loud and clear.
Brilliant. Well, we just put this presentation together for celebrating our journey. So if we can have the next slide. We basically pledged to inspire others to reignite their passion and encourage them to believe in their own ability to make a difference. We wanted to actually start the ball rolling again and get people to actually pick up and realise that they can make a difference where they are, no matter who they are. Next slide.
next slide is a little video that the statistics. Basically, where we try to reignite the passion, and this year, 6 million are gone from less than 7,000 places a year ago. Now,
Joan, can you get a bit further? It's Helen. Can you get a bit further away from the microphone?
I'm in the okay. Yeah.
Yeah. Okay, keep going. Yeah.
Mary, do you want to carry on? If it's I have problem with the microphone, you carry on.
Yeah, I'll do it. So we've now got the East Midlands. We've got the statistics up here. Just because we found them quite amazing. In 2013, 6,385 pledges were made in the East Midlands. And then we kind of wanted to break that target ourselves, and we sure did. In 2014, there were 63,238 pledges made in the East Midlands. He's got the monkey. Hi, Joan. So we did do awesome. The whole of the East Midlands came together, and we did go from bottom up. So we just wanted to show you the statistics there. And if we can have the next slide. This was, I'm not sure whether the videos will actually play or not. We've done a couple of videos of our actual journey that seem to have...
Yeah.
Oh, we're buffering. We actually took a teddy bear chimpanzee along for the journey with us, and people laughed at first, but everybody got behind it in the end, and it was just something different to get people involved and start the conversation rolling of what Change Day was. It made it fun, and it put the laughter back into it.
Sorry, Maria, I think we're just having trouble playing all the videos.
You're okay.
Yeah, I don't think they're going to play on here, so we're just going to let us know when you want us to advance the slides.
No problem. We've got them on YouTube anyway. If people want to check them out, they are on YouTube. And we'll tweet them, shall we? We'll tweet the link for people to watch the videos, because there's 2. So we can do that if you want to go to the next slide. So basically, how did we do the do bit? It was easy for us to do the pledging and the promising and the speaking. It was the doing that we wanted to discuss and see where people could learn maybe a little bit. If we can have the next slide. Between me and Joan, we kind of covered a few pledges of our own. The first one that we've mentioned about wanting to inspire others, but our first way of doing that was to lead by example. So between us, we pledged some individually and some together. Joan himself did the SMILE pledge, where he pledged to never leave a patient without having them return his smile. The year before, he pledged to just make sure that he smiled. So this year, he take it a step further, and actually, he pledged to get that smile returned to him. And like you can see, we still do this, and we make sure that every contact does count. The visiting pledge was one that we're both continuing to do the do, as you can see. And we're challenging and encouraging reviews of adult hospital ward visiting hours to make it more patient and visitor friendly. So rather than kicking our visitors out of the ward at 3 o'clock and letting them back in at 5, whereas I was finding them sat in the car park for 2 hours waiting to come back in, we've now tried to encourage that, so in all areas. So it's more of an open visiting. In our own place of work, they've taken that up. We've got different visiting hours now. It's not perfect, but it's better than it was for sure. And there's a few other hospitals that I know have reviewed their hours. So that is going in the right direction. It's something that we'll continue to work with.
Kingsmere Hospital has changed hours, and the Chesterfield Hospital has changed hours. The one-page profiles pledge
is something we both pledge for and passionately believe in. We pledge to raise the awareness of the excellent potential benefits that these one-page profiles can actually have for staff and for the patients and for the visitors. And we've done that in many ways. Through the Helen Sanderson Association and her one-page profiles, we've worked together and we've developed our own. We always carry them with us. We start interviews with them. We give them people in meetings. And rather than us leaving that room and then forgetting us, which I'm not sure they would do anyway, but it just helps them and they've got that reminder. I've used them on the ward with patients. The patients have done them, and I've used them as a staff member. I've actually found patients explaining via being the nurse, no, the proper one, the one with the dog, because they get to know a little bit about me. So breaking them barriers down between patients and the care. They have been a massive success. The Helen Sanderson herself pledged that she would have 1,000 for the Change Day, and I think it was 11,000. She signed so many different trusts up. There's nurses from 17 trusts that have worked with her with this. So everybody's jumped on board. We've kind of twittered it away as well and got all sorts of different professionals and everybody really to actually put theirs in. We've even got one from a superhero as well. Can we have the next slide? Some more of the pledges that we made, and like you can see, how we've done the do bit. The compassion circles is really Joan's area massively. I'm not sure how well we can hear Joan.
Yeah, we did, but Maxine at 7 o'clock is talking about compassionate circles, and she's the best to talk about them.
I can't hear you very well, Joan, so I'm assuming others can't. So if I can fill in the gaps there. The compassion circles, Joan himself pledged to support and encourage the use of these throughout our work areas. We certainly did do this, and even Andy Bradley came and actually held a compassion circle for us at our regional event that we held for NHS Change Day, just to raise that awareness and the benefit there is in them. So that is one that's been continual as well, and we still are doing that. I know Joan's working closely with Andy to carry on with that as well and to carry on championing that. The Dementia Friends pledge was mine. Even though both of us do it, it's my passion there. And I pledge to break down the barriers that people living with dementia actually face every single day. And those barriers are what we as human beings actually put there. They're not there to start with, we put them there. So that pledge itself we have done and we are doing, and I will always do. We've run awareness sessions for staff members, for visitors, patients themselves have come to awareness sessions. I've run them in the local Tesco's, in the local school, just to raise that awareness and actually just to create a more dementia-friendly society, really. It's one that's definitely been taken further by people. They've picked it up and ran with it massively. And I know right down to in my work area in the hospital, our porters, our estates, our domestics, all them staff have also done the training as well, and they've all had massively good things to say about it, so for the benefits there. And some of them have actually taken that further. The pledge of the Change Day song was how I got started with the Change Day this time, by getting involved with this. Kirsty wanted to do a Change Day song, and we ended up having 10 manic days of no life really and living in the studio whilst we put together the lyrics and everything and got it recorded. So the Change Day song was the NHS, the fairy tale of the NHS rather than the fairy tale of New York. So we did change the words in there. It is on YouTube, so you will have to check that out. It's one that definitely, again, the best benefit of it was starting that conversation between people about Change Day. Can we have the next slide? the final pledge was, me and Joan pledged to continue to show people the difference they can make. This is definitely something that's topped our doing the do bit really, because we've organised a carnival in the area, which has gone from being a tiny little affair to being the biggest event that this area will see this year. I wanted it to have a knock-on effect for the whole community. It's got a health and wellbeing element running through the carnival, but it's brought the whole community together. We've got the health promotion down there and the fitness side, but we've put the fun back into it as well. So that's on the 26th of July. Not that I'm plugging it or anything, but it is definitely on the 26th of July. And it's just to take the proactive approach, really, because it is our community that, in the end, will be using NHS services more than likely at some point. So we're trying to catch them before they actually get there. And I believe that's the final slide. There you go, thank you.
Yeah.
I promise I will tweet the link now for you for the videos.
Yeah. So, thank you ever so much, Maria and Joan. And I'm sorry we've had a few technical difficulties, Joan, in terms of hearing you very well. And well done, Maria, for kind of standing in and being the anchor woman there. So, a couple of things. Some things I wanted to ask you. Also, I think, is Helen Sanderson still on? Because Helen was on just shortly. I'm just see if she's still with us. Yes, she is. So, Helen, given that Maria and Joan are obviously very passionate about one-page profiles, would you like to say something about that? Are you with us, Helen? Can we unmute you? Can you hear us? While we're seeing if we can unmute Helen. So, Maria, you'll have to speak on behalf of you and Joan. What are your plans for Change Day 2015?
Oh, I'd be telling. We've had the monkey this time. We've had the whole love affair story of Charlie Change Day, chimp and monkey wellbeing. We're going to stick with the fun side, the fun element. The Bonnie and Clyde element is being tweaked a little bit, and we've got a third member, so we have got 3 amigos in the team, more or less. We are going down the superhero route. I'm personally wanting to engage with more of the younger population. I think it's a population that was missed out on this time round. So I've already spoken to the schools, and they're interested. I've spoken to the local colleges, and they're interested as well. So we shall see, but I'm not revealing too much.
Okay, watch this space, but we look forward. I don't know, I'd like to maybe see your statistics for next year. You're going to get like 630,000 next time.
Oh, don't set Joan a target, please.
I know, I won't set Joan a target, don't worry. And is Helen unmuted now? Hi, Helen, can we hear you? No, maybe we'll hear from Helen later. So I think we've run out of time now, but I just think that the two of you, we love your passion and your energy, and I think you bring some real fun as well to Change Day. So really appreciated that. Thank you very much, both of you, and I think you've had a few comments in the chat box as well. Thanking you both.
Thank you.
Yeah, brilliant. So can we go on now and hear from Lydia? And really interested to hear, Lydia, what you're doing in terms of the paired learning programme between junior doctors and managers, working together on service improvement projects and breaking down professional boundaries. So Lydia, we can see you.
Right.
And we can hear you as well, so fantastic. So the virtual floor is yours.
Thanks. Thanks. That was a really great presentation for Maria and Joan. I don't have any slides, but what I thought I'd talk about was why I decided to do this pledge and what the kind of background was from it, and then also what's been happening since Change Day as well. So I started in the NHS a few years ago as a receptionist, and one of the doctors said to me, if you're going to stay in the NHS, the one thing you should do is buddy up with a junior doctor, because you'll just see a side of the hospital that you won't ever see through, you know, spending time with other clinicians. And it always kind of stuck with me. So when I joined the NHS Graduate Management Training Scheme after 2 years and had my first kind of operational management role, and I asked to shadow a junior doctor and spend time with a junior doctor, and you know, it was considered okay, but the kind of feedback back to me was, well, really you should be spending your time with the consultants, because they're the decision makers, and they're the people who are going to stick around for a long time, and the junior doctor's always leaving every 6 months, and you know, that it's not a good place to invest your time. And I didn't really agree with that, and started working with this clinical fellow who was a surgeon about to apply for a consultant post, and he was quite interested to work with me because applying for a consultant post wanted to know more about clinical leadership, and he'd really never met a manager before as well. And we did a few different projects together, one of which was on safer start times. And I think one of the best things that came out of it was through a manager and a registrar working together, we kind of allowed other members of the MDT to come together, and we made an MDT group to look at safer start times that hadn't really been done before. And I think that was really started because other people saw that we were working across different silos that hadn't really been done before, which gave them permission to do that as well. But it wasn't really just that I enjoyed. I also thought that just spending time with a doctor and, you know, talking about what do you think about this in outpatients, what do you think about that, and he would ask me, I don't understand the new NHS structure, you know, this was when the reforms were happening, so, you know, what's happening with this, how do we get paid, you know, just so many questions. And it was through that we really learnt a lot about each other, and really changed my perception of doctors in training and his perception of managers. So when I left that hospital and started at Birmingham Children's Hospital, which is where I am now, I thought it was a good opportunity for other people to get involved, and everyone was really supportive of it. And I think it's quite a small hospital, and that really helped people getting on board. And I also had a lot of support from the senior leadership and the board, which definitely helped. So what I did was I made it my NHS Change Day pledge to set up a paired learning program, and I was quite keen right from the beginning that it would always be led by a pair who are on the program. And I met someone called Nikki Kelly, who's a paediatric intensive care registrar, and me and her are a pair working together, and our project is running this program. So she came along with me to things like when we approached the education and learning team about funding, she came with me so she could see that side, and I also spent time with her on intensive care and doing other things like handover, so I could see that side of things. So far, at the moment, we've got 60 participants, so that's 30 doctors and 30 managers, and we've paired them up, and we sort of left it to them really, because it's a program where it's completely voluntary. There's no, you know, there's no requirement, and therefore we don't really want to tell people what to do. We paired them up, gave them each other's email addresses, and said, go ahead, here are some ideas of what you could do. So we suggested shadowing each other, we suggested talking about the key challenges in your role, what are the kind of stereotypes that you've heard about a manager, what are the stereotypes you've heard about a doctor, you know, in a kind of worst case scenario, what's the worst thing that's happened when you've had an argument with a manager or an argument with a doctor, and kind of talk about those sorts of things. And I also circulated a few videos and blogs and things like that, so that people would have something to start a conversation if they wanted to start from something more concrete. So, for example, I circulated a blog about whether the 4-hour target achieved anything and things like that, so people had something to start from. And since then, loads of great stuff has happened. I think one of the barriers really is time, unsurprisingly. Everyone is really busy, and it can be difficult to find time in your diary to shadow someone when we know everyone is already really pressed, and so that, I think that has been a challenge. But having said that, there have been some some really great things that have come out of it, and other trusts are also getting interested in doing something else. The original paired learning program was started by Imperial in London, and there were also similar programs, and there's one in Manchester and another in Kent, run by another hobby actually. And so yeah, I probably haven't gone through everything, but the other thing I was going to mention is that we run monthly workshops. So as well as working together in pairs, everyone's invited to a monthly workshop which has different themes. So, for example, we did one on why is managing change in the NHS so difficult. We've done another one on how to measure improvement, and anyone can just come and contribute, and both doctors and managers are there and kind of talk about how they're, through working together, it's changed their perception, or really anything that we want to talk about. And one of the things that I did right at the beginning is I went to do a doctor induction and to try and get people interested in the program, and introduced myself to probably about 60 junior doctors, and half of them had never met a manager before. And I think that if we're going to work together to face the challenges in the NHS, really, if people have been a doctor for 8 years and have never met a manager, it's not setting them up for a future in clinical leadership, and you know, it's not setting a good precedent for communication between the teams, and that's really what paired learning is trying to change. Any questions or comments?
Yeah, very good. So, what I was going to ask you, Lydia, are other people in other places doing the same thing? Have you linked up with, you know, other people doing kind of similar pairing schemes?
Yeah, there are people doing similar things, and yeah, we've spoken and got ideas from other teams, and people are doing things differently in different regions. So I know that in some regions they've paired people across an area. So for example, in Manchester, it's not specific to a trust. So anyone, a sort of wider group, which also is good, especially with doctors being on rotation, and you know, it's just different ways to run it. And I think it's just about finding what's the best way to run it for your area, your organisation. Because at the end of the day, it's one of those things that has to be led from, you know, it's sort of middle manager level, and doctor level was mainly between like FT6 and above. So it's that kind of level, and I think it's important that it's not owned and run by the education or the OD team, the organisational development team. It's really run by us, and even though they're really supportive in terms of, you know, we can use their rooms and stuff, actually it really should be led by the participants.
Yeah, that's like a slide, you know, from the School for Healthcare and Radicals, which is like people will own what they help co-create. And I think that you know, the fact you own it yourself means that it's a different dynamic to the relationship, isn't it? That as if somebody was doing it for you. Yeah. I think that's a really, really important point that you're making there. So would anybody else like to ask Lydia a question? Or give your views in terms of these kinds of pairing schemes? Does anybody else work in an organisation that does this?
If no one has any questions, I've got some examples of things that have happened that I can go through. If that would be
okay. Give us an example. That'd be great.
So one pair through working together, they basically realised how little a voice registrars and doctors in training had in the hospital. So they kind of pledged as a pair together to commit to having, or to sort of campaigning and influencing, having a doctor in training representative at every decision-making forum in the trust. So, for example, at directorate management team meetings or governance forums, and they're trying to influence that to get to have a representative from the doctors in training there, which I think is a really good one and has been quite successful so far. Another doctor and manager, so the manager spent a night shift on paediatric intensive care, and at the time was doing a business case for long-term ventilation in the trust, and afterwards he really felt that through doing that night shift he could articulate better in the written business case, but also when presenting the business case, why we really needed a long-term ventilation unit. So that had sort of a direct impact on his work as a manager. Somebody else paired with a facilities manager and is a surgeon, and he was noticing problems with the portal, or not problems with the portal, but was getting frustrated with the portal. So then through his pairing with the facilities manager, I did a night shift as a porter to really understand what the porter role is and what kind of difficulties they're having. And after doing that, he kind of got more of an insight into the role, and also decided that when there was a review into an incident that happened, he was the one really pushing to have the porters there. So another way that it changed how people behave in the hospital. And lastly, someone who kind of joined the course because she's interested in education, but wasn't really interested in clinical leadership. And I think we found that a little bit as well, that people who were interested in teaching and things are interested in the course, but not necessarily thinking about going into clinical leadership. And through doing this program and pairing with the manager, she's really changed how she feels about clinical leadership and feels like she has more of a voice. So much so that she's really considering clinical leadership as a future career for herself. So I consider that a real success of the program as well.
You know, Lydia, this is really fantastic, and you know we've got this white paper which is being published today about the future direction of change and transformation in health and care. And one of the big messages in that is about getting people to have different conversations. And actually, if we got people together and connected, talking to each other, who wouldn't normally do that, that actually we can make change happen so much more effectively. And I think you're a really great example of that. And I think that, you know, every organisation should do what you and colleagues are doing. And I love the way that, you know, you're driving it yourselves, and it isn't the training department that does it for you. You know, the kind of the momentum and the energy for doing it comes from yourselves. I think it's really inspiring, and would love to kind of you know, follow things more and kind of see where this gets. And I think that you know, every organisation should be encouraging the kind of pairing arrangements that you're leading. So you know, really, really well done. And we look forward to some fantastic pledges from you for 2015.
Yeah, I'll have to link up with Maria actually, because I'm working at Children's Hospital, we're also looking at how can we get more primary schools and schools involved in NHS Change Day for next year. So.
Oh, that's a really good pre-pledge.
Yeah.
Yeah. Fantastic. So thank you so much. We've just got a few minutes before our next speakers. So at 18:40, we've got, I think, a really interesting combination that you just wouldn't normally put together. Okay, so we've actually got how do Wi-Fi and compassion link? Okay, led by Dr. Sebastian Yeun and Dr. Maxine Craig. And I think this is going to be a really, really good session. So I think what we should maybe do, we've got 8 minutes now. So let's take a 5-minute break, and then we'll hear from Sebastian and Maxine at 18:40. So, and well done everybody who's here with us on the evening shift. You know, I think that much of the best is yet to come. So we'll get back together in just over 5 minutes.
Hi, Maxine and Sebastian. I'm just going to do an audio check and make sure that your mic and your cameras are working. So we've unmuted you. Maxine, can you hear us? Okay, we can't hear you very well. Yeah, actually, Maxine, if you can you dial in with your phone instead of your computer? Yeah, just hang up from your computer and then call the numbers that show up on your screen under event info with your phone. Yeah, okay, talk to you in a second. Sebastian, can you hear me?
Hi, I can hear you. Can you hear me?
Excellent. Yes, I can hear you loud and clear. And do you have a video on your camera, on your computer, webcam?
In fact, I haven't turned the webcam on. I can try. Let's see.
Yeah, let's just check out and make sure your video works. Oh, could we add Sebastian to video? No, okay, perfect. Okay, let's just see if that works.
Is that working?
Hang on one second. Sometimes it takes a couple of seconds. Hang on a second. I'm sure it'll come up in a minute. Yeah, okay, that works. Perfect. Yeah, we can see you. Right.
Can you still hear me now?
Yeah, we can still hear you.
Okay.
A little bit muffled.
I can hold the phone and do it like this.
Okay. Yeah, that sounds a bit clearer. Okay, I'm going to put you back on mute for now.
Okay.
Thanks. Okay, Maxine, we can see you back on the line now. We're just going to unmute you. Okay.
Yeah, is that better?
Yes, that's much better.
Yeah, I don't know whether I'm going to have to get this checked because that happened last time we did this and I had to dial in.
Yeah, I know. It sounded, it's maybe the headphones. Are you using headphones? Or are you just
and I've just bought some new ones as well today, just in preparation.
Yeah, you sound,
really?
Maxine, it's Helen, you sound so much better now than you did before.
On the phone?
Really clear. Yeah,
no.
really clear.
Yeah, those headphones clearly, I don't know whether it's the PC that I'm using, and I don't know, I'll have to get it sorted.
Yeah. So, are we ready to go?
I'm ready.
Yeah, and Sebastian's ready?
Can you unmute?
Absolutely.
Yeah, very good. So, welcome to the evening shift of our 12-hour jam for celebrating NHS Change Day, and what a fantastic day we've had. Now, you know, when I looked on the programme for the whole day in terms of what I thought was going to be most intriguing, you know, I thought putting these two topics together, which are Wi-Fi and compassion, was going to be like a really, really interesting session. So, so first of all, we've got Dr. Sebastian Yearn, who is a consultant paediatrician and named doctor for safeguarding children at George Eliot NHS Trust. And he's going to talk about his CEO pledge to offer free Wi-Fi for patients and staff. Then we're going to have Maxine Craig, Dr. Maxine Craig, who's Head of Organisational Development at South Tees NHS Foundation Trust. And she's going to share her experience of facilitating 3 compassion circles in the North East on NHS Change Day. And then Sebastian and Maxine, no pressure, but I'm going to get you to both reflect afterwards on like, you know, what unites us. Okay? So, first of all, let's hear from Sebastian. Okay,
Hi,
the virtual floor is yours.
Thank you so much. It's lovely to be here with you.
Yeah, can we mute everybody else apart from Sebastian? That's great. And me.
Thank you so much for inviting me to join you today. Sounds like you've had a fabulous day, and it's a real privilege to be part of Change Day. I've been a huge fan of this social movement since it's begun. Just to introduce myself, I'm a consultant paediatrician, and what's really changed my life is being a fellow at the NHS Institute for Innovation and Improvement back in 2008 to 2009, where I worked with Helen and the Safer Care team to learn about improvement, and I learned a lot about myself as well. And from then, I chose to go to Walsall, just north of Birmingham, and we did the Patient and Family Centred Care Programme, and I learned there about shadowing patients and working with Hisham Abdallah, the Health Foundation and the King's Fund. We learned about how to better understand the user experience, to work together with patients and co-produce care, working together to introduce small tests of change with patients as partners. I was then invited to go to George Eliot Hospital, and this was in less than a year ago, and to create a new model of care. George Eliot was in special measures, had financial difficulties, and was looking for a partner to take it over to ensure its sustainability. Pediatrics was felt to be unsafe at that time, and we've come in to create a new networked model of care where there's no middle grade doctor, you have consultant delivered care 24/7 and SHOs, junior doctors, and it's really like being in a startup. So we have been making rapid, continuous change within the department, and it's a really exciting place to be. And actually, we just got a report back this week, a draft report on the progress we've made, and the West Midlands Quality Review Service say we've gone from being the bottom in the region to the top in the region in paediatrics, and people who've been there just 1 year ago to review it couldn't believe the change. So I'm going to describe a couple of things that we've done within the department and how NHS Change Day has really made a difference to us. So if we go to the next slide. So next slide, please. So in the talk, I'm going to talk about patient family centred care. Also, just go to the overview. Yeah, thank you. What we've learned from shadowing patients. We're going to talk about how we got to have free Wi-Fi. And I'm briefly going to mention 6 Cs after everyone. And that's because during the rest of the day today, there's been another national campaign kicking off, which is about the compassionate practice. So let's go on to the next slide, please. So most of you will be familiar with the tragedy in Mid-Staffs and Julie Bailey, who led the Cure the NHS campaign. And one thing that she said that really resonates with me is that we need to turn the NHS the right way out, where the frontline lead and patients are the priority. So really, we're moving from a top-down, command-and-control NHS to a bottom-up NHS where we on the front line, working in partnership with patients, are together making things better. And I think that that's going to be a sustainable model for the future. So let's go to the next slide, please. So I was part of the launch of NHS Change Day 2014. I think I was kicked off in November last year, and I made a pledge to shadow a patient. We got a lot of rich learning and also from shadowing patients. And there's a certain technique to this, and you're supposed to just be there, be present, be mindful, accompany a patient, get permission, and just sit and observe. When we first started doing this, one of our admin team shadowed a patient and was really upset that the care was so poor that they weren't offered food and drink despite waiting so long. And she made an intervention to get a drink for the patient to help them. And that's not really how it's supposed to be, even though it tears at your heart sometimes. I think it's important really to just be present and experience what it's really like. So I made a pledge at Change Day to shadow a patient. Now we've got a brand new service that's consultant delivered. You can see from our waiting room here. It's a really nice setup. It's really transformed from how it used to be. And we're pretty pleased with it, actually. And our waiting time is hardly anything at all. So I didn't know what to expect, but I turned up, I think it's December the 19th, it's a Christmas tree there, and just sat in the waiting room in the evening. I thought I'd follow several patients and it'd be pretty straightforward. So and I've got permission to use these slides and the names, and there's a lady in the corner and a young daughter, and I was shadowing the young girl, and her mother was concerned that she had a urinary tract infection, and they'd seen the GP, and they'd lost the urine sample. And basically, she was coming to us because she was concerned that maybe her daughter wasn't on the right antibiotic, and maybe the infection was still there, and she just wanted to test the urine. That's the only reason she came to the emergency department. She couldn't get back to her GP. She couldn't get an appointment, so she came to see us. And we sat there and had a conversation. It seemed to be fine, but time kept passing, and it started getting later, and they were told, we'll be with you soon, whatever that means. And I was thinking, well, I'm sure they will be with you soon, because we don't have a waiting time in our department. It's not that busy. And an hour passed, and 2 hours passed, and they kept told, you'll be there soon. And we could see through the door every now and then that it didn't seem that busy. And then other people would turn up with injuries, and I knew that they were being seen by the adult emergency department team. And they just walked straight in, and we were thinking, what? We've been waiting in 2 hours. What's going on? Well, how can they go through, even though I knew that it was a different team who would be seeing them? So the young girl then started getting quite tired. She was enjoying the toys and her experience. After 2.5 hours, she started getting tired to get to her bedtime. At this time, I noted the gentleman in the middle of the picture there, Dean, and he'd been waiting patiently with his young son, although his patient started going. And he was trying to use his phone and he couldn't get a signal. It's really difficult to get a signal on the phone there. And I could sense his frustration. It was leaking out big time. And he made a comment that he wished we had Wi-Fi. So if you could go to the next slide, please. Now, in the back of my mind, I was aware that the hospital had Wi-Fi. It had quite a complex system for Wi-Fi. For the staff, you could go in the morning and you go on the website and you had to go to a certain web page on the internet and find the code and type this into your phone. And it's a really long code with numbers and capital letters and small letters. And every time you left a room or part of the hospital, you'd have to retype the whole complex code in again. So it was really frustrating, but it did exist, which was quite nice. In the back of my mind, I thought, wouldn't it be great if we could press a button and make this available to patients? Because, you know, it's no cost. It's a potent symbol that we are being different, and there's a, you know, George Eliot is behaving differently, and it's with the modern era. So I suggested to Dean, as he spontaneously made this comment that he wished there was Wi-Fi, I made a video of it, and I put a link on the chat box, so you can click on that if you like. And it tells the whole of our story. So he made a video asking for Wi-Fi. So I thought, right, I'll take this to the chief exec and see what he says. So I went to my chief exec, Kevin McGee, and I was quite surprised. He embraced the idea. He said, yeah, let's do it. And I thought that's pretty cool. But with engagement, it's okay for someone to say yes, but it's all about, does anything happen? Because often people above us say, yeah, okay, we'll do that, and then nothing ever happens. The next thing I knew, I got an email from the head of IT saying, oh no, it doesn't quite work like that. It's really complicated. We don't have a firewall at the moment. It will cost £50,000. It'll take weeks to do. This is never going to happen. I'll work through it in my own time. About 2 minutes later, Kevin McGee, chief exec, fired an email back saying, just do it. And I felt really, really empowered and valued, and that's a beautiful example of how to engage your staff. So Kevin McGee had said, we want to do this for NHS Change Day. I think this must have been around January time. And what they actually had to do, because the existing Wi-Fi had its limitations, we went out and procured a whole new system. So they had to go around the country, find out who else was doing this, and got a whole new system. Really remarkable. So next slide, please. So here's Kevin making his pledge just before Change Day to deliver free Wi-Fi to patients and staff. Now, we went flat out. We had to procure a whole new system, so we weren't able to do it on the 3rd of March, but it went live on the 5th of March. It works now. It is an amazing system. You have to put a password in. Well, you don't even have to put a password in. You put your name, your email, and click log on, and the rest is automatic for the rest of your time in the hospital. You can keep going there every week, and it's all automatic. So it's a fabulous system. So thank you, Kevin. It's brilliant. Next slide, please. So following this, those of you on Twitter may remember that Helen and Roy Lilly and John Popham and a couple of others were talking the next day, and the conversation was all about, you know, Wi-Fi is a fundamental human right, and we, you know, wouldn't it be great if all hospitals had free Wi-Fi? So I put the link to John Popham's website, where he's got a campaign trying to get more organisations interested in this. And if you listen to the video from Dean Yardley, he's saying it's really important to have Wi-Fi. It helps the kids when they're bored play their games, but equally it enables family to communicate with their friends and their relatives, and you know, it's actually a valuable resource. And also the staff use it. So I think that in this social era, having free Wi-Fi has immense benefits. Can I have the next slide, please? Just want to come on briefly to the 6 C's are for everyone. The 6 C's, as many will know, is a campaign started by Jane Cummings, Chief Nursing Officer for NHS England. It's been going for a couple of years, and it's based on the concept of the NHS, the Olympic Games makers, about volunteering to come back to core values that unite us all. So I was at a meeting today. So I'm one of the caremakers. I'm one of about 4 or 5 doctors who are NHS caremakers. There's about 1,000 nurses and about 5 doctors. And I'm a champion for this campaign, which I think has immense value. So it's about, so Bruce Keogh and Jane Cummings today were talking about, you know, compassionate care is so important, and the other 4 values there underpin it. So I'm hoping that through the work of NHS Change Day, through shadowing patients, through, in a talk I gave earlier today, I was talking about 30 seconds compassion. We can all do this, and I think Maxine's going to tell us some more fabulous tools that they're using in their trust, which I'm trying to bring into George Eliot as well. I think that this has immense benefits for staff, for patients, and for the NHS as a whole. So, final slide, please. So, the shadowing, for me, opened a great perspective. Following the shadowing, a number of people in my department are shadowing. So I've gone on to shadow nurses. I've had people from the Health Service Journal shadow me. Michelle Mello from NHS England is going to shadow me. We've got managers shadowing staff, and our local manager is also, last week, she just went through her diary so that everyone knew the incredible amount of work that she does each day. It was a real eye-opener. I think that inviting patients to become partners in our work as we improve the service is essential and makes a real difference. A cheeky challenge to Helen and the team is, what do you think about starting a free Wi-Fi campaign for the NHS? And I hope that all those listening and all those who support NHS Change Day will become caremakers, because the caremaker network is like having Change Day every day. Thank you.
Thank you so much, Sebastian. My goodness me, it was a narrative, it was a story, it was you know, a kind of patient-centered success story, and it was a challenge and a call to action for the future. So thank you so much. So what I want us to do now, I want us to listen to Maxine, and then Sebastian, I'm going to get you to come back and comment on Maxine's presentation. I'm going to get Maxine to do the same for you. Is that okay? Brilliant. Okay, so Maxine, can you hear us?
Yes, I can hear you.
And you sound fantastic. So Maxine, the virtual floor is yours.
All right, thank you very much. Good evening, everybody. Could you put the first slide up, please? It's nice to be with everybody. I'm in a rather miserable, rainy, wet northeast, but the northeast is always beautiful as well, even when it's wet and rainy. So it's good to be with you all this evening. My contribution this evening is to tell you about some work that we've got going on here in the northeast, which is about looking at compassion. And this little tag that we've got in front of us now, I think before I started this work, it was just this whole idea of the 6 C's seemed to be coming at everybody. And there was a lot of dialogue in my organisation that it was just something else that had to be done. And I thought about compassion, and I've changed my opinion actually about compassion in the last year while I've been doing this work. But I think this has become a bit of a strapline for me, this little tag here, that it's not good enough just to be compassionate and to think you're a compassionate person. You've got to do something about it. So I suppose my pledge was about doing something about it. Next slide, please. I met Andy Bradley from Frameworks for Change. Quite, you know, it was a chance meeting, and he was working up in the northeast, and via Twitter invited me to meet with him for an evening, just to understand the work that Frameworks for Change were doing around this work. And I've just realised there's a spelling mistake on that slide, so I apologise for that. And Andy, myself and our Chief Executive, Tricia Hart, went up to meet Andy, and Andy asked us a couple of days before, would we mind, rather than just meeting with him to discuss the work that we wanted to do at South Tees, if we experienced a compassion circle with other people from the North East. And we just put ourselves in Andy's hands, really, and we've always found Andy to be genuine, honest and inspiring in terms of the work he's helped us with across the organisation. So we tipped up to the northeast, the top end of the northeast, and we just had a fantastic hour and a half just thinking about compassion. And in that hour and a half, both myself and Tricia Hart realised that we had to somehow take this work quickly back into the organisation, because we realised that our organisation needed this work. So I thought I would tell you a little bit about what we've learned from that. So next slide, please. This slide is just here to say Andy and Framework for Change methodology is all about compassion circles, and a lot of people ask me, and Sebastian asked me when we met recently, just tell me about it, what do you do? And I think the circles, I'd already begun to do some work on circles across the NHS, and circles have become really important to me in terms of methodology and a way of sitting together with people equally, listening. Everybody's sitting at the same level, nobody's more important, and just learning to listen and be with people. And when you look at the history and the sort of research around circles, it goes back many, many thousands of years. Human beings have always sat in circles. And Framework for Change methodology provides you with a simple but structured approach to sitting together in circles, creating space for people to think about compassion, compassion for themselves, compassion for others, and then for me particularly in our organisation, we've strengthened the work on what does all of this mean in terms of compassion in our organisation. But I can't emphasise more strongly that at the heart of this is the notion of compassion for self. You cannot be compassionate if you're not looking after yourself and being compassionate for yourself. So what have I learned through the pledge that I did? And I'll speak a little bit about the pledge and show you some slides of the people that have got involved. I've learned that people struggle with this stuff. If you invite people to a compassion circle, people struggle. They don't know what they're coming to. They feel quite anxious sometimes. I've had lots of comments about all this fluffy stuff. We haven't got time. We've got patients to look after. And what I've learned is when they've been, they say, wow, when are we doing it again? So I think there's something about how we talk about this in organisations and help people experience looking after themselves in organisations in order that we can look after our patients and the public we serve. I've learned that the words are really important. And what we call these things are really important. We've started talking about compassion conversations. That seems to help for some people. Some people, I just ask them if they'd like to come and sit and chat about kindness and compassion in their area. We use the same methodology. So I think there is something about how we introduce this into organisations. And I've learned that a lot of staff are worried and are quite cynical now about compassion, that it's becoming a target and something that there's tick lists about. So there's lots of negative debate about compassion when I move around the country, as well as the positive debate. So there are polarised groups around compassion. So I think before I move on to the next slide, just to re-emphasise here, this approach to sitting together well, listening, sitting equally together, is about compassion for ourselves so that we can generate more compassion in our organisations so our patients get better care. Next slide, please. I think my biggest learning has been that in the part of the NHS that I work in, which predominantly is an acute and integrated organisation, people want the science of compassion. People will come to something and sit with you and participate in a circle if we start by introducing the compassion of science. So that's my starting point now in most of the places I go. And Paul Gilbert's work has been sort of inspirational and seminal for me. Next slide, please. In terms of helping people understand the three regulatory systems that help us manage our emotions. So I would advocate that anybody who's thinking about replicating this work start with the science, because it seems to make it go in easy when you get over some of the barriers. Next slide, please. we decided on Change Day that I would step out of my comfort zone. I'd done some compassion circle work in the organisation, but we said we would offer an NHS compassion circle to anybody in Middlesbrough, and we paired up with a family-run business called the Cairo Group in Middlesbrough, and the chief exec is on that slide. And we ended up with a really interesting group. In that slide that you see, there are NHS staff, there's a solicitor, there's a policeman, there's an occupational therapist, there's 2 people with neurodisabilities, one guy with a head injury, came off a motorbike and has recovered and is now working back as an engineer. There's a couple of therapists there and a service improvement lead from the Cairo Group. And it was really quite scary, I've got to say, because I was used to standing and working and sitting in a circle with NHS staff, and all of a sudden I've got these people I've never met before, and what I learned was we're all human beings. And actually this methodology, this method of sitting collectively together, all at the same height, all in the same space, listening well to each other and working through this very simple but structured approach, unites people. So that was one of the compassion circles on Change Day. Next slide, please. This learn and spread far and wide. This is Ronnie Kettle. Ronnie Kettle is an inspirational young leader in the NHS in the North East. He works at Northumberland, Tyne and Wear NHS Trust. He joined Twitter as part of the work that we'd been doing. He was an apprentice, a modern apprentice, working with the organisation development team in this organisation, and he joined a network I was involved in and got interested in compassion circles, and we've been able to teach this young, bright, enthusiastic star of our future to actually spread the learning. Next slide, please. This is my final slide, and this is one of the latest groups. It's another piece of work we're really proud about at South Tees. These are a group of what we call therapeutic care volunteers, and we have over 200 therapeutic care volunteers, and they came to us and said, we've heard about these compassion circles, can you help us learn about them too? And we sat with these people, and you can see they range in age, they range in background, and they're just inspirational people that bring so much to our NHS. So that's the next step of my spread in terms of compassion circles. So I think for me, my pledge was about stepping outside of my usual boundaries and looking at, if I'm going to act myself into compassion, it's no good just doing what I do every day, which is trying to be compassionate, trying to work compassionately with the people I work with and bring compassion interventions into the trust. It's got to be about spreading this around the North East, and I'm glad I've done it. Because we've had a ball while we have been doing it. I think we've learnt a lot. So I hope that's useful for you all.
Oh, thank you, Maxine, so much. And you know, people kind of talk about compassion, but I think the way that you're really reflecting on what it means, and I think working in such a kind of personal, value-driven way, I think is a model to us all. So what I said I'd do now is I'd get Sebastian to comment on what Maxine said and Maxine to comment on Sebastian. So can we do that next? And the other thing is, if anybody would like to ask any questions of Sebastian or Maxine, can you put your virtual hand up? So let's let Maxine get her breath. So Sebastian, your reflection on what Maxine said.
I think Maxine already knows that I'm a huge fan of this, and I'm keen to implement compassion circles in George Eliot. I have been told that I should stick with my other project I've got at the moment, because I've just started a version of Schwartz rounds, which we're calling reflective spaces, and we just did the second one this week. So I might mention that later, but I'm very keen on compassion circles. So the question I've got is, Maxine said compassion's not enough and we need to act. I've had several conversations with people this week who are under an immense amount of pressure and at risk of burnout. So I'm keen to learn a little bit more about what compassion for self is, because I think many of us are driven to do this work and we're passionate, and we don't recognize the signals until almost too late that we're overwhelmed. So what is compassion for self, and what is the action around compassion for self?
I think what I've learned, Sebastian, is that actually asking the question, which is embedded in that methodology, what have you done in the past period, whether it's a week or a month, in which you have been caring for yourself. The first time you run a compassion circle, if you're running it with a group that run it over time rather than just a one-off, what these people say is they struggle with that question the first time because we don't ask each other that question. We don't stop and think, what am I doing to look after myself? What am I doing to care for myself? It's not just looking after myself, it's actually caring for myself, being kind and compassionate to me. What I've learned with the groups I'm running that meet every 4 to 6 weeks is the longer they meet, the more interesting their conversation is about that question, and the more they focus on that outside, both inside and outside of work. So simple examples would be people start to talk about, I now go for my lunch even if it's 20 minutes. I go for a walk outside. I bring a book to work. People talk about going for a walk in the park. They're very simple things, and people reflect on that as well. That actually, it's quite easy when you're mindful about the need to be kind to yourself. But we don't keep that at the front of our mind in these busy days where lots of people feel that they're on the edge of burnout.
Yeah, I think great points you're making there.
That's a great answer. Thank you. I think that's really clear and helpful. And what comes across so powerful is that it's so simple and it doesn't cost anything. And as many of you know, I've been using Fitbit for the last year, and I now walk more and eat less. And what's happened is many people around me are starting to do similarly. So in the department, several people have got Fitbits, several people are, it's just infectious that people are starting to eat a bit less and walk more. So I can imagine that as it becomes acceptable to, start looking after yourself in the same way that it's acceptable for everyone not to have a lunch break and everyone to stay late, I think that, the positivity that comes from that is brilliant.
Yeah, great. No, thank you both. And nobody's got their hand up at the moment, but I'm noticing that Robin, who is an attendee, Robin Saru, you've got a hand, which is an applause hand. So I just wondered, Robin, whether you wanted to be unmuted and to ask anything. See if we can unmute Robin.
Hi, yeah, I've been doing a bit of work with compassion and appreciation back here in Staffordshire and Stoke-on-Trent, and I particularly thought that was interesting, looking at the 3 circles and the model around compassion, because when staff are stressed, they can't really be creative, and it's that creative and that energy that we need in order to get change going. So I just wondered how that's feeding into getting change going where you're at with the compassion circles.
I come from an organisation, I'm really lucky that we have high levels of innovation, and we've got, like most of the NHS, let's celebrate the fact that it's the 66th birthday tomorrow. And I come from an organisation with 9,000 fantastic staff, and we've spent a lot of time over the last 20 years on innovation and change management. And actually we have the reverse problem. We have the problem that people take on such a lot of small projects and individual things that they want to do, that's the thing that gets in the way of their self-care. So people discretionary effort is so huge in the organisation, sometimes to their detriment. So we've had to spend a lot of time talking that through as well, which may sound sort of a perverse incentive really, but it is about balance and it's about well-being for us. So we've never had the problem of people not wanting to innovate. We have, in most of our areas, not all, but in most of our areas, we have the reverse.
That's fascinating. Thank you.
Yeah, great. Well, great session. Do you know, we haven't been in the last couple of speakers. We haven't done applause, but I think we should do that. So, for those of you that are new, if you look along the bar, you can see where you've got your electronic hand. Next to it is it's like a feedback button with a tick, and if you click on that, it'll give you some things to some options. So if you go onto the applause and applause our speakers, Sebastian and Maxine, that would be great. Do you know what I love about this? I mean, we've been keeping going with this since 8 AM, and you know, just to kind of hear these stories. I tell you, it's so energising, and you know, we could just keep going all night really. Well, probably not, but it just feels like it at the moment. So thank you so much. So just before we are due to go into our other session, I just wanted to ask our Twitter and chat monitor, who's Kathy, to just give us some feedback on, you know, how are we doing, what's happening on Twitter with regard to our hashtag, and what are we hearing? What are we hearing in the chat box?
Thanks, Helen.
Yeah, I can hear you. I can hear you.
Okay, we're hearing lots of positivity on Twitter. Interested in the compassion circles. There was lots of interest earlier on today in the conversations about the importance of maintaining mental health in all NHS staff and the wider population. And also interest in Sebastian's free Wi-Fi for staff and hospital patients. So there's a lot of positivity out there and a lot of people interested in what we're saying.
Fantastic. Thank you. And so we're now into our last 40 minutes, and we've actually now got our very last speakers session, and we've got Pollyanna Jones from King's College Hospital, and we've got Shahid Sadar from the Princess Alexandra Hospital, and we've still got 27 participants, the stalwarts, still going. So, do you know what I'd love us to do? I'd love to make this like a really interactive session, just to show how you know, how the kind of momentum's gone, and we've got two really great speakers here. So the first speaker, Pollyanna, has been the sort of the leader and the backbone of the hubby movements and Change Day that we've heard about quite a lot today. So if we can get Pollyanna on camera. Can you hear me, Pollyanna?
I don't have a camera. Sorry.
Okay, so we'll just do this verbally. So what we agreed was that I would interview Pollyanna, because I particularly want to ask Pollyanna about the history of the hubbies. So Pollyanna, yeah, tell us about the hubbies. Tell us like where the idea came from, how it started, and you know, how the hubbies came about.
Okay, so in the first year of Change Day, we came together as a group, and we learned so much about how to make a change and how to make a difference. But and for the second year, we really wanted to spread that learning and teach other people how to do it. And also, we realised in the first year that Change Day will never be successful unless you always have new people doing it. So we wanted to have some new people spreading the message. And luckily, through gathering some people from the first year and then meeting some other colleagues, we found some really excited people who wanted to make a difference and get involved and spread the message of Change Day, and that's really how Change Day came about.
Fantastic. So you know, how did the hubbies work? How were they structured?
Okay, so the hubbies are structured in a really non-hierarchical way. We have key people looking after every region, and they have colleagues who work with them in that region to develop what the hubbies
what they need to do and do the outreach work. They meet and direct what change they will do, as well as what they do in the season, and they teach each other lessons about how to do that. Their main working is through WhatsApp, 1 or 2 meetings a year, and then a weekly drop-in phone call. They also get coaching from people like me and Jeremy, who in turn get coaching from people like you, Helen, and Jackie on what to do and how to make change work.
So who are they? I mean, who's a typical hubby?
So a typical hubby is someone who leads care on the front line. They could be a manager, quite a lot of graduate trainees, a nurse or a doctor, any level. Anyone can be a hubby, and I think when we came together we realised that we were probably the most diverse junior group in the NHS to ever achieve a change. We had people from cleaners, junior doctors, consultants, nurses, healthcare assistants, we were mental health, we had a counsellor, someone from the council, we had a patient, and we had someone from every walk of life, and that's what made it so exciting, and we all connected on our shared purpose and helped each other have the motivation to make a difference.
Fantastic. So, you know, we talk a lot in the kind of change and innovation world about the importance of diversity, and, you know, not just diversity in a kind of human resources, making sure that our workforce represents the local community way, which we think is really, really important, but diversity around the sense that if we want to get new insights and we want to get innovation, we need to work with really diverse groups of people. So what's your experience of that with the hubbies and just the sheer diversity of people that you have?
Well, I think it's massive diversity, and it's really being positive. It means that we can make sure change reaches everybody, and we can work with each other to think about how we can best tell different people and get different people involved and help different people connect up with change in a variety of ways. The diversity is massive, from people who not even started their careers and they're volunteering in the NHS before university, to people who've qualified as consultants and really senior in the system working together. You need both sides. You need the junior people to fresh ideas, but also the senior people to listen to them to help them make the connections in the system to deliver the change they want.
So you know, something I want to ask you. So, I mean, the hubbies were amazing. I mean, they were so energized and made things happen. How do the hubbies manage the very difficult path or balance between doing their hubby work voluntarily and doing day jobs?
I think that's been the hardest part about being a hubby. But and there's been different strategies. Some hubbies have been lucky enough that they've taken what they do in their day job and then added to it with change days. So Molly, for example, launched Change Day really largely in her trust, and Lydia with her paired learning work. Some of the hubbies have had to use annual leave, but most of the hubbies have done their work in evening and weekends. All of the tools are after working hours, and the passion and energy has just been that they've managed to have that time. It doesn't take a lot of time to be a hubby. Different pressures at different times, but it's a real personal development opportunity, and the training and the learning that I've got from being a hubby has been so much bigger than any other thing I've done in my career. And I know I'm young in my career, but I've gone through the graduate scheme and lots of other leadership development programs, but this is where I've really managed to learn how to make a difference.
So I think it's fantastic. And, you know, what strikes me, when I look at the hubbies and the way in which that very talented, dynamic group of people are prepared to be volunteers and to spend their own time because they're passionate. I mean, how could we ignite that kind of passion and spirit of volunteerism across the NHS, you know, on a much bigger scale?
So I think it's about growing the group. I think it's about getting people who've done it and teaching other people how to spread that message. And how many people can we get to be hubbies? You can tell someone else, you can tell someone else. The teaching around a hubby is about you learn your shared narrative about the shared purpose and how to connect with other people. And then the first thing you go and do is teach that to somebody else. This is about passing on a domino effect, and I think that's what will make it big. I think further down the line, we do need to think about how people interact, and millennials really interact well through social media. So it's just about recognising that how they can relate through social media and then inspiring different passion ideas. Not everyone who's a hubby has an idea of, I want to change dementia, or I want to change this, but they all want to make the NHS a better place.
Yeah.
And they all have the time and motivation to do that, which is really important.
Yeah, no, I can see that. And, you know, we're a small, discrete group that are left on this WebEx now, but there's some pretty senior clinical and managerial leaders that are listening in to our conversation. So how can we take the spirit of the hubby, in terms of the way that you and colleagues have been able to unleash the passion? Okay, how can the leaders that are on the call here, how can they create the kind of spirit of the hubby in their own organisation? What is it that we can do that isn't just hubbies, but it's lots of other people, being as committed as the hubbies are, but in a local area for their own work? How can other leaders create that spirit in their own localities?
I think you need to find a few people at first in your hospital who've got those values and that passion, and then enable them to connect with other people along that line. Just give them a couple of key points of permission. So tell them they can go and do it. Give them some space and freedom to do it and some coaching on it, and then just step back. And when they get a bit stuck and they come to you, they'll come to you with the questions. They'll say, oh, we need some more people, or can you help us connect with this and that? And it's about having that light touch and not setting too much direction, but being there when they need the support. So it's offering the coaching. And I think the main thing a leader can do is teaching that person how to tell a story, and teaching them how to tell a story in a way that can affect change. And then also showing them how the organisation works. There's the politics and there's the barriers. These hubbies aren't aware, which is amazing. But if a leader can just demonstrate and help them go through where those little bits can be a bit challenging, that's really useful.
Yeah, brilliant. No, I think that's so. There's so much wisdom in that. So, you and I have been part of conversations, Pollyanna, about Change Day 2015, and part of the conversation that we've had was, we learned a lot in year one of Change Day 2013, and we learned a heck of a lot more in year two, and now we're thinking about year three. So in a sense, what we can't do is just take the existing system and scale it up even bigger. We've got to think about it in different ways. So tell us what you're thinking about, or what the hubbies are thinking about in terms of where this might go in 2015.
Okay, so there's lots of ideas for 2015. I think on the hubbies model, what they're looking to do is expand the model, but do some really good training for people. They want to have different kinds of hubbies to support people in different ways. So we're going to have a campaign hubby where we really take the learning from being hubbies and teach people how to create campaigns about the NHS. You heard from Andy earlier, who's going to be a dementia campaign hubby. Lydia's going to take paired learning around the system and trying to use those methods. Then we're going to have more regional hubbies like we did last year, but maybe a campaign in each region. Some hubbies have really done a good job on a speech structure, so they're going to spread about that. And basically, try and get as many as possible to spread that message and connect up. I think the other thing that hubbies really want to learn about this year and what they want to do is take some of those pages that people have faced and maybe had a bit of trouble delivering, and then help them learn about service improvement in their organisation and some more of the practical building blocks. Because as managers and people in the NHS, you learn a lot about leadership, but it's quite challenging sometimes to learn about the building blocks of the improvement and how do you actually practically do it, because it's so different in every organisation. So take people along that course as well. And I think a lot of it's about training and development and coaching. But it's an organic idea, and with Change Day, it needs to flow from the hubbies and from the new people who join in to what we do for strategy, and I think that's what will build up over time. I think what will be really exciting about Change Day next year is that we're going to have the hubby movement and all these campaigns hopefully really going around, celebrating the NHS for what it gives to us and trying to make it a better place, and connecting the senior and junior leaders together again. And I think all of that together is just going to make such an exciting 2015.
Yeah, brilliant. So, earlier on today, we talked about, some of the issues around, talked about the School for Health and Care Radicals, and about how there was such a big issue around people not feeling able to make change happen, and needing permission to even create very small changes. And yet when I see the way you operate and some of the other hubbies operate, and just the sheer confidence that you work with, it's like a different world. Okay, so what is it? I mean, what's the magic that makes hubbies be able to operate so so much more confidently than many other people in the NHS that are like them?
I think they support each other, but they're all from different old school tribes. So through that, they have a good understanding of what they're doing and a good self-awareness and political awareness that helps them do that. They get really good coaching and support. Yeah. So they know if there's a problem, there's someone there to talk to, the senior leader, and the working between junior and senior leaders in here is really important. Junior people, we've heard through the hubbies, have so many great ideas and patterns, but they still do need some senior support, some coaching to get that to work. Yeah. And I think also, like, the confidence comes from the fact that we've really connected with our shared values. I come to work every day, not because I want to get paid and not because of my job title. I come because I want to make a difference to patients, and that's what I want to spend my life doing and dedicated to it. All of the hubbies are the same. They're not, I'm a nurse, I'm a doctor, I'm this, I'm that. They're people who are in the NHS because they want to change it for patients, and they've got a vision and they've got a dream. They're the healthiest country in the world, and they want to see the best health system and the most interactive health system because they're proud of the NHS and they're proud of England and they're proud of the work that everyone does together, patients and staff, to deliver excellent healthcare.
I love it, honestly. So I've got time for one more question. And so, you know what, because I said I'd interview you now. So this is like probably like a really mean question for 1933 at night. But anyway, so what my question is what did you hope I was going to ask you in our little interview that I didn't ask you that you'd like to say?
Right, I hope that you would ask me to ask you some questions as a power balance.
Go on then.
So I would like to ask you what you think that the hubby should be doing next year to make Change Day even better.
Okay, so I think that's very good, by the way, clever. So I think that we need to kind of carry on with the spirit of the hubby. I really agree with what you're saying about the campaign hubby and the regional hubbies. I think that it's always the same. It's like any organisation or system or movement that as it gets bigger and it needs to, you know, like organise better, we start putting there's a risk that we start putting control mechanisms in. So, which is the wrong thing to do. Like, how do we get the balance between, you know, organisation and emergence? So, you know, I think we need to think about how, you know, what are the things that maybe need to be more structural, like, you know, the training and the support, but without losing the spirit of the hubby, so that things can be done on a much bigger scale.
Okay, and how do you think we can do that?
By having lots of conversations and doing it on a kind of commitment-based approach, where we talk to all the hubbies together and work out what the right thing to do is, rather than like saying, well, this is the new hubby training program and the hubby induction, and it's kind of, you know, that it's worked on a basis of like commitment and people being able to contribute to it and feeling very real.
Oh, well, thank you, Helen, and sorry for bringing you.
I know, that was mean. I was mean to you, and then you were mean back, so it's cool. Touché. Yeah, I know. No, that was good. I'm glad we did that. And I think, you know, Pollyanna and the hubbies, you should be so proud. And I think that you know, what you've achieved and what you're doing isn't just about hubbies, what they achieve, but also it's such a great model for health and care in terms of, you know, that amazing kind of passion and energy that's there, and how we unleash that. And I think so many of us can learn greatly from you and the hubbies. So well done.
Thank you.
Great. So stay there because we're going to still do some Q&A. And what I want to do now is I want to hand over to Shahid. And
hello.
Hi Shahid. Hi. Can we see you on a camera?
Oh, I wish we could, but it's not, there isn't one.
Oh, don't worry. Don't worry. So I'll just introduce you again, Shahid. So Shahid Sardar is Head of Patient Engagement, Patient Safety and Quality. That's a very long job title. From the Princess Alexandra Hospital, NHS Trust. Yeah, and okay, well that's well you can make sure I get it. You can correct me.
Correct it. No, I'm not interested in doing that. Okay,
I
so
don't mind. I want to get it right. You're going to talk to us about the campaign for achieving excellence for patients and staff, and how you gain support for your campaign. So so great to hear from you.
Okay, thanks, Helen. It's amazing to see so many people on the WebEx this late in the evening on a Friday afternoon, and I was just looking through the list, and there's so many people who I kind of recognize, and I think, oh my God, you know, these people know a lot more than I do. I'm looking at Jackie Linton's on there, Mina, Addie, Pollyanna, Helen, Kathy, and I can see in the attendees Arsha, Claire, Jill, Edmar, Jill Phillips, Pip Hardy, Anna, Maria, Robin Cesaro, Jeremy Tong, Emma Donaldson, Temptation Chigova, Alex Silverstein, Helen Sanderson, John Franks, and Sebastian. And I think it's just amazing because, like, you know, there is a passion out there clearly for quality improvement and transformation and bringing that kind of idea of change and really, really picking it up and making it real, even on a Friday evening like this, which is just fantastic. So I was just going to talk about Princess Alexandra, who, I don't know, many of you probably have never heard of Princess Alexandra Hospital, but is a cute little hospital nestling in the kind of corner of Essex, in beautiful green Harlow. And I want to talk about what we've been doing to try and bring the kind of the passion for quality improvement, which I see every day, and I see in kind of discussions which we've just been hearing. And I've got a slightly cheeky presentation title, which I've called From Change Day Place to Social Movement in 3 Easy Steps, which, of course, is not 3 easy steps. It's a hard, long road. But we've done our best to try and move our organization from a place where we thought, you know, nobody's really that interested in quality improvement, nobody's interested in change, to really champions everywhere. And I'll give you a quick example. Like the other day, we had our head of nursing in emergency department. She's a tough cookie, and if she's listening, she'd be laughing, I think. But she said to me, I'm just loving presenting this new plan which we've got for the multi-professional framework, which came out of change, the change work that we've been doing. And it just made my day, because I thought, she gets it. Wow, amazing. So if you go to the next slide, one of the things that we do at every induction is ask this slightly insane-looking question. Now, usually the whole room kind of looks at me as if I've just landed from the moon, and I probably have, so they're not wrong there. But what we're trying to get them to do, and I'm aware that this is Friday evening, so energizing everyone at a time like this is going to be difficult, but we're trying to get that energy and passion into the room. Usually we present this on a Monday morning, and they are usually fiery and quite brimming and sparky and kind of awake and kind of thinking, okay, I know how to answer this question, because they've just arrived and we're trying to introduce them to the trust. What we're essentially trying to do with that question is reconnect them with purpose. And amazingly, and I think it's testament and tribute to the people who I work with, they come back with answers like, it's reminded me about why I came to work for the NHS in the first place. And that's humbling to hear, because when we present some of the ideas which I'm going to present to you now, they're not very complicated. And I think what you've all probably heard earlier on throughout today is actually the ideas are not particularly complicated. It's about presenting them and about really going out there with a passion and saying, I believe we can do this, and we're going to do this together, and you're coming with me, as it were. And so I think that is a lot of the battle. And Helen, I've remembered so many of your presentations of you now. I'm going to have to make you cringe slightly, because one of the things I always read from some of the material you present is it's about getting the emotional impact. And that emotional impact is what we're always seeking. So going on to the next slide. What we try to remind people of is that actually, I don't think that's the next slide, but if you try again, we try to remind people of the fact that everyone has a story. We all have our own reasons why we've come into the NHS, and some of them can be very personal. Some of them are about lifelong ambition. Some of them are when I was a little wee lad or a wee girl, I would nurse my little sisters and brothers, or I would doctor, or I don't think anybody ever says I would be a manager, do they? But they say all those other things. And what we try to do is get people to reconnect with that thought. And what all of this has led to is what I describe as a multi-professional values, standards, and behaviors framework. And I'll tell you a little bit more about that further on in the slides. But it is about cutting across all of these silos in which many of us work, where individual professional frameworks, which we all sign up to and believe in, often end up doing the opposite of what we think they're intended to do, and people begin to defend their territory rather than looking across. And that's kind of, I think, one of the historic challenges of the NHS has been to cut across those boundaries. And we think we're beginning to do that with some of this work that we're describing. So if you go to the next slide, I can't really, if you click on again, I can't really, oh no, I think you have to click twice. I can't really present. Okay, we can't really present with all integrity without saying what our own backgrounds are. And so I began in mental health advocacy, and that was about seeing a group of people, which I think even now we can learn a huge amount from. The mental health user movement is, I think, one of the last great kind of struggles in terms of civil rights in our country, and their passion and ability to kind of own the issues which they have and go out there and kind of just grasp the bull by the horns and say, we're not going to take this. This is the kind of change we want. Let's see it in the law, in policy, and in reality, and in the relationships which we have with our healthcare providers. That's what really inspired me personally to kind of begin work in the patient engagement, patient involvement movement, and I guess why I've ended up in the NHS, because beginning in an organisation called Mind, I decided we've got to take this and actually change. So if you click on about a couple of slides, because I'm aware that we've got a short period of time, and I can see Jackie in the window on the corner. Hello? If you click on. So, and when you read the NHS Constitution, these are some of the sources of material we've used to really kind of create our social movement. Our social movement has come from, over the last year, working with 400 people, staff, patients, carers, families, telling us their stories about where their experiences have not worked. And we have used all of their words verbatim to create our value standards and behaviors framework. So if you click on a slide, another thing which we've really kind of struggled with is one particular group, which are named in this slide. I apologize in advance to any doctors out there, but we've got a very interesting, I think, particular challenge where we've eliminated essentially most of the other challenges in terms of poor quality in our national inpatient survey. One of those things which we use to classically get the metrics about what's happening. But our doctors in particular are one of our big challenges. So one of the reasons we've introduced this cross-cutting multi-professional framework is our doctors. So if you click on a slide, what we've been doing over the last 3 years, and this is our improvement process, is we've been whittling down that red bit of the pie chart to hopefully 0 by this year, but we've cut it in half virtually every year. So we've gone from around 18 to 10 to 5, and next year we're going to be astronomical. We're going to be off the chart. But at the moment, this is where we are. But we've been pushing hard, and this framework, these are the outcomes I think it's giving us. So you click on another slide. We went from 665, something like that, complaints per year. It's another slide forward, to 318 the year just gone. We've virtually halved it. And from our perspective, we think this is the consequences, these are the consequences of that work that we've been doing. If you click on another slide, so a lot of that has been about recognizing, if you click on again, recognizing that actually what motivates that transformation, if you click on one more slide, is not saying we must change and improve, we must do this, we must do that. It is, if you click on one more slide, it is about actually the positive feedback. Now this is a chart showing numbers of compliments we get month on month, and that chart is now off the scale. Like 1 month recently we had 300 compliments in a month, and that for our organization that is amazing, because if you think about the effect that has on our staff and the way they behave as a consequence, that has all come from, we think, this development work that we've been doing with them, in terms of saying, well, actually, it's about you. It's about how we bring in the patient voice and really help that change happen. So if you click on 2 more slides, I'm just trying to race through because I know we've got a short period of time.
We've probably just got a couple more minutes, if that's okay.
Yeah. I've got. Okay. So if you click on again, and I think we should probably go through to slide 18. So if you keep on clicking on until you get to slide 18, I think it is. So we've involved those 400 people in the design of that value standards and behaviors framework. And we've taken it and we've turned it from that framework into something which everyone can sign up to. So if you click on a couple of slides, it'll show you the values and standards framework which we've created. And it tells you, if you step on again, the effect that it's had on people. Like I presented this last week in a group of pharmacists, and the impact it had on them. And I think it is, we don't always necessarily know how we have the impact we have. So I was asking them the question, and because half the room was, people were crying their eyes out after the presentation, and we think it is because simply we have tried to reconnect with that patient voice. So if you click on a couple of slides, it shows you, so this is one of the pieces of, one of the materials we use, and it's from the Cleveland Clinic in the United States, one of the top 4 hospitals in the world. We looked all around the world internationally for evidence and material which we could use in our presentation of our values and standards, and this was one of the most powerful tools. So I'd encourage people to go out there and find it. And it was really interesting because we presented it to a group of pharmacists in the morning at like 8 a.m. and they were all crying. I don't know if that was because it was early in the morning for them. And then we presented it to a group of doctors in the evening at 7 p.m. And it was really funny, the response, or I shouldn't say funny, but one doctor, his initial response was, "That's very impressive." And I think it spoke to the culture of our teams, and that's what we're trying to straddle. But all credit to them, they really engaged with it. This was a group of senior doctors, and they didn't cry, although I wanted them to cry, because I wanted them to get the emotional connection with the story that was being presented. So that's what we've been doing in Princess Alexandra. We think it's impactful. We think it's because we're reconnecting people with that patient voice. If you click on a few slides, it just shows you one of the last things that we do, and it shows the card. So every single person now, we've turned our pledge into something physical. So we've got every single person who signs up to the values in the organisation signing this card. So this is just a picture of my card, and it says, I take responsibility for bringing these values to life in my work. And we think that really, really works. And it's very, very symbolic and almost corny when we do it at the end. But people very, very willingly feel comfortable by the end of our discussion about how the patient voice features to sign up to that. And that's really, what I wanted to talk about in this discussion. So welcome any questions, but I'm aware it's very, very late and you probably all want to go to sleep.
Yeah. No, do you know, I think that that was really, really fantastic, Sardar, and I'm just so happy that we're kind of ending the last presentation, absolutely getting back to the core of why we do what we do. And maybe there's not time, but maybe later on, I just think it's so interesting, in terms of what you're saying compared to what Maxine and Sebastian were saying earlier. And I think it would be really fantastic at some point to, to look at some of these different approaches. And maybe, it's given me some ideas as well around Change Day 2015 and how we might get people together, who are thinking so deeply and effectively about some of these compassion issues.
Yeah. I know it's difficult to put this across, and it's Friday evening, so we're all slightly worn out and kind of like on the edge. But I really, really do believe that at the core of an effective change is that making that emotional connection and enabling people to, themselves recall why they do the job and why they, decide to come into work every morning.
Yeah, and if you compare that, to the hubbies that Pollyanna was talking about, who are a group of people who young, a diverse group with many young leaders who are feeling really connected with their broader purpose and the energy for change that creates. I think that there are some really, really important issues coming through here. And we're running out of time now, and I want us to finish at 8 o'clock after our long 12-hour slog. And I feel really bad because I think there are some people on the call, just looking at who's still with us, who would love to have this conversation. So I think what we should do, we'll just put a rain check on it. But we should make sure that we do have that conversation, and that is part of what we're thinking about in the run-up to Change Day 2015. So can we thank both Pollyanna and Sardar there? Can we do some electronic applauses?
It's Shahid, Helen.
Shahid, sorry.
It's
I know. I've got it the wrong way around. It's on the wrong way around. Sorry, can we thank Pollyanna and Shahid? Because I've got it, it's like the version I've got here, I've written the wrong way around. Sorry.
Don't worry.
Yeah. Anyway, I'm going to applaud. Yeah, lots of applauses and lots of smiles. So we're nearly there now after this crazy 12 hours. And what we just want to do to finish is just talk a little bit about what's next for Change Day. So after Change Day, we had this crazy idea of having a celebration day, and part of the reason was because on Change Day, it was very easy to talk about pledges, and people can pledge. And I think what has been so brilliant about today is just the sheer nature and depth and importance of the kinds of changes that have come as a result of Change Day. So what we just want to do now was to just kind of to finish off and move things on and talk about what's next for Change Day. And there may not be time for kind of everybody to speak, but when I look at who we've got with us still, the stalwarts, there's some fantastic people who are on the call. And what would be great is if you don't speak, can we actually put some things in the chat box so that we end up in a really good place? So yeah, the first thing to say is to thank everybody for joining us today. And we've had quite a few hundred people who've taken part at various times. And the biggest numbers were for when we had the graduation from the School for Health and Care Radicals. But really, you know, through the whole day, there's been very, very good numbers of people and great contributions. And you know, just my reflection for the day is just I don't know, the kind of the importance of the work and the extent to which what people are doing kind of shows the way forward. What I wanted to do is just get a few people to just maybe say a sentence about reflecting from the day. And I particularly wanted to ask colleagues that have been with us all day. So I wanted to ask, you know, the people that have been on since 8 o'clock this morning. So Mina and Paul and Ade and Jackie, you know, having done this crazy thing for an entire 12 hours and eaten chocolate and crisps all day, you know, what's your one sentence reflection on the day? Ade, what's yours? I hear you. Or Mina?
I can't believe that it's actually over. I feel like the time has gone by so quickly, which means it was a good day.
Yeah, fantastic. What about Paul?
Hi there.
Hi, and Ade. Ade, what?
Hello.
Yeah, Ade and Paul, in whatever order. Like, what's your sentence, Paul, in terms of a whole day?
Well, personally, for me, it's really nice to catch up with Ken, who came along with dementia people, because I actually know him for about 20 years ago, because he's the dad of one of the someone I was at school with.
Yeah.
So I know him from before he had dementia. It's nice to see him today and reconnect with him. And because I didn't know that's what he'd come in for, I was reconnecting with him as a normal human being, not as a dementia sufferer. And it kind of reinforced the point he was making about just because you have something, that does not define who you are. Because I approached him as I knew him.
Yeah.
And that wasn't wrong. And that's the point he was making.
Yeah. Great. And
sorry, so I had problems with the audio. Just wanted to say thanks to Shahid's presentation. That was really, really interesting.
It's brilliant.
Particularly, you know, when you think you miss France and Germany, you think that was worth that was worth hanging around for. Particularly, I think what was really good about his presentation was he showed how we upscale from just sort of a small group of people to all across his organisation.
Yeah.
And I think throughout the day we've also just seen lots of interesting ways and things we can learn for 2015. So, yeah, really worth staying up for.
Yeah, brilliant. And I know there's people on the list that have been with us the whole day. I know Alex, you've been with us the whole day. It'd be lovely to hear from you or to just get a comment from you in the box. And other people, you know, that are on the call now, can you just kind of give us a quick reflection at the end of the day? Yeah, Claire's been with us a lot of the day. Jackie. So yeah, it would just be brilliant just to get some reflections. Alex, do you want to say something? Can we unmute Alex?
Hello.
Hi, Alex. Hi.
Hi. Yeah. No. Thank you so much for putting this on. It's been absolutely brilliant. I've just been very inspired the entire day. I work primarily with young volunteers, and so I do have a volunteer background, and I see a lot of similarities. And I think we talked about youth and young people earlier, and I think I'd love to help bring that as much as possible, because I think there are, you know, an army of young people that want to help make a change. And I classify a young leader as any age, but just someone that supports and believes in young people to bring a change. And I think everyone that's been on the call today has been a young leader, in my opinion.
Yeah. Brilliant. And some lovely comments as well. Emma, who's been with us a lot of the day. It's really great to hear from you. And Jill, who's been with us, and Claire. You know, it's been really, really fantastic that you've been here and been part of this. And you know, a few weeks ago, I didn't know whether this was the right thing to do or not, but we had a real sense that, you know, we needed to do more, because, you know, Change Day and pledging's fantastic, but a pledge is only a pledge. And I think that what today has shown more than anything is that you know, that the kind of actions that are happening are just so important and so impactful and so inspiring. So, you know, really, thank you to everybody. The tweets have just been great. And again, I think we'll do Storyfy and we'll follow up. And what we're going to do is, I mean, do you want to say something about this, Mina? You know, just in terms of some of the, we're going to make some short films, aren't we, on a lot of the presentations and make them available?
Yeah, that's our plan. So we hope to download the whole WebEx on Monday or Tuesday and then splice them all into shorter films and put them onto the Change Day website.
Yeah, fantastic. Just some data from 8 AM to 5 PM. We had an average of 50 people at all times, but they were a lot of different people. We had 32 presenters. We streamed five videos, and we had a 5-person tech team behind the scenes that had been running everything from 8 AM to 8 PM. And you know, it was really marvelous. And yeah, here we are at hour 12. So well done and congratulations all. And we have an announcement. Okay, so Change Day 2015 is going to be on the 11th of March. So put that one in your diary and start planning now. And we're gonna call it a day at 20:02.